Hindi ka ma-motivate mag-ano.
Recording in progress.
Good afternoon po. Mag-start po tayo ng NP1 po. Lumalaban pa rin po sa life. Tama yan, Shara, kasi malapit naman na yung board exam. So, konting push na lang. Tapos, registered nurses na. Kayong lahat. Registered nurses na tayo. Good afternoon po. So, we'll be starting mamayang in 3 minutes po. So, alas 10 po tayo mag-start, no? Start po tayo sa my NP1. So, kung gusto niyo pong kumuha ng snacks or drinks, you can get some na po para tuloy-tuloy yung time mamaya. Indeed. Manifest lang na manifest, guys. Manifest na may kasamang hard work and dedication and perseverance. And of course, confidence. Important yun, guys. Tiwala sa sarili. Kumain na ba lahat? Or diet ba tayo? Diet ba tayo kagaya ko? Uy! Ay, sorry. Sorry. Hindi na ako nabusog. Parang iba yata yan. Guys, malinaw ba yung audio? Or naglalag ba? Or choppy ba? Thank you, Mr. Marzon. Paraon. Salamat po. If ever guys na nagcha-choppy yung audio ko or naglalag yung presentation or yung um, camera, sabihin nyo na sa chat na para mabasa ko agad. Good afternoon, Miss Maya. For the live pala ito. Ipa-screenshot na lang po, SS. Okay, so since malapit nang mag-2 in 1 minute, good afternoon everyone. And good afternoon na rin sa mga papasok pa lang. So, just a quick introduction. I'm David Audrey Hidalgo Delay. I graduated last year and also took the board examinations last year. And hindi ko alam kung paano, pero I did pass. So here I am, and I will be teaching NP 1 to NP 3.5, yung first half, or kalahati ng NP3 sa inyo. No? Good afternoon po, Miss Sophia. Ayan. Ready na ba sila, guys? Ready na tayo mag-start? Kasi hanggang alas 8 tayo mamaya. Parang late night talks pala ito. What recalls po? Recalls 8 po. This is the rationalizationism of recalls 8. NPs 1 to 3.5. Yan. Okay, so mag-start na tayo, no? Okay lang ba? Okay lang ba? Start na tayo. Para matapos tayo by 8, tapos makapagpahinga. Yes, sir. Okay, so start na tayo sa may rationalizationism ng ating recalls 8. Recalls 8 and P's 1 to 5. Okay, so konting icebreaker. Kaya nyo ba? Rationalizationism, 10 beses nang walang hingahan. Kung sino may kaya tatasahan natin ng lapis mga 20 pieces, tapos pwede natin ibenta ng 30 pesos isa. Kaya ba natin? Rationalization is 10 beses walang hingahan. Diba? Nursing entrepreneurship. Gcash, prize na lang, sir. Sige, bibigyan kita Gcash pero loadan mo muna ako. Tapos kapag nagawa mo, isan ko sa'yo. Miss Iana. Okay, so proceed na tayo. Proceed na tayo sa may... Kayo na lang bahala humusga kung anong NP1 itong una natin i-rationalize. Mindset. Tama, mindset ba? Kung gusto mong kumita, may paraan. Joke lang po, joke lang guys. So unahin natin sa may NP, rationalization is na NP1 natin. So CHN. Honestly guys, nung nag-take ako ng board exams, CHN medyo, yung ganun ba? Ganun ba yung feeling ko dito sa NP na ito? Kasi parang mahirap eh. Parang ang dami kasi, di ba? So, pabili po ng isang, grapevine na naman si Kyle. Pabili po ng isang isaw. So, to NP1 kasi, di ba, during our reviews, parang ang daming batas, ang daming kailangan i-memorize sa batas, tapos ang daming ethical principles, ganun. So, nakaka-intimidate talaga siya. Pero, fortunately or luckily, when I took the board exams, isa ito sa mga sabihin natin isa sa mga pinakamadali. So, when I had NP1, medyo confident pa ako nun. Sabi ko, parang kaya ko pa mag-top neto. Tapos, as we go on mamaya, i-explain ko sa inyo bakit NP1 yung isa sa mga pinakamadali when we had our board exams. Pero, I'm not saying na, since nadalian kami, is madali rin sa inyo. Ano po book reference nyo, sir, sa CHN? Honestly, wala akong book reference sa CHN kasi nag-rely lang ako sa mga sa discussions ni Sir Dacris. Tapos sa rationalizations lang din. Pero yung mga kasama ko, gumamit sila ng white book. Yung white book from DOH. Yes, okay pa so alright. Basta magtiwala lang kayo sa mga tinuturo kasi usually yun nalabas. When po kayo nag-take, sir? Last year po, November. Tapos, ano pong top news? Top 9 po, Ma'am Celine. Magkano pa pala mag-saan yung mga okay. So, start na tayo, no? Sa my CHN. Sir, top 10 po kayo. Parang sa iba tayo patungo dito ay. Okay, so let's start na sa my question number 1 or situation number 1. Thank you, Miss Maya. In ilang weeks na lang kayo na rin magtatap na rin kayo sa board exams and papas the board exams. Ma'am Mitzi, this is recalls 8 po, NP1 to NP 3.5. Ilang taon ka na, sir? I'm 23 na po. Tanda ko na. So, dito sa board exams, guys, tatandaan natin na, sige, 2:05, mag-start na tayo, no? Sir, paano po kayo nag-aaral before? Honestly, ang ginawa ko lang noon, hybrid kasi kami, so pwede kami pumunta ng face-to-face reviews. At the same time, meron din mga recordings. And medyo tamad ako, hindi pala medyo, tamad ako pumunta kasi nga, iniisip ko yung time na mag-prepare, time ng pagligo, transport, medyo traffic, tapos matagal. So, ang ginawa ko lang noon, nung mga una, pumapasok ako sa may face-to-face, tapos yung medyo tumagal na, nag-rely na lang ako sa my recordings. Kasi at least doon na manipulate ko pa kung gaano kabilis. Kasi nga, medyo tamad ako, mabagal ako magbasa. So, minamanipulate yung recordings para mas mabilis kong, parang mabilis ko matapos yung mga kailangan kong matapos. Yes po, Ma'am Maya. Top rank lang po ang inenrollan ko talaga. From SLU po, Ma'am Christine. Okay po. So, top rank lang po talaga. Kasi top rank ang pinakamagaling for me since from top rank ako. And base naman sa results sa last board exams, top rank may pinakamaraming top notchers. So, consistent naman sila. So, papasa tayong lahat. Okay, so, proceed tayo. Guys, sa may board exams, no? Ilan po ranges ng scores nyo? Mga 62 to 72, ganun lang. Ganun usually. Ganun yung mga ranges sa board exams. Tapos yung iba, actually nakaka-insecure kasi sa totoo lang yung iba, syempre nakakakuha ng mga 80, 90, ganun. Tapos, ako 70 lang. Saan ako pupulutin neto? Pero, sabi nga ni Sir V, yung pagiging top-notcher, may halong fate. Alam mo yun? May halong tadhana. Kasi, aminin mo natin o hindi, marami yung mas magaling sa atin. Marami yung mas masipag sa atin. Pero pagdating ng board exams, hindi natin alam kung ano yung lalabas. So all we can do right now is really to anticipate talaga. Your own, tapos may... Ay, hindi pa po ako reviewer noon. So, ngayon lang po naging reviewer. This is my second class pa lang po. So, I had my first class last Last Wednesday? 13. Last 13 po. So, second class ko pa lang po ito. So, bear with me kung minsan medyo nangangapapa po ako. Okay, so, guys, sa board exams pala, merong situation every 5 numbers, no? Every 5 items. So, maganda, dapat binabasa yung situation kasi usually, nasa situations na yung mga sagot sa board exams natin, sa 1 to 5. May mga clue na tayo doon. So, for example, basahin natin itong first situation. The Philippines is one of 18 mega biodiverse countries of the world, containing 2/3 of the Earth's biodiversity and between 70 and 80% of the world's plant and animal species. The Philippines ranks 5th in the numbers of plant species and maintains 5% of the world's flora. One of the benefits of this is having herbal plants that can be used as alternative medications for communities who have limited access to Western medications. So, pagkabasa pa lang ng situation na ito, ano na yung pumapasok sa tingin nyo or ano na sa tingin nyo yung topic na a-answeran natin? 'Di ba? So kapag nabasa natin dito, herbal plants pagdating sa CHN, ano lang ba yung herbal medications na diniscuss ni Sir Dacris? Siyempre papasok na doon yung Santa Labi. So matik na yun, kapag naisip na natin yung Santa Labi, mag-anticipate na tayo kung ano yung mga type ng questions na lalabas. So, tama, herbal na mga goods. Kita nyo to guys. Lumilipad na naman ang mga isip nyo. Iba pala. Yan. Sorry. Okay, so proceed tayo sa question number 1. Question number 1, Judge has been experiencing a productive cough for 3 days now and is complaining of difficulty breathing, especially when he wakes up. What herbal medication is appropriate for his condition? So letter A, Tiang Gubat, letter B, Lagundi, letter C, Bayabas, or letter D, Acapulco. So, guys, ito yung Ma'am Jehana. Erase ko po muna yung scribble nila. No? Salamat po. So ito yung tatandaan natin guys ha. Kapag nagbigay sila ng symptoms sa situation, always natin hahanapin kung ano yung mother system ng mga ito. So for example, sa situation natin, may coughing, may difficulty breathing. So iisipin natin agad, ano ba yung body system na related sa dalawang symptoms na ito? So papasok yung respiratory system. So since respiratory system, alin ba sa mga choices na ito ang ginagamit to aid sa mga respiratory illnesses? So ganun tayo mag-process ng mag-thought process kapag nag-answer tayo ng questions, okay? So for example, dito, madali lang kasi itong number 1 kasi dito naman sa probinsya or sa Philippines, kapag may ubo, matik Lagundi yung pinapainom, Ascoff, ganun for example. So, ang answer sa number 1 is letter B. Pero kapag lumabas, for example, kapag lumabas ay signs and symptoms ng for stomach ache, ano yung gamot na appropriate sa ganitong mga illnesses? It's Tiang Gubat. Letter C, Bayabas. Bayabas for cleansing ng mga wounds. Or for example, bagong tuli or kapag meron kang sa gums, masakit yung gums mo, you can use Bayabas as gargle kasi nga maganda siyang anti-infective, antibacterial. Then Acapulco naman, Acapulco is mostly used for integumentary system. So basically for scabies, for skin irritation, we'll use Acapulco. Tama po, antifungal for skin infections. Or yes, skin infections. Okay, so mabilis po ba yung pacing natin or bilisan ko pa po yung pagsasalita? Yes po ma'am, Iana Bayawash. So thank you Sir Dacris, tama. Tiang Gubat. Yes po. Tiang Gubat is for GIT. All goods po ba? If ever po na mabilis ako magsalita or mabagal, sabihin nyo lang po para maayos natin pacing natin. Thank you. So proceed tayo sa question number 2. Question number 2, in Barangay Ciudad, it is estimated that 11 community folks have diabetes insipidus. Suppose they have no comorbidities, what herbal medication can be prescribed to them? Mr. Neil, sige po. Bibilisan ko po yung pag-discuss natin, pero if ever po na yung iba masyadong mabilis na naman po, sabihin nyo lang po para mahanap po natin yung perfect fit para sa lahat po, okay? So proceed tayo. So tignan natin yung number 2. Ang keyword nyo dito ay diabetes insipidus kasi ito yung sakit ng community mo. Siyempre, as a community health nurse, you will focus sa may complaints ng iyong patient or ng iyong focus or ng iyong community, which is in this case, diabetes insipidus. Now, kapag sorry po. Kapag diabetes insipidus, ano yung herbal medication na appropriate para sa kanila? Any idea? Letter D. Ma'am Angela. Ang sagot ni Ma'am Angela ay letter D. How about the others po? Ulasimang bato. Okay, so, di ba usually kapag nabasa natin yung diabetes, ang naisip na agad natin ay blood sugar. So kapag blood sugar ang usapan, ang medication or ang herbal plant na appropriate for lowering blood sugar, blood glucose levels, ay ang palaya. So if hindi tayo nagbabasa ng maayos, ang i-answer natin dito ay letter B. However, tandaan natin na diabetes insipidus yung nasa situation natin. So kapag diabetes insipidus, ang problema mo ba ay nasa blood glucose levels mo or nasa production ng ADH or vasopressin? Siyempre nasa ADH production. And usually kasi yung mga ito, endogenic. So sa loob talaga ng katawan nangyayari. It's either may problema talaga sa iyong pituitary gland or sa mga mismong convoluted tubule ng ating kidneys. So kahit ilang beses ka mag-take ng ampalaya, hindi ma-resolve yung problem. That's why ampalaya is not appropriate. Therefore, the best answer here, since bawang is for cholesterol level naman, and bayabas is for bayawash, for infection, the best answer is letter D. None of the above. Kasi nga, ang gamot sa diabetes insipidus, ang main treatments talaga dito ay fluid replacement or fluid resuscitation kung sakali man, and supplementation ng synthetic na vasopressin. So kahit pakainin mo siya ng 10 kilong bayabas, walang mangyayari. Okay? Yes, very good guys. Thank you for participating. Yes, thank you po. Mag-chat lang po kayo, no, kung sakali po na may mga hindi kayo naintindihan or may ideas po kayo para mabasa ng iba and ma-share naman po natin yung mga ideas natin sa kanila. Sabay-sabay po tayong papasa. Papasa ka ba? Magtatap ka ba? The board exams. Okay, so number 3. This herbal medicine is administered by eating the seeds of newly opened, mature, and dried nuts 2 hours after supper. So, yes po, papasa po. Tama. So, the best answer here is letter. Sorry guys, dalawang gamit kong devices, no? Kasi kapag isang device lang maglalag tapos baka matagalan tayo. So, the answer here is, best answer is letter B, nugyogan. Now, irrationalize natin dito. So, for example, kung ang hinahanap ng tanong ay seeds, syempre, isipin na natin, tingnan natin ibang options. Anong parts ba nung ibang options yung ginagamit as herbal medication? So, Acapulco, di ba? Ang sa Acapulco naman, ang part na ginagamit ay yung leaves. So, pinipiga, di ba? Tapos sa pagdating sa ulasimang bato, pwede itong gawing salad, pwede itong gawing decoction, pakuluan mo. Same sa sambong. Pinapakuluan din natin. So, matik na since ang hinahanap ng number 3 ay seeds, bakit mo isasagot yung mga options na gumagamit ng dahon? So, kahit na wala kang clue sa apat na ito, kunwari hindi tayo nakikinig sa CHN, hindi tayo nakikinig kay Sir Daclis, kung familiar tayo sa mga halamang ito, at kung alam natin na ang sambong, ulasimang bato at Acapulco ay gumagamit ng mga dahon, or ang ginagamit ng mga parts sa mga parts na ito ay dahon, matik na ang best answer would be letter B. Okay, so ganun yung guys. Pa-SS plus number 2. Yes, very good. So, number 2, sorry. Konting tip lang, no? Kasi hindi naman talaga natin ma-memorize lahat ng concepts na tinuturo sa review center. Kahit na gustuhin natin, kahit na magbasa tayo everyday, hindi natin ma-memorize lahat. Well, okay, siguro meron yung some na mas gifted or mas may techniques pagdating sa may memorization. Kasi honestly ako, hindi naman ako ma-memorize sa tao. So the best weapon na you can use is, second sa memorization, ay familiarization. Sabi nila, pagdating sa board exams, ang may nakakampi mo ay critical thinking skills, which is true naman. However, ang pinaka-basic skill na meron ka dapat before you can perform critical thinking would be memorization or basic concepts nung topic sa question. So kung wala kang basic knowledge regarding the topic, kung wala kang memorize na kahit onte, anong critical thinking mo doon, di ba? So it's best to memorize or at least familiarize ourselves sa mga topics natin. So proceed tayo sa number 4. Number 4, J. Lord, 7 years old, just had his tule. Di yung kaya. For the konyo tayo rito. Just had his tule. What herbal medications or medication can be given to him? Select all that apply. Yes po, 1 MB lang po memory ko. Tama po. Ako rin po. I can relate. Okay, so number 4, the best answer here ay letter B. Letter B, ano po, gamit din po ba ang gamit din po ba ang strategy for board exams? The answer is letter B po. Number 1 and 2, yerba buena and bayabas. What do you mean po, ma'am? Sir or ma'am Abdullah? Sir Abdullah. effective po kung you're talking about test-taking strategies, effective po siya sa ating board exams. So yes po, tama po. Ang answer ay numbers 1 and number 2, yerba buena and bayabas. What is yerba buena used for? So yerba buena or yung mint, peppermint, is used for, saan po ginagamit yung yerba buena? Tama po, for pain as analgesic. How about bayabas? So paulit-ulit tayo, kagaya ng sabi kanina, bayabas, bayawash for cleaning wounds or for preventing infection na rin sa ating mga sugat. Ang palaya is more on cholesterol levels, bawang is for hypertension, di ba? Ay, ang palaya is for blood glucose levels, and bawang is for cholesterol level, so for hypertension. So best answer ay letter B. Number 5, for Acapulco to be used, it is usually pounded and squeezed. The juice is then used to, so saan indicated ang Acapulco? Diba? So sabi natin kanina, Acapulco is used for integumentary system, for fungal infection sa ating mga paa, sa ating balat, or for example, sa scabies, to relieve scabies. That's why the answer is letter B. For urination, ang gamot na binibigay natin to encourage urination to decrease edema would be sambong. And then to lower uric acid naman, ang binibigay natin ay ulasimang bato. Okay? So, pwede natin magamit yung mga key or yung mga clue na, for example, uric acid, letter U. Ang appropriate dito na herbal plant ay letter U din, ulasimang bato, UU. Okay? So, kapag naman parasite infection sa loob ng ating katawan, ang usually binibigay dito ay nyug-nyugan. Okay, so the best answer for number 5 is letter B. To relieve scabies, itchiness from scabies. So proceed tayo. Basahin pa ba natin yung situations, guys, for the other numbers? Or sa parasites po, for example, ascaris, we can use nyug-nyugan po. So yung mga ganito, guys, nasa may binigay naman usually, kapag nagbabasa kayo ng modules na binigay ng top rank, yung mga ganito nandun po yun, guys. So, magbasa po tayo, no? Habang, kung may time pa po kayo or kung trip nyo pa po magbasa, you can scan your notes para ma-refresh lang po. Nyug-nyugan po para sa parasites. Okay, so proceed na po tayo sa number 6. Okay, basahin muna tayo yung situation. As fully fledged nurses of the country, we must rise to the challenges as primary drivers in the health sector, in pushing for better healthcare delivery, and in bringing good health outcomes for all. As such, we must be competent and knowledgeable on how public health runs in our country to contribute better to society. Proceed na po sa question, sir. Okay. Thank you po, ma'am. Or ma'am, or sir? Ma'am Anna Marie. So proceed na tayo sa questions, no? Para mabilis tayo, guys. So sa number 6, this mandates the devolution of basic services from the national government to local government units, allowing them to facilitate health service delivery from provincial health level down to the barangays. So isa-isay natin. Excuse me po. Ma'am Adet, NP1 po. Sorry guys, wait lang. Okay. So honestly, sino pa rito yung nai-intimidate sa mga Republic Acts natin, sa mga batas-batas natin dito sa sino po yung mga sino pa po yung medyo 50-50 pa po dito sa mga batas? Okay po. So si Ma'am Umera, tama po ba, Ma'am Umera? Okay po. So marami pa tayo. So don't worry guys. Hindi ko alam kung applicable to sa lahat ng board exams. Pero when we had our board exams, yung mga Republic Acts sa amin actually, may katabi silang for example, ibibigay yung number, di ba? For example, RA7600. However, sa tabi nun, may parenthesis, tapos nakalagay doon yung translation niya in words. So for example, if RA7600 has 2 zeros in its numerical form, so it will stand for OO ng Rooming In and Breastfeeding Act of 1992. So yung Rooming In and Breastfeeding Act of 1992, katabi niya yung mismong Republic Act. So if nag-worry kayo na baka hindi nyo pa memorize, hindi ko alam kung applicable sa inyo pero sa amin kasi may katabi siya Katabi niya yung kung anong Republic Act ito. So may clue na kami kung ano yung sagot sa specific question na yun. So hopefully sa inyo, sana meron din. So proceed tayo. So for example, isa-isahin natin muna ito. So sa number 6, RA7600, Since dalawa yung zero, mukha siyang dibdib, di ba? Mukha siyang suso. So, this is for Rooming In and Breastfeeding Act of 1992. Pag titignan natin yung RA 9003, actually, wala akong magawang clue dito sa akin noon. Pero ngayon, since judgemon ako, gamitin natin yung 3 sa huli. 3 for E. 3 for E, ecological. Tapos yung dalawang O sa ecological. Hindi ko sure, guys. So, hindi natin magagawa ng clue yung lahat ng ating mga Republic Acts. Pero kung meron kayong way, kung may alam kayo, share na lang natin sa chat natin para matulungan din natin iba. Letter D, RA 11223. Ang clue ko rito kapag mga 5 numbers na sila sa Republic Act, usually ito yung mga bago. So, 11, since judgemon tayo, pwede natin siya ma-convert into H for healthcare. Healthcare Act. So, ang answer dito sa number 6 ay letter B, RA 7160. Yung mga ganitong type ng question, guys, memorization talaga yung labanan dito. So, kung di nyo memorize, familiarize nyo lang para ma-cancel out nyo. So, proceed tayo sa number 7. Sorry po. Number 7, the Local Government Code of 1991 has the major goal of, sabi ni Sir Daglis. Okay, so, thank you guys. L daw, 7160. Balik na rin lang yung L. 160, legal dead decentralization. Okay, so, thank you po. So, proceed tayo sa number 7. The Local Government Code of 1991 has the major goal of, the best answer here would be, letter, ay, pabalik po saglit, sorry. PSS, okay. Ililipat ko na in 1, 2, sino yon? Screenshot nyo na, ililipat ko na in 1, 2, bingo, Sir Ken. Tama po guys, Sir Ken. Okay, so, na-screenshot, put a big star sa, ililipat ko na in 3, 2, bingo. So guys, proceed na tayo sa, okay, so okay na po ba? Proceed na tayo sa number 7. Okay, proceed na po tayo sa number 7. The Local Government Code of 1991 has a major goal of, so sabi ulit ni Sir Daclis, kapag may nakita tayong, anong i-staran natin dito? Let's put a big star on. Yes po, bingo. Doon tayo sa promoting self-reliance. So, empowerment and self-reliance. Kapag nakita na natin to sa community, sa mga questions sa CHN, sa NP1, usually ito po yung best answer. Okay, so, the best answer, yung number 7 is letter D. Tama naman po yung strengthening local government units. Tama rin yung bigyan sila ng autonomy. Tama rin yung basic services more accessible to people. However, ang focus natin sa CHN, always remember na ang nursing ay individual-centered. So choose the answer na mas nagfo-focus sa individual mismo. Sa pagde-develop ng individual para mas maging independent siya pagdating sa kalusugan niya. Okay? So it's letter D kasi you help them be independent and be self-empowered, self-reliant to have actions or to make actions para sa kanilang kalusugan. So next, number 8, under 7160 under RA 7160, section 102A, who is the chairman of the Provincial Local Health Board? So kapag ganito guys, yung mga chairman, ganun, or referral system, always tandaan lang natin yung hierarchy. So there will always be hierarchy. So kapag chairman, alam naman natin na ang word na chairman, put a big star sa chairman. Ang chairman ay nagpa-pertain sa someone na nasa highest position usually. And pagdating sa Provincial Local Health Board, pagdating sa province, sino ba ang pinakamataas na nakaupo? Yes po. Ma'am, yes po, it's the governor. Ma'am Abigail, when we talk about mayor naman po, they are usually the highest position sa ating municipality. So kapag municipal local health board, the answer would be mayor. Pero since sa number 8 natin, Provincial Local Health Board, the answer is governor po. Okay? So, thank you, si Tito Goff. Oh, for the sugar daddy. Proceed na po tayo sa number 9. Number 9, one of the participants in a HELA training class asked you to, whom should she refer a patient in labor who develops a complication? You will answer, kanino natin i-refer ang isang nanganganak sa community na nag-develop na ng complication? The answer po ay, yes, Ma'am Rowinil, tama po ba, Ma'am Rowinil? I understand, papasok, syempre, sabi po natin kanina, hierarchy. So, tama naman po na ang nagsusupervise sa ating mga tagahilot, mga midwives, are usually yung ating mga nurses. Pero since dito po, tignan po natin, start po natin dito yung complication. So kapag may nakita na po tayong mga complication, di ba? Usually, ang mga complication, mga doctor na talaga yung nagmamanage yan. We nurses, yung mga midwives, mga nurses, they can perform, or yung specifically dito sa question na to, no, sa mga labor, yung mga midwives, they can perform skills when it comes to delivery of the baby. However, kapag mga complication na, kailangan i-refer na sila sa may mga mas mataas na knowledge or supposedly mas may mataas na knowledge and may mas developed skills to manage these complications, which will be the doctors sa ating munisipyo. Okay? Sorry po, pabalik po sa number 8. Sige po, ma'am. Ma'am Iana. There, number 8. Screenshot mo na. Screenshot mo. Lipat ko na. 1, 2, 3. Thank you po. Okay. So, tama po. It's letter A, Municipal Health Officer. Kapag sinabi nating Municipal Health Officer, he or she is the doctor. Okay? Municipal Health Officer, doctor. Provincial Health Officer, doctor po. So, number 10. If a rural health unit needs an additional midwife, a request will be submitted to whom? So, RHU. RHU, ano ang susunod sa RHU? Diba? It will be the Municipal Health Board. So, kung yung RHU yung nangangailangan ng midwife, bakit ka magsisend ng request sa sarili mo pa? Di ba? So, hindi ka naman magsisend sa my health office and health office kasi hindi naman sila yung nagde-designate or what do you call this? Nag-i-employ ng mga nurses or ng mga kung anong kailangang healthcare professional sa mga community natin. So, it will be, letter D, Municipal Health Board. Okay? So, it will always be, kapag mga employment, designation, delineation ng healthcare personnel sa ating community, the answer will be the health board. Kasi sila yung nag-employ, sila yung nagpaposition sa kanila kung saan sila pupunta. Okay, so proceed po tayo sa number 11. Number 11, yan. Basahin natin, kailangan natin basahin yung dito, yung situation. A group of newly licensed nurses is conducting a study on the effectiveness of neurotonic administration and the passing rate of NLE takers. Now, number 11, which of the following is the independent variable in the situation? So, ano ang independent variable natin, guys? As a board exam, guys, marami ito ha. Maraming Palmer. Maraming research. So, siguro kaya medyo sabihin na natin, naging mas manageable yung board exams for me kasi maraming Palmer. Nung nag-aaral ako, medyo nadikdik. Hindi naman sa nadikdik, pero they gave emphasis pagdating sa research talaga. So, siguro depende rin talaga. Minsan kasi may mga specialty yung bawat school na nadadala nila sa board examinations. Okay? So, ang answer dito sa number 11 ay letter A, very good. So, ang independent variable natin yung it can stand alone. So, usually, ito yung mga manipulation, na binibigyan natin, mga ina-administer natin, ganun. Ito yung mga action na ginagawa natin. Usually, yun yung mga independent variable. So, passing rate, ano bang passing rate? This is a dependent variable. Kasi ito yung tinitignan after mo magbigay ng intervention natin, which is yung neurotonic administration. NLE takers are our respondents, or could be also the population. Then effectiveness, parang additional word lang siya. Yes. Usually, guys, meron yung mga tanong na nung recalls namin, may nasa-separate yung options na neurotonic administration and effectiveness of neurotonic administration. So, iisipin mo, nakakalito, ano ba yung tamang sagot doon? Usually, kung may mga options na ganun, piliin mo na lang yung buo. Yung neurotonic, kung ako guys, kung yung ganun yung lalabas sa board exams, I will answer neurotonic administration. Pero luckily, pagdating sa board examinations naman, ganito usually yung formulation ng questions nila and options. So, hindi masyadong nakakalito yung board examinations pagdating sa may Palmer part. Okay. So, proceed tayo sa number 11. Number 11, which of the following is a dependent variable na sabi natin kanina is the passing rate. So, number 13, which design would be the most suitable to use for this study? So, anong design, guys? Kapag meron tayong introduce na intervention and tinitingnan natin yung effects, we are looking for the relationship between the two. So, since andun na yung word relationship, yun na yung ating clue. Ang answer na natin dito ay letter B. Yes, it's correlational. Comparative is you compare, di ba? From the word example, you compare. It could be na compare mo yung effects ng isang intervention at yung effects ng isang intervention. Methodological, hindi naman natin tinest or hindi naman tinest ng mga researchers sa given situation yung bagong strategies or processes to collect information. So, hindi siya methodological. Hindi rin siya phenomenological kasi ang phenomenological, kagaya ng sinasabi ni na Attorney Capili, di ba? Usually, this is ni na Sir Maniago, phenomenological is for the lived experiences ng ating mga respondents or ng ating population. Yes, thank you po, Ma'am Maya. So, yun guys, yung mga ano kasi, usually kapag nakita yung situation, di ba? Andun na yung mga keywords. Effect of. So kapag effect of, relationship na. Effect of to. Ibig sabihin, you're studying the relationship. That's why you answer letter B. So proceed tayo sa number 14. Number 14, if the researchers hypothesize that administration of neurotics positively influences passing rates, they are stating what type of hypothesis. So, tingnan natin yung choices, guys. Common words. Meron ditong directional, may non-directional, may simple, and may complex. So, i-differentiate natin. Kapangyarihan, saluhin mo, ibabato ko. Tama yan. Nice. So, proceed tayo. Nakakamiss naman mag-review tuloy. Hindi pala. Hindi ko pala na-miss mag-review. Ayoko na ng anxiety, guys. So, alam ko marami sa ating hindi pa ready, pero minsan wala tayong choice kundi maging ready. Kasi nga, kesa naman patagalin pa natin ang anxiety. Tapusin na lang natin. Tapusin natin and ensure natin na binigay natin yung best natin during our review and habang nag-answer tayo para no regrets pa rin tayo. Okay? So, proceed tayo. Sir, nag-tap ka ba sa pre-boards? Yes, Ma'am Shara, andito na tayo eh. Nag-tap ka ba sa pre-boards? Opo, Ma'am Krija, pre-boards 1, top 3 po ata ako nung. Tapos pre-boards 2, top 6. Kaya siguro top 9 ako sa Barson. Kasi 3 plus 6, 9. Hindi mo kaya. Okay. Parang ako matatapos, sir. Parang mas matatapos ka, Sir Zeus, kapag mas pinatagal mo yung anxiety mo. So, tapusin na lang natin. Kung matapos man tayo ngayon, at least natapos tayong pumasa. Kasi papasa tayong lahat. Wala tayong choice, guys. Papasa talaga tayo, okay? Chamba lang yun, guys. Actually talaga, pwede po pa-count ng up to 5 before mo. Sige po. Sorry. Thank you. Okay po. So, proceed na tayo na sa number. Proceed tayo sa discussing yung kung ano yung directional and non-directional and complex and simple. When we say directional, so, di ba may spectrum tayo? Directional basically means na it positively influence or kapag directional, ibig sabihin yung result niya or yung effect niya ay may direction or it either positively or negatively influences our dependent variable. So for example, ang mga keyword natin sa directional would be kapag nabasa nyo na it positively influences, it increases, ganon, yung hypothesis increases, positively influences, it's directional. However, kung ang nabasa natin ay it has an effect, ganon lang guys, parang napaka-simple. It has an effect. Kapag gano'n yung nabasa natin, ang tawag doon, non-directional. Kasi hindi siya nagpe-pertain sa either extent ng ating continuum. Di ba? So, yun yung pinagkaiba ng directional and non-directional. So, kung babasahin natin yung situation natin or yung hypothesis nila, it positively influences. Ibig sabihin, this is directional. So, matik, cancel na agad ang letter B and C. Now, what's the difference between simple and complex? So simple and complex pertains sa may interplay lang between or the ratio between our dependent variable and our independent variables. So kung ang ratio ng ating independent to dependent ay 2:1, so kapag meron kang dalawang interventions tapos isa lang yung ini-study mo na effect, that's complex. That's complex na. Kapag simple naman, kagaya ng ating nasa situation, di ba? Ang independent variable lang natin ay yung neurotonic administration. So, iisa lang siya. Tapos, yung ating dependent variable ay yung passing rate ng ating NLE takers. So, iisa lang din siya. So, since 1:1 ratio lang siya, it's simple. However, kung dalawa yung ating intervention, for example, neurotonic administration and sleeping early, sabi niya, effect on passing rate. So, dalawa yung ating administration, tapos isa lang yung ating dependent variable. Therefore, it will become complex na. So, the answer in number 14 is letter D. Even po ba, sir, na negative ang siya effect point dito? Yes po, guys. So, kahit nasabi niyang it negatively influences, ganun, directional pa rin siya, guys. Basta it pertains sa either end ng ating continuum. Could be positive or it could be negative. Okay. So, proceed tayo sa number 15. Number 15, which statement applies the principle of justice in conducting research? Letter A, informing the client about the risks and benefits of the study. So, ano ba dito, guys? Siyempre, kung gumagawa tayo ng study, di ba? Paano ba natin hihikayatin yung mga participants natin na sumali? Siyempre, kung tayo yon, and kung nangangailangan tayo ng participants, hindi natin sasabihin yung risks and benefits. And if we do that, we are being nagiging mapaglihim tayo, di ba? To the point na, to the point na, it is close enough to being dishonest. So, ano ba ang kabaligtaran ng being dishonest? It's honesty. And in the terms, and for our ethical principles, the usual term or the most common term na ginagamit to talk about honesty is veracity. So, letter A talks about veracity. Okay niyo pasok. Ano lang, guys, hindi mo mapapasok lahat sa utak niyo. So, get familiarized lang. Kung tatanungin ako, kung ang type ng question ay enumeration or identification, I cannot possibly answer everything. Pero kapag ang tanong ay multiple choice, I can at least get to go back or try to remember concepts. And then I can use that to apply task-taking strategies or the critical thinking skills. Okay, so proceed tayo sa letter B. Ensuring that participants' identities will not be disclosed. Guys, ito yung isa sa mga main differentiation ng privacy versus confidentiality, ha? When we talk about privacy, it usually talks about the identity of our patients or of our clients. When we talk about confidentiality, usually it pertains to it is related to the medical condition, and it also involves the healthcare team. Okay, that's what confidentiality is. Tapos, so sa letter B, since identity ng participants yung pinag-uusapan, this talks about privacy. Letter C, allowing participants to withdraw anytime they want. So in this option, you're giving the participants self-determination, you're giving them the autonomy. So the best answer here is letter D. Justice pertains to giving the same treatment to all participants throughout your research. Okay. So proceed tayo sa pahiram na lang po muna. So proceed na tayo sa number 16. Number 16 talks about rabies, ha. Rabies, isa lang yun. Rabies. So since sa Pilipinas tayo, pasensya na guys kung medyo rabies yung magamit ko. Pero when we go to other places na sa ibang bansa, sa US for example, or rabies daw guys, rabies. Okay, so proceed tayo. In order to control, prevent the spread, and eventually eradicate human and animal rabies, the country passed what Republic Act? So, 6173 is for Code of Conduct ng mga professionals natin, public officials and employees. RA 9262, so since dalawa yung 2 natin, and number 2 pertains to two individuals, ang clue ko rito ay yung number 2 talaga. So, it pertains to anti-violence against women and their children. So, since dalawa sila, 9262. Okay? So, 7600, mukhang dibdib. So, it's all about rooming in and breastfeeding station. Ma'am ZMA, this is NP1 po, recalls 8. So, the best answer here is letter D, RA 9482. That is the Anti-Rabies Act of 2007. So, proceed tayo sa number 17. Under the Section 5 of the Anti-Rabies Act of 2007, what are the responsibilities of a pet owner except? Sorry, upon checking the questions that I 99 para sa A. Ang tindi niyo naman, Ma'am Tricia, kung na-memorize niyo ito, sana all. Sana all kaya i-memorize yung mga ganito, guys. Kasi yung mga ganito, hindi mo kaya i-memorize talaga. So, ito guys, may binibigay na silang mga clue sa inyo, si Ma'am Krisha. So, try natin incorporate sa ating way of reviewing, sa ating review, para mas mapadali sa atin. Thank you, Ma'am Krisha, and sa iba rin na nagsisend ng mga clue nila. So, proceed tayo sa number 17. Upon checking the questions that I sent, hindi ko ata nalagay yung word na except. So, ang answer po rito guys ay letter B and C. Or letter B. So, options B and C. Have their dogs regularly vaccinated? Sa mga ganito guys, di ba? Kapag may nakita tayong except, it's talking about the negatives. So, magmarka tayo ng mga, for example, markahan natin sila ng positive, negative. So, kapag except ang nakita natin, we put, sorry. Yan. Ito, yan, negative for literal na negatives. Tapos kapag ang nakalagay lang ay, for example, what responsibilities should the nurse do? So it's all about the positives or kung ano yung mga dapat natin gawin. So since the question talks about except, ano yung mga hindi natin dapat gawin? So isa-isay natin. Have their dogs regularly vaccinated against rabies? Of course, this is positive. Kasi di ba? You're ensuring na yung reservoir ng rabies or yung possible reservoir ng rabies ay protected against the actual virus. Allow dogs to roam the streets or any public place at night. To roam the streets or any public place at night, this is wrong, guys. So this is negative. Bakit? According sa ating batas, bawal lumabas ang mga aso kapag wala silang leashes. So dapat may leash yung mga aso kapag nag-roam tayo. Opo, yun po problema. Select all that apply. Hindi ko po nalagay yung except, guys. Kaya yun yung mali ko sa ano. My bad po yun. Sorry po. Pasensya na po. Hindi ko pa nalagay yung word na except sa number 17 natin. Kasi kung all of the above natin dito, guys, so ano sa tingin nyo yung sagot? It would be A, B, and A and B. Kaso lang, wala namang A and B dito sa options, diba? So, mali ko talaga yun. Okay, so proceed tayo. Balik tayo sa option C. Shoulder half of the medical and other incidental expenses incurred from dog bite. This is also wrong because you should shoulder full, buong presyo. Lahat ng magagastos ng nakagat na aso natin. So this is negative. And then lastly, submit their dogs for mandatory registration. This is positive. Para alam nila kung kaninong aso yung mga naggagagala dito. And sino yung will be held responsible kung sakaling may nangyari. So since negative ang letter B and negative rin ang letter C, the question pertains to which of the options are negative or yung hindi kasama sa trabaho ng isang responsible pet owner, ang sagot natin ay letter B. Options B and C. Nag-gets ba natin? So far, nag-gets ba natin, guys? Yes, thank you po. Kung meron pa tayong hindi maintindihan, sabihin nyo lang, guys, no, para ma-elaborate natin. So proceed na tayo. Clear. Proceed na tayo sa number 18. Number 18, while playing and smooching with her puppy, Tanya received superficial scratches without bleeding on the right side of her neck. According to the DOH's Manual of Procedures for National Rabies Prevention and Control Program, this can be classified as what category of rabies exposure? So, unahin natin sa letter B. Guys, walang category 4 sa manual ng DOH, okay? From category 1 to category 3 lang. So, category 1, easiest terms possible would be anything na involving yung aso or yung hayop. Pero sa involvement na yon or sa occasion na we got involved sa mga hayop na yon, walang tearing sa ating integumentary system. So as long as intact yung skin, kahit na dinilaan tayo ng aso, ganun, or hinawakan natin yung aso, as long as intact yung ating skin, this would be considered as category 1. Okay? Also, included sa ating category 1 yung mga casual exposure natin sa mga patients na may rabies. Casual contact, ganun. Included ito sa may category 1. Category 2 naman, usually kapag ito yung merong mga minor scratches na. So, merong damage sa ating integumentary system, however, walang bleeding. Kung sakali man na yung scratches ay pinadugo natin, included pa rin siya sa category 2. Kung yung bleeding ay induced by tao, this will be included sa category 2. Ano naman ang included sa category 3 natin? Yes, thank you po, Ma'am Tricia. Yes po, sorry guys, mali ko sa akin yung sa may number 17. Hindi ko nalagay yung exact. Sorry. Sir, okay na po ba if isulat niyo po yung ratio para po may sulat yung ratio. Tingnan, Ma'am Carla, sige. Try natin mamaya para makita natin kung sakaling, kung sakaling sakto sa oras natin or kung mababagalan tayo. Pero try natin. No? Pero, tignan natin. Thank you, Ma'am Tricia. So, if ever man po na meron kayong mga notes or photos about sa topic natin, kung willing po kayong i-share sa mga classmates natin, I thank you po for your help and for your support. So, tignan din po natin yung chat box natin. So, I'll try and sulat-sulat po. Sulat-sulat. Ay. Yan. Category 1, usually yung mga licking or integ, licked, or touched by pets, pero intact skin. Yan. Yun yung sa may guys sa category 1. Category 2 naman, kapag category 2, ito yung mga may minor scratches. Pero, allows dugo. Yan. Category 3, ito yung mga may dugo. May dugo or spontaneous bleeding. Sabi naman dito, sa may situation natin, superficial scratches lang and walang dugo without bleeding. So, bakit? Ang answer dito sa number 18 ay letter C. Bakit letter C ang sagot sa number 18? It's because, according sa DOH, lahat ng sugat from the neck hanggang face, so dito guys, lahat yon included na sa may category 3. Why? Kasi di ba ang virus, ang rabies virus, tataas yan sa utak. So kapag yung sugat malapit na sa utak, syempre matik na yun na kailangan na natin ng prompt action. Kasi napakalapit na ng tataasan niya. So mas mabilis yung pathogenesis ng rabies kapag ganun na yung sugat natin. So kailangan natin ng extra. Sorry. Sorry guys, medyo nangangapa pa ako sa mapagaganto na kasi medyo first time ko second time kong, ito yung first time ko mag-annotate kasi nung last class ko medyo hindi ako nagganito so naninibago pa ako. So category 3, kapag neck to face, matik category 3 na. Ayan. Okay, so proceed na tayo sa may sa may number. Okay, clear ko na po guys ha. Thank you. Clear na natin. Tapos proceed na tayo sa may number 19. Tapos after 19, konting bladder break lang guys. Mabilis lang. Ayan. Proceed tayo sa number 19. Number 19, for adults and infants, the recommended size for vaccine administration would be, the answer here ay letter A. So, ano to guys, isa rin sa mga magagamit yung tools for the board examinations would be visualization talaga. Hindi siya pictographic memory, pero hindi pictographic memory ha, pero it's useful kapag may baka pictographic memory nga yun. Pero alam niyo yun guys, yung i-visualize nyo mismo yung mga muscles or yung organs na involved. So for example dito, sabi natin, bakit mali yung letter B? Anterolateral thigh for adults and deltoid for infants. Siyempre alam natin na for infants, yung muscle layer, yung muscle natin kapag sa deltoids nila ay masyado pang manipis. So kapag na-visualize nyo yun, kapag na-injectan nyo ng syringe, siyempre baka matamaan na yung buto. And kapag adults naman, sa anterolateral, masyado nang makapal. So it could be na masyadong mababaw yung pag-inject ng needle natin. Letter C ay mali rin kasi nga hindi pa masyadong malaman yung gluteal for infants. Mali ang gluteal, both adults and infants kasi yung absorption ng any vaccine or any gamot sa gluteal region natin is unpredictable. Ang problema kasi sa rabies, di ba, kailangan ng agaran na vaccination. Kasi nga kailangan agad-agad maagapan yung rabies, yung virus. Kasi kapag mabagal yung absorption ng gamot or hindi natin na monitor ng maayos yung absorption rate ng gamot, kagaya if nag-inject tayo sa gluteal region, hindi natin malalaman kung effective ba yung gamot or kung nagagawa ba ng gamot yung indication niya ng maayos. So that's why the best answer would be letter A. Thank you po. Thank you, Ma'am Prisha. Sana all. Yes, for the imagination. Imagination lang po ang words, guys. Nasa utak lang natin lahat ang words. Okay, so proceed tayo sa number 20 before mga 2-minute bladder break. Bladder or 2-minute or 1-minute bladder break. In the Philippines, the most common reservoir for rabies is, tama po, is letter D. Yung mga nagpapakagat dyan mga kinks nyo Joke lang po. So number 20 is letter A, dogs. Alam ko, mga mahilig manggat dyan, please lang po medyo masakit-sakit yung mga kagat ninyo. Baka mamaya may mga rabies na kayo, ayos-ayusin nyo lang. Pero is letter A, guys. Pagdating dito sa Philippines. Sa ibang bansa, talamak yung mga raccoons, kung alam, kahit domestic yun. Yes po, domestic po. Yes po, ma'am. Domestic, dogs po. Depende po kasi sa, kahit po domestic sir, depende po ito, ma'am. Kasi po, ang rabies, di ba? Ang rabies ay napapasa. So, it's not that, hindi naman sa, bigla-bigla na lang magkakaroon ng rabies yung mga aso natin. However, kasi, isa sa mga pinakamaraming hayop dito sa ating bansa ay mga aso. And minsan, yung mga aso pa natin, asong gala, di ba? Kahit nasabi natin, pagmamay-ari natin, hindi natin sinusunod yung mga may leash policy, ganun. So, minsan, kahit saan saan sila napupunta, nakaka-encounter sila ng ibang hayop na may rabies. Yes po, marami mo nangangagat. Rar! So, talamak pa rin po yung mga, yung mga aso po natin, kahit domestic po sila, it could be na maka-encounter sila ng mga hayop na may rabies virus po. So, dun po nangyayari yung transmission ng rabies sa ating mga alaga, kahit na domestic pa sila. Pero kung yung aso naman natin, 24 hours na sa bahay, pero syempre, hindi pa rin naman natin ma-monitor kung anong klase mga hayop yung pumapasok sa bahay, ganun. So, that's why important pa rin na ipabaksin natin. Sir, pakagat. baka po ma-fire tayo. So, mag-bladder break lang po tayo ng mga 1 minute, tapos balik po ako agad. 1 to 2 minutes. Thank you po. Hello, paproceed na po tayo sa number, nandito na po ba lahat? Or yung mga nag-CR? Okay, so proceed po tayo sa number 21. 21. Sorry, quickie lang. And I oop. Mabilis guys para hindi tayo masyadong late matapos. Kasi alas 8 parang. Siyempre, paano kung meron pa yung mga ka-date, diba? It's Saturday. So, kailangan ko naman kayo bigyan ng oras para sa sarili nyo. Para makapagpahinga, to do your alone time. Unless gusto nyo mag-rush tayo hanggang alas 10. Dito tayo BGC, sir. Pre-board books. Sorry po, Ma'am Ana. Okay, so bilisan po natin para makapagpahinga po kayo. Kailangan nyo po ng energy for pre-boards. Okay, so proceed po tayo sa number 21. All our goals of Formula 1 for health except. So, ano ang sagot dito? The answer here is letter D. Guys, ito yung sa community. Kapag nakita kayo ng free you will not give free healthcare services sa ating community. Kasi ang ina-establish natin sa community, self-reliance, empowerment. So dapat, after nyo mag-live sa community, kaya na nila yung sarili nila. And when we give free healthcare services, ang tatakbo sa utak ng mga tao would be, magbibigay naman sila. So bakit pa tayo mag-e-effort? Yun yung tatakbo sa kanila. That's why you do not give free healthcare services sa ating community. So may kadate. Ay, hindi pa ako nanonood ng Drag Race, ma'am. Ma'am or Sir Jan? Sorry. Pero yung ibang friends ko po nanonood. Pero, I know some of the characters naman po ay. Kasi parang narinig ko rin sa kanila. Sure, may kadate ka raw, sabi ni Mitzi. Admin? Sino admin po? Admin to you. Hindi ko pa. Secret po. Wala nyo, hindi nyo sure. So, proceed po tayo sa number 22. The 4 elements of the strategy include all of the following except. So guys, tignan nyo na lang dito, di ba? Matik na kapag nabasa natin yung word na restriction, health restriction, bakit may i-restrict yung health? So it's negative na agad. So since the word except is equivalent to the negative option, it would be letter C na. Okay? So the best answer is letter C. Hindi ko alam kung may better explanation pa rito, pero from the etiology alone or from reading alone, health restriction, alam na natin na mali ito. So proceed tayo sa number 23. All of the following are considered intermediate level healthcare workers except, the answer here guys is letter, yes, it's letter A. Kasi ang mga health auxiliary workers natin, sila yung ating mga barangay health workers. So usually sila yung mga trained community health workers or sila yung mga traditional birth attendant lang natin na tumutulong sa ating mga professional or sa ating mga intermediate level health workers, which include yung ating mga public health nurse, rural sanitary inspectors, and midwives. So, lagyan natin dito. Sorry, nakakalimutan kong mag-annotate minsan. Mga health auxiliary workers natin ay ating mga BHWs. Yeah. So, okay guys, so okay na ba? Hindi ba ito na ba? Yeah. Proceed tayo sa number 24. Clear. Yeah. Number 24. This level of healthcare includes facilities capable of performing minor surgeries and perform some simple laboratory examinations. So, okay po. So, ano natin? Isa-isa natin. Primary, ang included dito sa primary level of healthcare, ating mga barangay health stations, mga RHU natin. So, usually, di ba, ang binibigay lang dito is yung mga dito nagsisimula yung ating referral system. And usually, ang mga binibigay lang dito is yung mga basic services, basic healthcare services sa mga nangangailangan natin sa ating community. Pero ang sabi kasi dito sa situation natin, minor surgeries and some simple laboratory examinations. So saan ba tayo nakita ng mga barangay health center, mga RHU na merong simple laboratories, or merong mga simple surgery area? Ang mga usual na nandito naman, ang mga usual na tagabantay sa ating mga BHS, mga RSU, ating mga nurse, diba? Mga nurses or mga barangay health workers, minsan nga wala pang nurses palagi eh. Minsan mga midwives lang, ganun. Sino bang kailangan kapag may mga minor surgeries, diba? Kailangan natin ng mga physician. So, tertiary naman, tertiary refers sa tertiary involves institutions, health institutions na for more specialized or sila yung mga medical centers na yung mga mas malalawakang sakop. So for example, mga Philippine Heart Center, Kidney Center of the Philippines, yung mga lungs, sa mga eyes, pag mga special systems na, pinuproceed dito sa tertiary. Or yung mga Baguio General Hospital and Medical Center, for example, sa SL Sacred Heart Medical Center. Hindi ko na alam, hindi ko tanto alam. Pero medical center niya atang SLU ngayon eh. So sila yung mga included sa tertiary. Walang quaternary guys ha. So it's only primary, secondary, and tertiary. Now secondary naman, ito yung mga usually, dito pong pasok yung mga infirmaries natin, mga municipal hospital, district hospital. Dito rin ginagawa yung mga, kagaya ng nasa question, dito ginagawa yung mga minor surgeries natin. Kasi usually dito na yung mga may help ng ating mga physician. So, kapag mga minor surgeries, of course, sa secondary. Kasi nga, sa primary, ito ang usual na nababantay dito, yung mga barangay health workers natin, mga auxiliary workers natin. And then kapag mga major na, papasok na tayo sa tertiary. So, yung referral system natin guys, from primary, pupunta sa secondary, tapos pupunta sa tertiary. So proceed tayo sa number 25. Yumi, who has a family clinic in her house, belongs to what level of healthcare and referral system? So the answer here, number 25, is letter A. So ito guys, kung nagtatanong kayo ng mga reference books, sa white book, yung from DOH, kasama doon yung mga, kapag may mga private clinics sa mga barangay natin, or mga puericulture clinics, ganon, included sila sa may primary level of healthcare natin. So proceed na tayo sa number 26. Ano to guys? Yung triangle, if I'm not mistaken, nandito si sinend ni ma'am, ni ma'am, wala dito sa ma'am Trish. Pero, sige, isulat natin. Dito sa may primary, lagay natin mga puericultures, ganun, mga private. Next. Next. Yan. Yan. So, 1, 2, 3, 4, 5. Lipat na pa natin. Thank you po. Proceed tayo sa number 26, no? Number 26. Number 26. As part of her job, she visits homes and refers patients to appropriate levels of care when indicated. She's performing what function? Ito guys, mali ko na naman to kasi supposedly yung answer dito ay, anong answer nyo dito guys? Sa number 26. Letter D, coordinator. Supposedly yung answer kasi dito ay as nurse clinician talaga. Kasi they're performing their nursing care function. Kasi ang supervisor, di ba? Supervisor, mali to ha, mali yung nabigay kong option sa top rank. Ang sagot dito guys, clinician. Sorry, my bad po. Yeah. Yan. Dapat ang sagot dito ay nurse clinician. Why nurse clinician? Di ba ang mga supervisor natin, sila yung they perform supervisory roles, o binibisita nila yung ating mga health centers, gano'n, yung ating mga midwives, nagkakonduct sila ng surprise assessment sa mga midwives natin, gano'n, gamit yung mga supervisory checklist natin. So, yun yung ginagamit ng supervisor. Yun yung ginagawa ng nurse supervisors natin. As the root word implies naman ng supervise. So, dito sa situation, wala namang sinabi na she supervises or the nurse supervises. So, mali, cancel na agad yung supervisor. Hindi na siya educator kasi as educators, ang job natin ay to supply information sa community. At dito naman ang sabi, di ba, she visits homes and refers patients to appropriate levels of care when indicated. So, I understand na yung refer could be related sa word na coordinate. Pero kapag sinabi kasi natin coordinator, usually this is for you establish linkages na and collaboration mismo. Collaboration sa mga either public or private owned na health agencies, ganun, yun yung ginagawa ng coordinator. Pero kapag when you refer, kasi you're doing your job as a healthcare worker. So it pertains or it refers to the job of the nurse as a clinician. That's why the best answer here is a nurse clinician. Nurse manager is you implement yung binibigay na, kasi di ba, ang papasok ulit yung hierarchy. Yung ginagawa sa bawat barangay health center, nanggagaling, of course, sa may pinakamataas sa ating health board or sa ating DOH. So, ang trabaho ng manager, ini-implement niya yung binibigay na programa ng DOH sa pinagtatrabahuhan niyang barangay. Yun yung ginagawa ng nurse manager. So, sorry po guys, wala dito yung tamang choices. It should be nurse clinician. Okay? So, proceed tayo sa number 26. Ang dami ko nang mali tuloy dito sa reports 8 na technicalities. Sorry po. I'll be better next time. So, number 27 po. Assessing, planning, and implementing care. Nurse clinician. Thank you po, Ma'am Abigail. So, number 27, assessing, planning, and guys, thank you pala, no? It's very helpful yung mga ganito na tumutulong, mga nagsisend ng definitions. Pero kapag kasi board exams na, tandaan natin na situational yung bibigyan nila mga questions, no? So, aside from memorizing lang yung mga ganito, you also expand sa parang i-translate nyo yung ganitong concepts sa mismong actions na pwedeng gawin ng mga nurses. Okay. So, i-expand pa natin yung horizons natin regarding sa ano ba yung ginagawa ng nurses sa bawat role niya sa community. Akala ko yun na yung sagot, pero ikaw lang pa. Yes po, Sir Lorenzo, kasi po, mali po yung nabigay ko options, kaya ang sagot ay literal na nasa akin po ay. Pasensya na po. So number 27, assessing, planning, and implementing care and evaluating outcomes are part of her. These are included sa ADPI natin. So kapag ADPI, matik na ang sagot dito ay letter C, nursing care function. Related siya sa previous question asked, or kung walang nursing care function, nurse clinician. So letter C. Number 28. Nurse Alanis was asked by the municipal health officer, "Sir, kayo po gumawa?" Yes po, Ma'am Sheila. Sorry po. So number 28, sorry po, maraming technical. I'll be better po. Number 28, Nurse Alanis was asked by the municipal health officer to assess training needs and design training programs for midwives. And so guys, tingnan natin yung ano. So guys, hello guys, welcome to my vlog. So tingnan natin yung situation. Nandito na yung word na training, di ba? Tapos kung titingnan natin yung options, meron na yung option na trainer. So, ano nyo na lang, parang pag-connectin nyo na lang. Training, trainer. So, matic na, it's letter C na. Kung mga wala kayong clue, ganun, wala kayong clue sa mga options, tignan nyo lang yung words, mga keywords, tapos kung ano yung mga kaparehas niya sa may options. Kagaya ng sabi natin kanina, coordinator is all about linkages sa ibang, could be health institutions, could be public or private, ganun. Manager, sila nag-implement ng mga programs galing sa higher-ups. Supervisors, as the word implies, it supervises yung mga midwives natin, ating mga barangay healthcare workers. Trainer, it trains. It designs, assesses the skills, makes training regimen para sa ating mga barangay health workers. Okay? So the answer here is letter C po. Proceed tayo sa number 29. Ito na guys, sabi niya, Nurse Alanis visits midwives and other auxiliary health workers and identifies together with them any issues or problem. Diba kapag ganito, this is just a rewording of the word assessment. Nag-a-assess na siya kung ano yung mga problema na, could be problema sa may mga midwives natin or problema na nai-encounter ng ating mga midwives and other healthcare workers. So since, ayun pala, if you will enroll, I suggest maganda mag-enroll sa Coaching with the Icons kasi additional information. Yun pala yung sinabi ni Ma'am Udan na tumatak sa akin. So sinabi niya na ang board exams ay rewording lang ng mga definitions. Kaya yung sinabi ko kanina guys na maganda na you familiarize yourselves sa ating mga definitions, theoretical definitions, pero also you find other ways na pwedeng ma-express yung definition na ito. So you find synonyms, gano'n, specific words, para kabasa niyo sa board exams, alam niyo na agad kung ano yung sinasabi. Pabalik po sa 28. Sorry po. 28 po, yan po. Sa trainer. So sa number 29, ang words na identifies with them, other word lang siya sa supervisor. So number 29 is letter A. Thank you. Number 29 po. Number 29, letter A. Ayan. 3, 2, 1. Proceed na po tayo sa my number 30. Number 30, as part of her advocacy and of creating a supportive environment, Nurse Alanis influences the sangguniang bayan to build a biking or walking lane in the community. She's performing what function? Usually guys, magkasama kasi yung health promotion and education function. Itong nasa question, this is under health promotion. So the answer here is letter A. Na-define naman na natin isa-isa yung letter B, letter C, letter D. So alam na natin na yung situation, hindi siya angkop or hindi siya under sa options na ito. So ang natitiran na lang ay letter A, health promotion and education function. Okay po? So tapos na po tayo sa 31, mag-proceed na po tayo sa number 30. Tapos na po tayo sa number 30, mag-proceed na po tayo sa number 31. Number 31 talks about tuberculosis. So number 31, which of the following are common signs and symptoms of tuberculosis? Select all that apply. The answer here, guys, letter D, all of the above. Unexplained weight loss, coughing for more than 2 weeks, hemoptysis, or hemoptysis yung merong may dugo, may blood streak sa ating nilalabas na excretion mula sa lungs. Night sweats and chest or back pains not referable to any musculoskeletal disorders. So the answer is letter D. Number 32. After a month of treatment, Jessa complains of orange-colored urine. Nurse Jera knows that the medications causing this and the appropriate intervention are, this would be, guys, kung papansinin nyo, iba-iba yung mga gamot na nasa options sa ito. So, by the help of memorization or familiarization sa mga anti-TB medications, alam na natin agad na number 32, orange-colored urine is a normal side effect. Hindi naman normal, pero it is a non-health derogatory side effect of letter B, rifampicin. Yes, it's rifampicin. So, matik na kung alam natin na ang orange-colored urine ay caused by rifampicin, kahit huwag natin basahin yung katabi niyang kadugtong niya. So, matik na letter B na yung sagot dito. Ethambutol, letter E, so could be correlated sa ice for optic neuritis. Isoniazid naman, peripheral neuropathy. Or alam niyo ba yung burning fit syndrome, guys? Burning fit syndrome. Usually related to sa vitamin B6. Tapos pyrazinamide, P. Sabi na natin purines. Purines, uric acid, hyperuricemia. So yun tayo. Number 32 is letter B. Sige, isulat natin. Ethambutol, optic neuritis. Diba? Kapag pyrazinamide, purine, hyperuricemia, uric acid, gout. Ganun yung ano, guys. Alam mo, magkakadugtong sila. So, mag-start sa tapos mag-branch out. Tapos, madali nyo na matitrace. Isoniazid, peripheral neuropathy. Pyrazinamide, hyperuricemia. Yan. Okay. Ay, tama po, Ma'am Micah, rifampicin. Yes, thank you po. Yes, it's expected. Expected side effects ng rifampicin. So, guys, screenshot nyo na 3, 2, 1. Tapos proceed na tayo sa number 32. Thank you. Number 33. Jessa has been taking anti-TB drugs for 7 months now. Lately, she has been experiencing a burning sensation in her feet, prompting her to visit their RHU. Nurse Jera is correct if she states that the drug responsible for this ay, gaya ng sinabi natin kanina, it's letter B, isoniazid. Ang mechanism kasi nito, guys, yung isoniazid natin, inhibitory kasi siya pagdating sa enzyme na related sa may pyridoxine natin, sa ating vitamin B6. So, ininhibit niya yung enzyme na tumutulong para ma-absorb ng body and magamit ng body yung pyridoxine. That's why nagkakaroon ng peripheral neuropathy. Ang trabaho kasi ng pyridoxine sa katawan, crucial siya para ma-produce yung ating mga neurotransmitters for signal transmission. Diba? So kung kulang tayo ng pyridoxine sa katawan or hindi nagagamit ng katawan yung pyridoxine, hindi tayo nakaka-produce or hindi nakaka-produce yung katawan natin ng neurotransmitters for signal transmission. That's why nagkakaroon tayo ng burning fit sensation. Okay. Nagkakaroon tayo ng peripheral neuropathy. Pag mga neuropathy, usually it talks about talks about neurons, talks about neural transmission. So proceed tayo sa number 34. After reading the prescription that Jessa's doctor has given her, what would Nurse Jera provide Jessa to aid in the nursing sensation in her feet? So kagaya na nasabi natin kanina, pyridoxine is the scientific term for what vitamin? Vitamin B6. So the answer is letter B. Number 35, if Jessa suddenly experiences impairment of visual acuity and color vision, the nurse would, the answer here, guys, letter Letter C. Advise her to hold anti-TB drugs and refer to physician immediately. Kasi ito yung concept naman, di ba? Pagdating sa um, kind of similar for peripheral neuropathy. For peripheral neuropathy, sir, vitamin 6 din po ba ang guys, ang vitamin C hindi siya matatawag na drug of choice ha. Kasi ang drug of choice is yung drug na primary ginagamit para magamot agad or magamot yung problema. Ay, mali po sa G-form. Anong number po, Sir Lorenzo? Number 35. Okay po, wait. I-clarify lang po natin na ang vitamin B6 po, any vitamins ay supplementations po siya. So, hindi po niya ma-resolve agad or hindi po niya ma-resolve yung problem ng peripheral neuropathy. Instead, nag-provide po siya ng support para hindi naman po sa mapabagal, pero para meron pa rin pong supply yung katawan ng B6 natin, para may magamit pa rin po natin, para hindi po mas mapalala yung symptom ng peripheral neuropathy or para ma-relieve po tayo sa may symptoms ng peripheral neuropathy. So, proceed tayo sa number 2. Apo. Ano po ba nga? Sir po ba or Ma'am Abdullah? Sir. Proceed tayo sa number 35. Sir po, okay. Thank you po, sir. Pasensya na po. Hindi po ako masyadong sure. So, number 35, if Jessa suddenly experiences impairment of visual acuity and color vision, the nurse would, it's letter C. Guys, kung mali sa G-form, i-correct nyo na lang sa sa own copies nyo or sa mismong rationals. Ang importante naman here is yung we'll be able to understand the rationalization, the concept before. That's what you should look for kapag may rationalization. You don't just look for the answer. You ask for the thought process. Paano na-formulate yung ganitong sagot? Paano tayo nag-derive sa ganitong sagot? Kasi pagdating sa board exam, syempre hindi naman lalabas yung similar questions. Pero, yung similar context ng question and concept ng question, yun yung possible na makita natin ulit. Ang problema, paano kung iniba-iba nila yung wordings? So, dun papasok yung thought processing natin, no? So, pa-correct na lang ako guys sa copy nyo yung number 35. So, kapag may mga problema sa mata, visual acuity, usually pinapa-hold natin. So, it's letter C. Number 36. All of the following are included in the essential health package under the maternal health program except, ang answer dito guys ay letter A, vitamin A supplementation. Kahit anong dosage pa yan. Basta, kahit anong dosage pa yan, kung ibibigay mo siya within the first trimester of pregnancy, that's a big no-no. Big no-no guys kapag vitamin A supplementation during the first trimester of pregnancy. This is because vitamin A contains retinoic acid, di ba? Retinol, yung mga nag-retinol dyan, it contains retinoic acid. And very destructive kasi yung acid na yon pagdating sa sa genes ng katawan. So during cell cycle, di ba? Kapag nag-reproduce yung katawan ng cells, since ang retinoic acid ay destructive sa mga genes, it could be na may mga alterations sa may genome transcription ng mga cells natin. That's why, hindi siya, di ba, ang organogenesis or ang production ng ating mga organs ay nasa within the first trimester of pregnancy. That's why, habang nagpo-form pa ng mga organs yung katawan, leave the fetus alone. Huwag ka magbibigay ng mga teratogenic na pagkain or supplementation. So, huwag tayong magbigay ng vitamin A during the first trimester. Excuse me po. So, proceed tayo sa number 37, guys. No? 37, as part of giving supportive care for the mother during onset of labor and to help her deliver cleanly, safely, and free from fatigue, the nurse must encourage her to select all that apply. Guys, ang answer dito ay letter... Answer po rito ay letter... Say natin. It's letter A, letter B, letter E, and letter F. A, B, E, F. So, it's letter A po. 37, letter A ang sagot natin dito. Bakit mali ang ating letter C? Eat huge meal for energy storage. You should not eat huge meal, guys. Kasi di ba, i-visualize ulit natin yung anatomy ng ating mother. Tama ba yun? Yung anatomy. So, kapag kumain tayo ng marami, probable na sa dami ng kinain natin, naiipit yung uterus. Or since marami yung kinain natin, it could be na yung yung energy natin, mas naka-focus siya sa ating GUT. So baka naman maubusan si mother ng lakas para umire. At saka 'di ba kapag marami tayong kinain, minsan naiipit din yung ating diaphragm, yung ating RS or respiratory system. That's why baka mahirapan naman ang huminga, mahirapan namang huminga si mother. So, kung papakainin mo man si mother, maliliit lang, small amounts lang. Yung sapat lang para mag-provide sa kanya ng immediate energy kapag kailangan niya. Kasi nakakapagod ang labor. Though hindi ako babae, pero if we were to imagine the process, may lumalabas sa baby sa katawan mo, tapos pinupush mo siya, di ba? So, nakakapagod yun, guys. So, syempre, kailangan pa rin ni mother kumain. Pero unti-unti. Okay? At saka hindi mo rin i-hold yung bladder and bowel. Kasi nga, anatomically na naman, di ba? Nasa taas ng ng uterus, ang ating bladder, urinary bladder. So, kapag puno yun, may ipit. So, mahihirapang lumabas yung baby. That's why you should advise the mother to empty the bladder every 2 hours. Hence why, letter A ang sagot natin dito, guys. Answer natin dito, letter A. Text. Draw. Stamp. Yan. Tignan natin. It's letter A po. Yan. Proceed tayo sa next question. Number 38. So, number 38, medyo bilisan ko yung pagsalita, guys. Ang bagal ko ata magsalita. So, medyo nahula ako sa pacing ko. Number 38, additionally, as a health educator, nurses must inform, teach, and counsel women in labor on important MCH messages, which include, this is letter D, all of the above. Important ang birth registration, important din ang to discuss the importance of breastfeeding. Important din na i-discuss natin ang newborn screening dapat tayo yung mga advocate dito. Advocate tayo sa breastfeeding, newborn screening, and pati nurses schedule postpartum visits. So all of these are correct. Kung mga ganitong questions, guys, memorization talaga yung key strategy dito. Or familiarize yourselves. Or matik na, kung tignan nyo na lang, ano sa tingin nyo? Kung tignan nyo yung options, may mali ba sa mga options? Wala naman, di ba? All positive naman. So all of them. Now, number 39 tayo. Since the risks of complications increase after the second birth, the ideal spacing of birth to help mothers completely recover from previous pregnancy and childbirth would be, so the answer here, guys, ay letter C. Ang main, tatandaan natin dito, guys, letter D could be a good answer. Pero the best answer would be letter C. Bakit? Kasi ang ibigay natin na option would be yung time frame na the couple or the mother could conceive as soon as possible. Diba? Kasi para kung plano niyang gusto mga anak ulit. So you give her the option na as soon as possible pwede, pero dapat consider din natin na fully recovered na si mother to proceed with the pregnancy. So the best answer here is 3 to 5 years. 1 year minimum, 2 years minimum, masyadong maaga. So, proceed tayo sa number 40. After Gab gave birth to her first child in their RHU, Nurse MC knows that the recommended schedule of postpartum care visits would be on. Ang answer po rito ay letter B. First week postpartum, preferably 3 to 5 days for the visit. Tapos, after nun, 6 weeks postpartum for the second visit naman. So, ito guys, nasa lang din to, nasa copy. So, memorization or familiarization na din talaga ito. Proceed tayo sa na-screenshot na ba number 40? Proceed tayo sa number 41. Excuse me po. Number 41, Moses and Kathy, the family's heads ask about sterilization procedures. Which question should Nurse Ashley ask the couple to determine the most appropriate family planning method? So alam naman natin na sterilization usually, sino na sa answer para may time kayo mag-screenshot. Sterilization procedures, usually kasi diba, kapag ito yung ginawang procedure sa ating heads or sa ating couple, yung probability or possibility, percentage na mag-conceive sila ng child would be, could be 1% na lang or lower. So tanungin nyo, kung alam ba nila na ang sterilization procedure ay, ibig sabihin na to, yung possibility nila na manganak na ulit or magkaroon ng baby ulit ay very low na. So, tanong nyo muna, plano nyo po bang magkaroon ng anak ulit anytime soon? Kasi kung oo pala, edi hindi sterilization procedure appropriate sa kanila. Okay? Letter A, have you ever had surgery? Hindi naman lahat ng, ito could be questioned after mo tanungin. Kung alam ba nila kung ano talaga yung sterilization and kung willing ba talaga sila after knowing na, after ng sterilization procedure, hindi na sila pwedeng manganak ulit. Or very low na yung possibility. So letter C naman, do either of you have diabetes mellitus? Hindi siya directly related sa my question. Letter D, do either of you have problems with high blood pressure? Of course, these are factors that could affect the surgery kung sakaling nag-proceed sila. Pero at this point, since nag-assessment pa lang naman, first phase pa lang naman, the answer is letter B. So, proceed po tayo sa, kaya answer dito. Thank you, Sir Lorenzo. Proceed tayo sa number 42. The couple then asks Nurse Ashley which method of contraception is the best for them to use. Which response by Nurse Ashley would be most appropriate? So, the best answer is letter B. Kung titignan nyo guys, sa mga options or sa mga questions na may mga, or yung mga nagtatanong about sa what response would be best, ganun, ang piliin yung mga sagot ay yung mga pinaka-compassionate, pinaka-empathetic, and pinaka-holistic na mga sagot. And most importantly, individual-centered or the patient-centered na mga sagot. Because nursing is not about you naman. It's all about your patients. Kasi diba, sila naman yung dahilan kung bakit tayo meron. Diba? So, maging advocate tayo sa health, pero we should always consider kung ano yung gusto nila. And we should help them. We should not impose our knowledge. Instead, we should only present para matulungan silang pumili ng tamang choice. Ang mahirap kasi kapag mas may alam tayo, inisip natin, tayo laging tama. So, dapat sundin nyo kami. And hindi okay yun, guys. Hindi mo sila i-manipulate, hindi mo sila i-gaslight. Okay? So, number 42, syempre, tanong nyo kung ano yung mapag-agrihan nilang dalawa kasi silang dalawa naman yung gagamit. Tapos, since yun yung napag-agrihan nilang dalawa, ibig sabihin, willing silang gamitin. So, you can ensure na may consistency sa usage ng contraception na pipiliin nila. The pill is the best. Siyempre, kung best lang naman, dun ka sa may sterilization or complete na pag-alis ng mga reproductive system. Condom is the best method. Hindi po guys, mababa. Mababa ang percentage ng condom para ma-prevent pregnancy. No method is completely effective. You should practice abstinence. Sana all. Gusto nga nilang magtalik diba? So, bigyan mo sila ng option para mabawasan yung risk para manganak. Risk ng pagbubuntis at panganganak. Number 43, Kathy asks Nurse Ashley about what would happen in case she gets pregnant after being sterilized. What should Nurse Ashley respond with? The answer here po guys ay it's letter B. Letter B dapat to guys, ectopic pregnancy. Kasi, di ba, kapag guys, number 43 is letter B ha. Ectopic pregnancy. Stamp. Kasi ang nangyayari dito, di ba, kapag nagkakaroon tayo ng sterilization, siyempre, it could be na tinatalian yung fallopian tube, ganun. Ang problema, kapag ovulation, so yung egg cell, siyempre, dadaan pa siya sa fallopian tube. Ang problema is, kapag narating siya ng sperm cell at na fertilize siya doon sa may fallopian tube, outside the uterus, it's outside the uterus implantation, or outside the uterus fertilization, it's considered ectopic pregnancy na. Kasi lalaki siya doon sa may fallopian tube. Diba? And it could put the mother at risk for bleeding, ganun, kasi nga lumalaki, fallopian tube, napakasikip. So wala naman siyang capability to how do you put this pa? To accommodate yung growing fetus kung sakali. Number 44, Number 44, Moses expresses concern on his sexual functioning and pleasure in sexual activities in case he undergoes vasectomy. What is the most appropriate response by Nurse Joe? Again, ano yung pinaka-empathetic dito, pinaka-patient-centered. Sabihin mo ba, what's more important? Your personal needs or your wife's happiness? Pinonsensya mo pa siya, di ba? Letter B, you will not lose your sexual ability. The pleasure will return after a year of recovery. Guys, it will not take a year for Moses to recover. It will only take maximum or minimum of 3 months. So 3 months pwede na ulit. Letter D, you don't need to get bothered by that there is more to life than sexual needs. Gusto nga niya, di ba? Gusto nga niya gusto nga niya ng vasectomy. So, bakit ka magbibigay ng ibang magbibigay ng ibang sagot? Ang ibigay mong sagot, kung ano yung tinatanong niya, kung ano yung hinihingi ng tanong niya. And that's letter C. Ba't mali ito? Oh? Kasi ano to? Letter C ito ha. Mali ba yun sa Google Form dito? Number 44? Letter C ito guys. Should be letter C. Letter C po, 44 letter C. You can have better sex since there's no fear that your wife will get pregnant. Letter C to guys, number 44. It is the only option that answers the question. Okay? So proceed tayo sa number 45. Number 45, Moses and Kathy asked about the effectiveness of condoms. What is the most important information about condoms? Should Nurse Ashley provide the couple? The best answer here is letter D. Always use Vaseline. Hindi ka gamit ng Vaseline guys kasi parang ang sakit naman. Parang di ba nakakatuyo naman yun kung sakali man. So painful yun para especially for Kathy. Letter B, apply the condom to the penis right before ejaculation. Okay lang na wala kang condom kung mag-ejaculation ka, as long as walang. The important concept here is yung penile vaginal contact. So pwede kang mag-ejaculate as long as walang contact sa vagina. As long as walang contact sa vagina. Letter C, you do not need a medical prescription for condoms. Tama naman ito, pero is it the most important information? The most important is letter D. Diba? Kasi kahit pre-cum lang yan, kahit very minimal na amount lang yan ng semen, it could make Kathy pregnant. So ensure na, before any penile vaginal contact, meron ng protection. So D is the best answer. Number 46. Yes, sir, masakit. Number 46. Kathy proceeds to ask Nurse Ashley if oral contraceptives have any side effects. What is the best response for Nurse Ashley to make? The best answer is letter A. Nausea, fluid retention, and weight gain. Guys, yung pathophysiology natin is it is related sa may raas natin. Related din siya sa may pituitary glands ating, especially sa may ating raas nga, sa raas. So, ang nangyayari kasi rito, di ba? Kapag nagtitake tayo ng contraceptives, yung estrogen, yung main cause ng fluid retention, sa mga nagtitake ng oral contraceptives. Ang nangyayari kasi rito, for example, kapag masyadong mababa yung estrogen mo sa katawan, usually, nagkakaroon ng fluid retention kasi nga, masyadong marami yung nabibigay na, masyadong marami yung napoproduce or napaprocess na ADH natin. That's why, naiipon yung tubig sa katawan imbes na ilalabas. Pero yung ganitong side effects naman ng contraception, guys, according sa my research ng NIH natin, hindi naman siya tumaas. So, syempre, kapag nagpo-proceed yung contraception, nawawala rin naman. Pero usually, ito lang talaga yung main reklamo, main complaints na nagtitake ng contraception. Fluid retention and weight. So, the best answer here is letter A. So, proceed tayo sa number 47. If Kathy would take progestin-only contraceptive for birth control, Nurse Ashley would entrust her to, ang answer po rito ay this is letter C. First of all, you take the drug every day, hindi every 5th and 30th day of each monthly menstrual cycle. You take it every day para maging effective. Use a barrier method of contraception for 4 months after starting the drug. Usually, itong mga 7 days 7 days, after 7 days, makikita mo na yung effect. Or hindi mo makikita pero andun na yung effect ng ating contraception. Pero, syempre, mag-take ka pa rin kung gusto mo ng 100% sure, mag-take ka pa rin or maglagay ka pa rin ng barrier method. Pero yung barrier method, usually needed lang siya for the first 7 days after your first intake of the oral contraception. Then after nun, you could remove the barrier method. Letter D, stop taking the drug if you experience a menstrual period. Again, hindi naman tatalab agad yung contraception, di ba? So continue mo lang. You trust the process. And at some point, darating ka sa point na hindi ka na mag-mens and hindi ka na rin mag-ovulate. So the best answer is letter C. Why should you wait for 3 months? Kasi guys, ang progestin, di ba? Progestin, responsible siya sa mga uterus natin. If you take POP or mini pill kasi ibang tawag sa POP, di ba? Numinipis yung ating uterus. So you also give time din para sa katawan mo to produce enough progesterone, natural progesterone, para yung uterus natin could become thicker and be able to accommodate the fetus for implantation. That's why C is the best answer. Para maging efficient yung thickness ng uterus kapag nagbalak na magbuntis ulit si mother. Okay? So proceed tayo sa number 48. In discussing para same kayong mag-take. Opo. Paano ka, opo. Parang kung same kayo nag-take, parang afternoon, parehas na kayong bottom. So number 48, in discussing basal body temperature with Moses and Kathy, which change would indicate probable ovulation? The best answer here ay, di ba, kapag basal body temperature, bababa muna ng mga 0.5 to 1 degrees Fahrenheit. Tapos after na bababa siya before ovulation, then after ovulation, tataas na siya or during the ovulation, slowly increase na siya to 0.5 to 1 degrees Fahrenheit. So bababa muna siya onte, tapos ovulation, tapos tataas siya. Yan yung ating basal body temperature. Number 49, moreover, if Kathy desires to use basal body temperature method for family planning, Nurse Ashley should instruct her to do which of the following. The answer I is letter B. Take her temperature at the same time every morning. So dito guys, kailangan pagkagising mo pa lang, kunin mo na agad yung temperature. It could be dito sa oral, it could be sa kilikili, take mo na agad yung temperature mo. Kasi nga, every movement you make could affect your temperature then. Could affect your metabolic rate. That's why you take it as soon as you wake up. So B is the best answer. Number 50. A 19-year-old nulligravid client visiting the clinic for a routine examination asks the nurse about cervical mucus changes that occur during the menstrual cycle. Which of the following statements would the nurse expect to include in the client's stitching plan? The answer here, guys, is letter C. 50 is letter C. Bakit? Kasi diba, kapag fertile si mother, the best differentiation that you could give the client sa kanilang cervical mucus would be egg white. So, kung ano yung consistency ng egg white, ganun yung consistency ng cervical mucus ni mother kapag fertile siya. It is abundant, it is clear, it is stretchy. So, it's letter C. Raw egg whites. And this helps para anong importance ng ganitong consistency ng ating cervical mucus? It is important para mas mapadali yung paglangoy ng ating sperm papunta sa egg cells ni mother. So this is usually caused by what hormone? Hormone estrogen. Estrogen peak. So proceed tayo sa number 51. 51, ito guys, medyo spin Barkley, yes. Spin Barkley test. 51, there are various definitions of health according to different sources. Murray stated that health is, ito yung mga questions guys na in-include natin. Usually kasi, yung sa amin, kapag CHN, all about sa community sa Philippines. So, syempre, yung mga concepts doon, about sa Philippines talaga. Pero of course, nag-include tayo ng mga ganitong type ng question, yung mga included yung mga idea or theory ng ibang nurses regarding CHN sa ibang bansa para mas maging familiarized tayo. Kasi hindi naman natin alam kung ano yung lalabas sa board exams. Syempre, hindi naman kung ano yung lumabas sa akin, hindi naman yun yung lalabas sa inyo. What if ganito yung lumabas sa inyo? So it is best to familiarize yourself sa mga ganitong concepts. Para kung pagkabasa nyo ron, hindi tayo manigas. Pagkabasa nyo ron, okay, alam kong hindi ko alam ito, pero alam kong familiar ito. So I can make a smarter choice. Diba? A smarter guess. So the best answer number 51 is, it's letter D. This is definition that was provided by Murray. Letter A is from WHO. Letter C is from Pander. Letter B is from RM. Okay, so proceed tayo sa number 52. Similar to health, there are various definitions of community. Sir, sorry. Opo, guys. Don't worry, hindi tayo, I'll make sure na hindi tayo mag-overtime. Number 52, similar to health, there are various definitions of community. According to Schuster and Joppinger, the community is, the answer here, guys, is letter it's letter D then. Because letter A is from Allender, letter B from Lundy and James, and letter C is from Clark. So proceed tayo sa number 53. 53, in 2013, Morer and Smith introduced two main types of communities. Which among the following is the best definition of phenomenological communities except? So negative na naman ang hinahanap natin dito. So kung hindi natin alam yung phenomenological communities, hindi rin natin ito masasagot. So define natin. Basically, ang phenomenological communities, ito yung mga communities outside the traditional communities. So for example, nasa UK yung mga nurses natin, may mga communities ng Filipino nurses doon. At yun ang example ng phenomenological communities. So, tama yung community that is functional. Tama rin yung refers to relational interactive groups in which the place or setting is more abstract. And tama rin yung refers to the setting where people share group perspective or identity based on culture, values, interests, and goals. Bakit mali yung letter A? Letter A kasi is included sa may ating geopolitical communities. When we say geopolitical communities, lagyan natin geopolitical communities, usually ito yung mga traditional. Yan. Ito yung ating mga traditional communities na usually makikita natin sa mga barangay natin sa Pilipinas. Ganyan. Tayo ay included sa mga geopolitical communities. Yan. So, screenshot natin guys. 3, 2, 1, and proceed na tayo sa next. Number 54. Number 54, which among the following best describes the difference between community and public health nursing? So the answer here, guys, is letter B. Ang main rationale dito is because the National League of Philippine Governments, sila yung mismong nagsabi na ang PHN should be funded by the government. So yun lang yung main differentiation. Yung main differentiation nilang dalawa. So the employer of the public health nurses is the government. Ito yung tamang sagot. Community health nursing refers to a service rendered by a professional nurse. Guys, pagdating sa mga ganitong tanong, ang best talaga dito is for you to familiarize. Ang kailangan nyo rito ay sabi natin little bit of luck kasi hindi man lahat madidiscuss. So ito yung mga tanong na, for example, kung ako mismo, hindi ko na i-expect na masagot, pero gagawin na ako ng lucky guess. So letter B is the correct answer. Proceed tayo sa number 55. Which among the following best describes a comparison between community health and community-based nursing? So the answer here, guys, ay it's letter C. Kasi pagdating sa community health nursing emphasizes health promotion and health preservation. Pagdating naman sa may community-based nursing, it is more on the treatment aspect of health. Now, pagdating naman sa CHN, ang primary client may community, tapos pagdating sa community-based nursing, ang primary client mo ay ang individual and ang family. That's why the best answer here is letter C. Ito, so automatic lang, itong mga letter A, hindi both. Kasi ang branch ng ganitong klaseng nursing, which has the community as its client or as its patient, ay community health nursing lang, CHN. Community-based nursing, basically BNB na, of course, yung kabaliktaran na nila. It is community health nursing, which focuses on preservation, and community health nursing, which focuses on family. Yes. Community health nursing na rin ang nagfo-focus sa community as clients. So proceed tayo sa number 56. The nurse is tasked to assist in the epidemiological investigation. Which of the following questions should the nurse or should the team ask first to guide them in the epidemiologic investigation? The answer here po is letter B. Are all of this due to the same disease? So this is part of the of verifying the diagnosis. Lagyan natin. Diba? When you, before any epidemiologic investigation, you always verify the diagnosis first. Yan. Part siya ng verifying diagnosis. And then itong letter C, is it prompt enough so that the cases reported to date represent a fairly accurate picture of the present situation? Part na to ng reporting natin. Yung reporting ay susunod sa verifying diagnosis. Reporting. Ayan. Usually yung second. Tapos, is there any unusual prevalence of the disease? Of the disease, usually ito na yung mga third na to. Yan. This is after you identify or verify the current situation first. Yung yung ating first option, is it reasonably complete? Ito ay part din ng reporting natin. First, so tandaan natin, first is we verify the diagnosis first, tapos we report, tapos after the reporting part, after the basics, we now proceed to the to letter D, finding unusual prevalences of the disease. Okay. So screenshot muna natin, guys. 3, 2, 1. Let's proceed na tayo sa number 57. Number 57. The multi-causation theory implies that each of its components must be analyzed and understood to predict and understand the pattern of disease. The following are true regarding the epidemiologic triangle exam. The answer here, guys, is letter A. Kasi dapat, it should be major, not minor. So, yun lang. Word change lang yun, yung naging result ko, or yung reason kung bakit letter A ang best answer. It should be major, not minor. Okay, so letter A is the correct answer. Proceed tayo sa number 58. Understanding the natural history of disease will help the nurse and the people institute measures to prevent pathologic processes from further evolving. The following are true regarding the stages of the natural history of disease, except the answer here po is letter B. When we say early signs and symptoms are observed to be developing, this is included sa may discernible lesion. So letter A, discernible lesion stage, included sa kanya yung letter B. Meanwhile, ito yung ito na yung pathogenic stage na. Yan. A and B, included sila sa may discernible lesions. Under sila ng discernible lesion. Itong advanced stages, yan yung third stage na. So, dito na nakikita yung ating mga pathognomonic signs and symptoms. Yung mga symptoms na specific lang sa sakit na yun. And then letter D, susceptibility, there are factors that favor the incidence of the diseases. Hindi naman yan yung tinatanong na ating question. So, letter B yung mali kasi it should be under discernible lesions. Okay? This time, what I meant is letter D. Tama naman yung definition niya. So, pakisya yung mag-game. Hindi siya yung negative. Okay, so screenshot muna, guys. Tapos, proceed na tayo sa number 59. Yan. 3, 2, 1. Clear. Yan. Punta tayo number 59. Number 59, the epidemiologic approach consists of 4 phases: descriptive, analytical, intervention, and evaluation. The following are true regarding the epidemiologic research, except the answer here is letter D. Bakit letter D? Because kapag sinabi mo nang look for previously unidentified case of diseases, this is all about case finding na. Diba? This should be case finding. Case finding. Kapag sinabi mo screening is for yung mga recent na reports lang ng disease. Pero when you look for previously unidentified cases na, we are talking about case finding. So D is the correct answer. So screenshot po natin, 3, 2, 1, and number 16 na po tayo. Yeah. Number 60. The Henle-Koch postulate states that a cause of the disease is any event, condition, characteristic, or combination of these factors that play an important role in producing the disease. The following are true regarding the concept of causality and association, except the answer here, guys, I letter C. The concept of association implies a causal relationship. Again, guys, when we say association, it does not necessarily mean na may connect yung dalawa. Na yung variable B is caused by variable A. Doesn't always go like that. When we say association, it could be that both of them exist at the same time. And yun yung concept ng association sa kanilang dalawa. Kasi they're existing at the same time. They may not be directly connected, pero yung existence nila, yung concurrence nilang dalawa, that's the important term that you need to take note of. The word concurrence. Association can also mean concurrence din. Meaning, nag-exist yung dalawang fact or yung dalawang variables at the same time without having any direct relationship with each other. Okay? So, yun yung main point ng ating letter C, ng ating number 60. It's letter C. Yun yung mali. Okay? Hindi porket associated silang dalawa ay may causal relationship na sila. Not always that way. Okay. So, proceed na tayo sa number 61. 61, as a public health nurse, Martha is aware of the core principles of community organizing, which is first and foremost, the answer here, guys, is letter D. Again, the option D is the most patient-centered answer. People are the means and ends of development. Kasi diba, we are establishing self-reliance. So dapat, yung mga tao mismo, kung ano yung development na gusto nilang marating, yung development na gusto nating ma-achieve nila, ma-receive nila, dapat sila rin yung mismong primary involved sa pagkamit neto. Because that's self-reliance. That's establishing self-reliance. That's why D is the best answer. Okay? So, proceed tayo sa number 62. Ito, guys, rewording lang ng self-reliance. And then when we say, community empowerment, community empowerment is the process and the outcome. So, basically, kinda interconnected. Okay, so proceed tayo sa number 62. Number 62, Martha and the community are said to be in the entry phase of COPAR. She is considered to be implementing the following except, ano ba yung hindi kasama sa entry phase dito? It's letters. Kasi ang ocular survey ay ginagawa sa pre-entry phase. Hindi ka naman pupunta sa mismong lugar na hindi ka pa nagpe-pre-survey. Pagpasok mo ron, hindi ka pwedeng nangangapa-ngapa sa lugar. So at least dapat may idea ka na sa pupuntahan mong lugar para yung integration mo sa community ay mas mapadali. And parang welcome ka sa community, guys. Hindi, guys. Guys, yung mga ganitong type ng questioning kasi, ito yung mga mahihirap talaga. Pero, hindi kasi pwedeng sa kanyo lang ma-encounter yung mga ganitong klaseng type ng tanong sa mismong board exams na. Kaya binibigay natin ito ngayong recalls para ma-familiarize kayo, para hindi kayo magulantang kapag mismong board exams ng mga ganito. So, mas okay na mahirapan kayo ngayon. Marami bang ganitong tanong, sir? Sa NP1 sa amin noon, hindi masyado. Basta, ang mahalaga, mahirapan kayo ngayon. Yun yung mahalaga, mahirapan kayo ngayon para, hindi nyo kaya for the, ano tawag doon? Sa dista pala. Para pagdating sa board exams, mas madali na. Okay, so proceed tayo sa number, NP1, pagdating siguro sa board exams, may kita nyo parang, sana madali yung NP1 sa inyo. So proceed tayo sa number 63. 63, Martha knows not to consider the two strategies for gaining entry in the community that are said to be counterproductive. According to Manalili, as cited by Famorca, the strategy that is seen as the easiest way to gain the approval of the community is, this is letter A to guys, Bongga. Bongga community or Bongga entry is basically you're exploiting the wants, guys ha, wants, kung ano yung kagustuhan ng community, kung ano yung weakness nila. So, for example, kung yung community ngayon kulang ng bigas, so magbibigay ka ng bigas para magustuhan ka nila. And hindi maganda yun, guys. Kasi yung establishing mo ng rapport with them, with that, using that kind of entry, hindi siya nagbi-build ng connection. So, nagbi-build lang siya ng supply and demand, kumbaga, supply and demand na type of relationship lang. Kaya kapag wala ka nang maibigay, ano na lang tingin nila sa'yo, di ba? So, bongga yung sagot dito sa 63. Ang padrino naman, padrino talks about, yan, padrino talks about yung ano, ito yung when you help when you ask for someone with authority na tulungan ka to enter the community. That's padrino. Kaya sa sponsorship, hindi siya kasama dun sa dalawa. So the answer here is letter A. Screenshot nyo na guys. Clear ko na in 3, 2, 3, 2, 1, and pop. Proceed tayo sa number 64. 64, Martha, being a PHN, knows the different styles of integration according to Manalini. The integration style that refers to visiting the community per the schedule but is not able to transcend the guest status is? The answer here, guys, is letter C. Now you see, now you don't. Isa-isayin natin ha. Border, from the name itself, border. Sila yung mga literal na tumitira sa community. Excuse me po. Kapag elitist naman, sila yung mga sip-sip, yung mga may kapit. Yung mga gustong nakiki-associate sa mga people with names, people with authority sa community. Sila yung mga elitist, kaya elitista. Kasi gusto nila, may connection sila, may kapit sila sa mga matataas. Now you see, now you don't. Ito yung mga nagpe-perform naman ng home visits. Ginagawa naman nila yung trabaho ng community health nurse. However, hindi sila nakaka-establish ng rapport sa patients natin. They perform health teaching, ganito ganyan, nagsasalita sila, ganun ganyan. Pero hindi naman naiintindihan nung family. Hindi naman naiintindihan ng community, 'di ba? Para for example, tayo kapag may mga naglalakad ganun, tapos may mga missionaries, 'di ba? Sabi, pwede po ba namin kayong basahan? Tayo, oo naman tayo ng oo. Hindi naman natin talaga naiintindihan. Hindi naman natin iniintindi. It could be, that is one example of now you see, now you don't. Because they perform their role. However, hindi sila naka-establish ng rapport. Kumbaga, pagkaalis sila sa community, stranger pa rin sila para sa community, para sa family. Diba? Yun yung tingin pa rin ng community sa kanila. So, proceed tayo sa number 65. Martha uses informal conversations to be able to integrate around the community. This is referred to as, guys, this is huntahan. So, huntahan is basically parang you go where the community goes. Parang you join the community sa kanilang social routine, social practices. For example, may mga nagchichismisan sa tindahan, may common poso yung barangay, may mga magulang doon, may mga nanay doon na naglalaba, tapos sasama ka sa kanila, may kipagkwentuhan. That's huntahan. That's an example of informal conversation. Kasi sa ganung instances, you are not there as someone na sabihin natin community health nurse. You are there as someone na, yes, you're a nurse, pero you're doing what they're doing. So basically, yung ginagawa mo is you're involving yourself sa ginagawa nila. Hindi kagaya ng participation in the production process and participation in social activities. All of these are formal kasi these are under sa main tasks mo as a nurse. Pagbabay-bahay naman is formal then. And it's a usual routine of community health nurses. It's what you do. It's part of your nursing responsibilities. Huntahan is the only informal option here in the options. So the answer is number 65. So tayo sa number 66. Martha is currently developing the management systems and procedures, including the delineation of the roles, functions, and tasks of officers and members of the community health office. She is said to be in what phase of co-par? The answer here, guys, is letter A, community organization. Diba? Dito mo pinuproduce yung team mo, yung leaders mo. So, since meron ka ng core group, ibibigay mo na kung ano yung mga trabaho mo sa kanila. Hindi naman siya community diagnosis kasi community diagnosis pertains sa kung ano yung main problems ng community as identified by the community. That's what community diagnosis is. Entry is yung included dito yung mga community calls. Ganun. Tawag doon sa call na yun? Nakalimutan ko na. Basta yung papatawag kayo ng barangay. Courtesy call, sorry. Ang community action naman is yung literal na implementation na ng yung action plan. So the best answer in number 66 is community organization. Part to ng diba kapag after na may core group ka na, syempre, this is part of organizing na your core group. Para alam nila kung ano yung role nila sa community. Proceed tayo sa number 67. 67, Martha is conducting a team building phase and the action reflection action. She is said to be in what Cooper phase? Again, kapag in-establish mo pa lang yung integrity ng yung core group, this is still included in the community organization phase. When we are talking about the core group and we're delineating tasks and making sure that the core group understands its function and is developing the bond that they have in order to work cohesively as a team in the community, that's part of community organization. So the best answer is letter A. Okay, so proceed tayo. Yes po, courtesy call. Thank you. Proceed Spanish word for chismisan. Let's go, huntahan. Thank you po, Ma'am Adet. So proceed tayo sa my question number 68. Martha is in the initial identification and implementation of resource mobilization scheme. She is said to be in what Cooper phase? So andun na yung keyword natin, guys. Oh. Identification and implementation of resource mobilization scheme. So when you implement, letter D, you already act. That's why it's letter D. So ganun lang yung rationalization natin, guys. Look for interrelated words sa may situation and sa option natin. Okay, so proceed tayo sa doggy. Proceed tayo sa number 69. Martha is formulating and ratifying the Constitution and bylaws. She is said to be in what Cooper phase? When we already include yung ating mga LGU, yung ating mga government na natin, and mga batas, we're already strengthening our action plan or our mobilization scheme. That's why the answer here is sustenance and strengthening. So we do this para we make sure na masustain ng community yung project natin, yung action plan natin. Na kahit umalis na tayo sa community, nandun pa rin yung help from the linkages that we have created and tuloy-tuloy pa rin yung action plan natin. So C is the best answer. Now proceed tayo sa number 70. Martha, with the local researcher, is now prioritizing the community needs and problems for action. So kagaya ng sabi natin kanina, when we talk about the community's needs and actions, it will be all about community diagnosis. So kapag community's needs, community's problems, community's complaints, it talks about the diagnosis na. It's letter D. So number 71, IMCI. Guys, walang IMCI sa amin noon, pero malay natin magbigay sa inyo ngayon. Pero hopefully wala, kasi napakarami ng IMCI. So proceed tayo sa IMCI, guys, ha? Excuse me po. IMCI number 71, the IMCI guidelines, which are based on expert clinical opinion and research findings, are intended for the management of. The answer here po is letter A. Yung ganito, guys, nasa mismong copy natin ng IMCI, yung color green, nasa harap niya. It's all about, yes, it's letter A. All about sick children aged 1 week up to 5 years. So proceed naman tayo sa my letter number 72. Ratify. Yes po, thank you, Ma'am Abigail. Ratify, yes, making valid po under the law. Number 72. Sasha is a child who has had a chronic cough and difficulty breathing for more than 30 days na. This could be indicative of, guys, yung mga sagot dito nasa IMCI booklet. So this is already asthma or bronchitis. So syempre hindi na natin ma-argue ito kasi yun yung nilagay ng WHO. So by the guidelines. Number 73. In some cases, especially when a child has wheezing when exhaling, the final decision of the presence or absence of fast breathing can be made after a test with a rapid-acting bronchodilator. All but one is true in the care of a child with wheezing. So, ibig sabihin, all but one is true. So, lahat daw tama except yung isa. Ang hinahanap mo dito ay yung mali. All but one is true pertains to the wrong answer or the wrong option. At ang mali dito ay letter D. Mali ang letter T, bakit? Kasi kung under 5 years old pa lang, kailangan may spacer siya. Kasi spacer helps the child or helps for the medication to be delivered directly sa ating respiratory system. So, syempre kapag bata, hindi pa sila masyadong maalam sa kung ano yung gagawin. Hindi pa sila masyadong masunod sa kung ano yung process. Paano mag-inhale ng medication. Paano mag-inhale ng bronchodilator. That's why we give spacers kapag under 5 years old. So, the answer here, guys, is not letter D. Number 74. Baby Jopet is reported to be having loose stools for 4 days, making her mother bring him to the health center. So, upon assessment, he was observed to have sluggish behavior and does not readily respond to touch. Joseph is classified as a severe dehydration case. The preferred IV fluid to be administered is, the answer, guys, kapag cases ng dehydration is letter D. D. Ringer's lactate solution. Bakit? Also, syempre, dito, kung walang Ringer's lactate solution, you give IV fluids na isotonic din. So, kagaya ng plain normal saline solution. However, mas preferred lang ang RLS kasi it lessens the risk of metabolic acidosis. Unlike yung ating normal saline solution. So, nagsusolve ka ng dehydration, di ba? Of course, doon ka na sa best option. But mo pipiliin yung, as much as possible, piliin mo yung best option para maiwasan natin yung metabolic acidosis, which will cause more complications pa sa bata. So the best answer, guys, ay Ringer's lactate solution. Kung walang Ringer's lactate, edi piliin natin yung next best answer, which would be yung PNSS natin. So number 75, Nino, a child also brought to the health center, has been experiencing diarrhea for 6 days. There is no blood in the stool, he is irritable, and her eyes are sunken. The nurse offered fluids and child drinks eagerly. So, ang classification nito, guys, ay letter B, some dehydration. According sa criteria natin sa my IMCI. Next po, number 76, Nino was reported to have no blood in his stool, but in cases where blood is found in the feces of the child, the recommended antibiotic for bloody diarrhea management is, guys, the answer dito ay, it's letter A, ciprofloxacin. So, ciprofloxacin is used for, ano ba yung bloody diarrhea, guys? Diba? It's dysentery. Cotrimoxazole usually this is for pneumonia. Metronidazole for parasite invasion. So proceed tayo sa number 77. 77, along with increased fluids and continued feeding, all children aged 2 months up to 5 years with diarrhea at home should be given what? They should be given zinc supplementation kasi zinc helps in the absorption of fluids and electrolytes. So since may diarrhea yung bata, mataas yung probability na siya ay may dehydration. That's why you give supplementation of zinc para ma-relieve yung kanyang dehydration. So the best answer ay letter B. So number 78. Tofi was visiting Barangay Quito, known to be endemic with malaria. One of the children, Kala, brought to you has a temperature of 38 degrees Celsius, lethargic, and resistance is noted on neck flexion. Guys, yung ganito, this is a case of very severe febrile disease or malaria. So, tingnan natin guys endemic na ng malaria. So, doon na tayo sa endemic na ng malaria, tapos feverish pa siya. So, it's letter C, according sa criteria natin sa IMCI. Number 79. Appropriate interventions for this case of Kala in the previous question are, the answer po is letter C. Letter C, 1, 2, 3, and 5. So, according sa IMCI guidelines natin, guys, ibigay na natin yung first dose ng kinin ngayon. Then also, magbigay na rin tayo ng appropriate antibiotic. Tapos, we would also refer her to the hospital. And since may lagnat siya, we also give paracetamol to lessen din yung probability na siya ay magkaroon ng seizure episode. So, the answer po is letter C. Number 80. In malaria risk areas, when a child presents with fever but no runny nose, no cough or other possible cause of fever, he or she may be classified as malaria risk area na siya po. So it's B na, malaria yellow. Okay, so proceed na tayo sa number 81. 81, Miss Bell and the 4 staff nurses are considered which of the following? May situation pala. It's important to read the situation dito sa numbers na ito. Miss Bell and 4 other staff nurses are subjects of an administrative case filed with the Board of Nursing because of malpractice. The relatives claim that there was failure to render proper nursing management when the client was having asthmatic attack. So, since sina Miss Bell and yung 4 staff ang narareklamo, they are called respondents. Respondents are also known as the appellee. Appealing. So, other terms kanila ay appellee. Hindi sila accessory, guys. Kasi ang accessories, ito yung mga, yes, it involves sila sa commission ng crime, pero wala silang hands-on. Yung mga accessories, usually, hindi sila hands-on na tumulong. Di ba, sina Miss Bell na mismo at yung 4 staff nurses, ang mismong nirereklamo kasi sila daw yung mismong hands-on nurses or personal nurses ng pasyente during that time. So they are respondents. Companies tawag lang sa mga tumulong. Ang problema dito sa question natin, lahat sila ay main propagator kuno nung malpractice. So they are called respondents. Complainants ang tawag dun sa pasyente na nagreklamo. Okay? So proceed tayo sa number 82. Part 2 ng guys ng Palmer. And maganda i-familiarize yung sarili niyo sa mga questions. 82, during the investigation, it was decided to call the nursing assistant to testify what she knows about the case. Kapag ang hiningi sa nursing assistant ay kapag sila mismo yung pinapunta sa may Supreme Court, sa may hearing to testify, kapag tao mismo, ang tawag dun ay subpoena ad testificandum. Unlike sa may subpoena duces tecum, duces, documents, ibig sabihin yung notes na ang hinihingi ng Supreme Court. Supreme Court or basta ng ating korte. So 82 is letter D kasi yung mismong nursing assistant ang pinapapunta. So it's the tao. Number 33, the patient who filed an administrative case against the nurses are considered which of the following? So since sila yung nag-apply ng kaso, sila yung nag-complain, ibig sabihin, ang tawag na sa kanila ay complainant. Kina Miss Bell, another term na pwedeng tawag sa kanila would be defendant. Okay? Pero since dito sa 83, ang hiningi ng question, anong tawag sa nagsampa ng kaso, tawag doon ay complainant. It's letter D. So 84, together with the nurses, the doctor assigned to the patient was sued. Sabi dito, what legal order will the hearing officer have to issue to compel the doctor to bring the patient's chart? So it's part of the medical documents of the patient. So duces tecum, it's letter C. 34 is letter C. Number 85, if found guilty of negligence, the Board of Nursing will most likely, isa-isay natin, sentence her for life imprisonment. Mali na yun kasi hindi naman sila magbibigay nun. Subject her to a 5-year imprisonment. Hindi rin ito, guys. Demand a 40,000 pesos fine. Hindi po ito. So, ang answer dito, guys, ayon sa Section 23, revocation and suspension of Certificate of Registration of Professional License, ang answer dito ay revoke lang nila. I-revoke nila yung license ni Miss Ba. Kasi administrative case. So, it's letter B po. Revocation of the license. Proceed tayo sa number 86. 86, active or positive euthanasia is the intentional termination of a patient's life. Which of the following is an example of, which of the following is positive euthanasia except? So, positive euthanasia, ibig sabihin, you were active in inducing the death. So, may ginawa ka. So, tignan natin yung choices. Administering a criminal substance. So, may ginawa ka kasi you administer. That's your intervention. That's your action. So, part siya ng active or positive euthanasia. Letter C, removing life support. So, may ginawa ka pa rin. Kasi literal na inalis mo nga. So, yun yung action mo. Inalis mo. So, you acted by removing the life support. Letter D, prescribing an agent that would result in death. So, you prescribe. That's part of the action then. That's part of the part of active euthanasia. So, the best answer is letter C. Kasi andun na mismo yung yung word guys, not doing CPR. So wala kang ginawa. So you were being passive while namamatay yung pasyente. So the correct answer is letter B. Kasi ang hiningi ng tanong, ano sa mga choices ang hindi kasama sa positive euthanasia? Of course, you will pick the option na wherein you were passive during the procedure or during your contact with the patient. So the answer is letter B. Proceed tayo sa number 87. For the first time, the Philippine Human Rights Commission recommends that abortion be decriminalized. Which of the following abortion statements is correct? So, alin ba sa mga options na ito ang correct, guys? Isa lang naman ang correct dito eh. It is letter D. Abortion is absolutely illegal in the Philippines. Kasi wala pang abortion dito, guys. So, yun lang naman yung sagot dito. Yun lang yung explanation na meron. Ito lang yung tanging option which pertains or which answers the question. So proceed tayo sa number 88. The subject of organ transplant is one bioethical concern that has recently emerged in the country. An organ, such as a kidney, that is to be transplanted may be taken only from the donor if the correct answer is letter B, kapag brain dead na yung pasyente. Kasi that's the ultimate, yun na yung ultimate, kumbaga, sign para malaman na hindi na gumagana yung katawan ng pasyente. And na pwede na nating ibigay, pwede na siya for transplantation. Okay, so, yun naman usually, di ba, yung inaano nila. Kapag brain dead na yung pasyente, pwede na ibigay yung kanyang organ sa mga mas nangangailangan. So, yun yung criteria. Number 89, sasabihin natin, sir, di ba kapag wala naman ng pulse, walang respiration, patay na yung pasyente, of course, oo rin naman. Pero ang best identificate or ang best, anong term ba yun? Ang best na mag-identify or ang best na magsasabi for the patient na hindi na talaga gumagana or hindi na talaga kaya nung katawan niya on her own to survive would be the evidence of being brain dead na talaga. It's letter D. It's the best best sign na hindi na kaya ng katawan or na total nag-shutdown na yung katawan niya. 39, it is best for a nurse whose personal philosophy is contradictory to birth control measures to do which of the following. Again, papasok dito yung idea or yung konsepto na dapat patient-centered tayo. We should be advocate ng mga patients natin. Hindi yung ini-impose natin kung ano yung kagustuhan natin. So kapag hindi nagtutugma yung ating philosophy sa ating pasyente, we must recognize their rights. And we must acknowledge na hindi, yung alam natin, hindi palaging parehas sa kanila. Sa ganitong paraan, may iwasan natin yung pagiging invalidating and mas mafulfill natin yung right as patient advocates. So A is the best answer. This is the most compassionate answer. Most compassionate, most holistic, most empathetic answer. And most patient-centered answer, most important. So proceed tayo sa number 9. Which of the following factors have increased ethical decision-making problems for nurses? It's letter C. Letter C, bakit? Kasi it's more of the more umbrella answer. As we all know, ethics is related sa morality. So kung ano yung So kung ano yung alam natin, kung ano yung piniperceive natin na tama at mali, naapektuhan na to yung ating ethical decisions. That's why kung iba-iba tayo ng moral standards, iba-iba rin tayo ng ethical principles na nagagawa. That's why very important na as nurses, yung moral standards natin dapat talaga very patient-centered and kailangan upright talaga based sa standards natin. And we should not let yung ating preconceived or yung ating upbringing or ating mga preconceived moral standards na makaapekto sa ating ethical decision making natin kasi hindi naman natin buhay yun. It's the life of the patient. So we advance what they want. That's why letter C is the most complete or best answer, most related answer when it comes to ethics. Number 19. Caring is the most important duty of a nurse. This is demonstrated when a nurse, letter B, listens. So, kung titignan natin yung sequence, letter B follows the concept of ADPI. Inuuna niya mag-assess muna, mag-plan, ini-ensure niya na pinapakinggan niya kung ano yung gusto ng pasyente bago siya gumawa ng action plan. Unlike sa option A kasi nag-implement siya agad without even assessing. Diba? Masyadong mabilis. Letter C naman, nagplan na agad siya without even assessing. So, paano ka makakagawa ng nursing care plan na walang assessment? Sa letter D naman, nag-assess nga siya, pero nag-evaluate naman siya agad. Anong i-evaluate mo kung wala ka pang intervention? So, the best answer is letter B. Number 92. Which of the following is a process in nursing which determines and maintains competence and professional growth the most? Guys, ang number 92 natin is letter B, credentialing. Credentialing may only because it is, again, the most complete answer, or it encompasses all of the options. It is an umbrella answer. Maintaining clinical competence, pasok yun sa credentialing. Diba? Ba't ka ba kumukuha ng clinical competence? Para kapag nag-apply ka, yung credentials mo maganda. Paying annual PNA membership fee, of course, part yan ng ating professional. Nakalagay yan sa may, yung para sa nurses, basta part yan ng ating professional responsibilities to join PNA. Also, seeking certification for clinical practice, all of those are for you to have good credentials. So letter B is the best answer. 93. Which of the Anne is reading the guidelines for the admission for licensure examination for nurses? To qualify, she must meet the following. So the best answer here, guys, is letter C. Option 1 ay mali dahil, dahil mali yung at least 19 years old. Kasi nga, as early as 18 years old, pwede ka na. So, matik canceled na agad yung number 1. Number 3 is mali dahil you don't need 1-year clinical experience after BSN graduation bago ka maging deemed na pwede ka mag-take ng board examination. So, pagka-graduate mo, pwede ka na mag-take as long as napasa mo ng required documents. Hindi necessary na may clinical experience ka pa ng 1 year after your graduation. So, C is the best answer, 2 and 4. That's under section 13 naman, or the qualifications for admission to the licensure examination. Nursing Act. Number 94, after passing the board exam, the nurse shall be required to, it's letter B, enter the social contract, enter into a social contract. Social contract, it encompasses oath-taking. Social contract basically means you are giving your word and tinataya mo yung pangalan mo to do what a professional nurse must do. So, pasok dito yung oath mo. Yung Nightingale's pledge natin, yung oath natin as professional nurses, dapat you enter into a contract na gagawin mo yun, na susundin mo yun sa totality ng practice mo. A, of course, pwede naman ito, pero hindi ito requirement. This is personal decision. C, fulfill registration. Ginagawa mo to after oath-taking. And ang oath-taking nga, di ba, part ng entering into a social contract. So, you first oath-take mo na bago ka magkaroon ng PRC license. Bago ka mag-practice. C and D, almost similar lang. So, ganoon naman sa board exams, kapag may almost similar questions and almost similar options and hindi naman sila humingi ng SATA answers, of course, i-cancel out na sila. Number 95, an examinee who obtained an average of at least rating of 75% or higher, but with a rating of below 60% in any subject shall be required to take the examination again, but only on subject where he or she is rated below 60%. Dapat i-take niya yung examination on or within its letter A po, within 2 years after the last field examination. So, no other rationalization dito kasi ito yung nakalagay sa ating batas. Shall be taken within 2 years after the last field examination. Of course, para naman syempre, hindi magandang immediately kasi mapapagod naman yung estudyante. Give her time to regain her confidence. Give her time to also review them para make sure na sa next na take niya ay mapapasa na niya. So that's basically the concept or the thought process why letter A is the best answer. For number 96, to be a military nurse. Sino ba yung may gusto rito maging military nurse? So here are the criteria for judging. To be a military nurse or to be a member of the Philippine Army Nurse Corps, a nurse must be letter B. 1, 2, 3, 4, 5, and 7. Bakit mali yung 1, 2, 3, 4, 6, and 7? Bakit mali yung option 5? Mali yung option 5 kasi ang minimum height na nire-require ng PMA ng ating Philippine Army, ng ating Philippine Army ay 5 feet. Diba? So, as long as 5 feet ka, 5 feet pataas, and meron ka ng options 1, 2, 3, 4, 6, and 7, pwede kang maging military nurse. So proceed tayo sa number 97. The nursing graduating students are wondering who would be the next dean of the College of Nursing among the faculty. The dean of College of Nursing must be a Filipino citizen. And ano ba yung criteria to be a dean ng College of Nursing? Filipino citizen and A, and dapat siya ay registered nurse sa Philippines. B, at least 1 year ng clinical practice sa isang field of specialization, guys ha. Tandaan niyo yung field of specialization. Number 3, dapat good moral standing din siya and part siya ng Professional Organization of Nurses, so PNA. Also, letter D, dapat meron siyang master's sa may nursing and also sa may other health sciences, allied health sciences. And then most importantly, dapat meron din siyang 5 years experience sa clinical nursing. So kung titignan natin, mali yung letter A kasi 5 years teaching experience when it should be 5 years clinical experience. B ay mali rin kasi 6 months clinical experience ay kailangan niya 5 years clinical experience. C ay mali rin kasi hindi naman necessarily na MD graduate siya. Okay? And kahit 10 years pa siya ng nursing practice or experience, kung wala naman siyang 1 year clinical experience and wala pa siyang masters of nursing or other health allied courses, hindi rin siya pasok. So the answer is none of the above. Number 98, ano yung nagbibigay ng nursing specialty sa Philippines? This is provided by Nursing Specialty Certification Council. Lagay natin. NSCC basically means Nursing Specialty Certification Council. Yan. Sila yung nagbibigay ng specialty certification dito sa Philippines. Yan. Screenshot po natin. 3, PRC, BON, PNA, alam na natin lahat yan. So, Philippine Regulatory Commission, Board of Nursing, Philippine Nurses Association. Okay. So, proceed na po tayo sa number 99. Yeah. 99. The leading causes of lawsuits against staff nurses are related to basic and common nursing procedures. How can similar lawsuits be prevented? Also, of course, you must always follow the standards, nursing standards, yung ating mga evidence-based practice. Sabihin na natin, sir, bakit mali yung hospital policies? Di ba, according to hospitals naman. So, hindi ba standards din yun? Yes, tama naman yun, guys. However, iba't iba ang mga policy ng hospital. So, in general, we must always follow kung ano yung mga standards na sinusunod ng lahat. Di ba? And that's letter C. That's why C is the best answer. And lastly, number 100, aside from a competent adult, who else can legally give their consent for healthcare? So, tingnan natin guys, somebody holds a durable power of attorney. Of course, tama na to. Pero when we say durable power of attorney, doesn't necessarily mean na dapat attorney ka ha. It only means na yung pasyente gave you the right to make the decision for his or herself given or with the help of an attorney. Yun yung durable power of attorney. Number 2, a married Muslim woman, of course, meron siyang karapatan na magbigay ng consent. Bakit naman wala? She's already a woman. So she is of legal age na siya when we term someone as woman. Okay? Option 4, parent of a minor child, of course, pwede. Number 3 is wrong. So ang answers lang dito sa 100, ang pwedeng magbigay lang ng consent ay 1, 2, and 4. Mali ang mature minor. Bakit? Pwede siya magbigay ng consent only and only if meron siyang assent na inaprubahan ng ethical committee. That's why hindi included ang number 3. Okay, so that's basically our NP1. So mag-break lang tayo ng at least 5 minutes. Tapos saka tayo mag-proceed sa NP2, guys. Okay? So kung meron tayo, ano po number? Kung meron po tayong hindi maintindihan, type nyo lang po tapos balikan po natin yan. So break tayo 5 minutes, guys. Balik tayo ng mga 4:34, 4:35. Start na tayo. Marami po ba sa tanong tayo? Wala masyado, guys. Wala masyadong sa tanong tayo. Wait lang, guys. Mag-CCR. Wala masyadong sa atin. Depende pa rin talaga sa inyo. Ang marami sa amin noon yung exact. Kaya parang siguro hindi masyadong komplikado yung pagpili ng sagot. Exact. Hello po, Ma'am Kai Ma'am Kai Rizal. Tama po, Ma'am Kai Rizal. Magbabalik po tayo ng 4:35. So, pwede po tayo mag-break naman actually. Pwede po tayo mag-break habang nagdi-discuss tayo. So, working break. So, ilan po scores nyo during pakibalik po sa may NP1. Hindi bali po, Ma'am. This. Ma'am Kai Rizal, may breaks po tayo in between mamaya. Ano po natin yung 15 minutes para hindi po masyadong matatag. Ano dito? Covers for NP1. Ah, hindi pa naman. Oh, ano? Ito na po. Ilan scores ko po? Recalls. Usually po mga 60 to 70, ganun po. 60 to 70. Hindi po masyadong tumataas doon. Ewan ko yung, nakakababa po talaga ng confidence kapag ganun yung scores. 60 to 70, tapos yung iba nakakakuha ng mga 80, 90, ganun po. Okay na po ba, Sir Neil? Okay po. Proceed na tayo sa may NP2. NP2. Okay po. So, proceed na tayo sa NP2, which is ang tanging ina nating lahat. May mga mother dyan pagdating sa mga Chinese garter. Ito na po yung ano natin, specialty. Maternal and child nursing. NP2. Mga mima nating magaling mag-Chinese garter. Let's go. Okay po. So, proceed tayo sa NP2, guys, ha? Guys, nung sa amin, yung NP2 namin, maraming pedia. Developmental stages ng pedia. Kaya nung nag-answer ako ng NP2, parang, medyo nawalan ako ng confidence. Kasi, ang top rank noon, nagpo-focus more on sa ano sa mother. Yung sa review namin noon, more on sa mother. Or hindi lang talaga ako nakinig sa pedia noon. Kasi bandang una-una yung pedia. So, nakalimutan ko na, guys. So, medyo kinabahan ako. Nung NP2 na, parang yung chances ko para mag-top numbers, parang 60%. 60% na lang. So, medyo tinanggap ko na nung time na yun. Pero, tingnan natin sa inyo, guys. Hopefully, either, depende kung confident kayo sa pedia, edi good for you guys. Pero kung hindi, this is the time para mas ma-practice pa natin. Number 1, Renz and Richa, who just had their first baby a month ago. Am I NP3 sir? Nahirapan po kayo. Sakto lang po. Ang pinakamababa ko pong rating ay NP5 po. Akala ko doon ako pinaka mas madadalian or doon ako most confident sa NP5. Pero surprisingly, yun yung pinakamababa. Pero hindi naman po ako nagtaka kasi marami rin po talaga hindi alam sa NP5. So, medyo tanggap ko naman po yun. Kasalanan ko po yun kasi nagpaka-complacent ako. So, that's important yung guys ha. Kailangan maging confident kayo pero do not let yourself to be complacent po. There's a very big difference between confidence and complacency. Be confident, not complacent. So NP2, number 1, Renz and Richa, who just had their first baby a month ago, asked Nurse Ray on how they can meet the basic needs of baby Eri. Based on an understanding of Erickson's stages of psychosocial development, Nurse Ray would tell them to, it's letter D. Kasi according to Erickson, this is on what? Ano yung task nito? Ano yung kailangan nilang ma-develop? Diba? It's all about trust versus mistrust. So dito sa options, alin ba sa options yung mas well-rounded? Alin yung mas holistic? Yung na-provide lahat para pagkatiwalaan ka nung infant. And that's letter D. Attend to the infant's need for comfort, security, predictability, and warmth. Number 2, after 3 years, Renz and Richa told Nurse Ray about how their daughter Eri has been rebelling constantly and having temper tantrums. Using Erickson's psychosocial development theory, which instructions should Nurse Ray provide Eri's parents? Select all that apply. Guys, ang answer dito ay letter A. Only A and D. Bakit? Letter A, set limits on the child's behavior. So, gone are the days na when we ignore yung mga behavior ng child natin kapag nagtatantrum sila. Kasi, what if, for example, kung yung tantrum ng child involves hurting thyself na. For example, nagdadabog na sila ng ulo sa may pader. Sabi nila, di ba? Edi, is it still safe for the pedia? Hindi na. So you do not ignore that. Or you do something na. That's why you set limits. Di ba? Kasi nga guys, it's giving. Di ba? So you set limits. Kasi kahit na bata sila, kahit na pedia sila, they can understand, okay? As long as yung ating explanation, yung ating limits, na we tell them in a way na maiintindihan nila. Di ba? And we should always be patient sa ating mga pediatrics. Okay? So A is tama, B is mali, C, allow the behavior. Mali rin ito kasi it's basically letter B. You're being passive. Ignoring the child when his behavior occurs is basically you're allowing it. So it's the same concept. And it's mali na to. Kasi kung mali na ang B, of course mali na ang C. D, provide a simple explanation of why the behavior is unacceptable. That's very important, guys. It's very important na you communicate with your pediatrics. So kapag may mga options na ganito, or may mga tanong na ganito, and may options na may options na you communicate with the pedia in a way na they understand, yun yung pinakamagandang sagot. Isa sa mga pinakamagandang sagot kapag pediatrics yung pinag-uusapan. Letter E, punish the child. Guys, mali itong punish. You don't punish your child. Sige, kaya nga pumapasok na yung set limits, di ba? Kung under sa napag-usapan nyo yung punishment, make sure na maiintindihan ng bata kung ano yung punishment na sasabihin mo. Pero as much as possible, you don't punish the child every time the child says no. Kasi saying no in her age is normal, di ba? Kasi she's a toddler. And part talaga yun. So the best answers would be options A and D or option A. So proceed tayo sa number 3. Nurse Ray is assessing Eri's psychosocial developmental level using Erickson's 8 stages. Which of the following behaviors would Nurse Ray most likely find if Eri were demonstrating being in shame and doubt instead of having mastered autonomy? So tingnan natin guys shame and doubt, autonomy, these are the tasks of a toddler. Task D, toddler. Kapag autonomy ang pinag-uusapan, ano ba ibig sabihin ng autonomy, di ba? Autonomy is being able to do something on your own determination, on your own sa sarili mong kagustuhan. Nag-English pa, nahirapan pala. Sa sarili mong kagustuhan. Lang hindi masyadong you can ask for other people's advice, pero you will make the decision by yourself. Sa kung ano yung sa tingin mo tama. That's what autonomy is. Diba? So kung titignan natin dito guys, options, ano ba yung kabaliktaran neto? It's letter A. Dependency, constantly looking to others for approval. Kasi nga, when the child is already autonomous, he or she does what she wants to without constantly seeking for his or her parents' approval. Okay? That's one of the signs na he already developed autonomy. Sleep disturbance, crying, and vomiting, these are physiological. So, ang tanong dito ay psychosocial. So, piliin natin yung more on psychological. Always imitating others rather than using imagination. This is more on preschool ito, guys. Letter D, frequent crying, emotional outbursts, and whining. Usually ito sa mga infant naman ito. Kapag hindi na provide yung kanilang needs, diba? Or more on physiologic din kasi ito. Yung tanong more on psychologic. So, dun tayo sa options na psychologic in nature. Number 4, the parents of an 8-year-old child tells the clinic nurse of a concern that the child seems to be more attentive to friends than anything else. Using Erickson's psychosocial developmental theory, the nurse would plan to make which response? The best answer here, guys, is letter C. Normal lang ito sa ating mga school age. Kasi sa ating mga school age, sila ay nagde-develop ng industry versus inferiority. So dito sa age nila, normal lang na maging attentive sila sa mga kaibigan nila kasi doon sila naghahanap ng mga skills na pwede nilang ma-adopt and ma-adapt. Kasi dito nila binibuild yung sarili nilang repertoire of skills, sarili nilang skill set, sarili nilang mga kakayahan. So walang dapat ipangamba. That's why mali yung letter A and mali rin yung letter B. Mali rin yung letter D kasi sabi niya provide more. Of course, you provide praise to the child or you compliment the child, you give positive reassurance, pero positive reassurance na deserve niya. Hindi yung sobra-sobra, 'di ba? Para hindi siya maging negative maging effect niya sa bata as he or she grows up. So, letter C is the best answer. Number 5, in accordance with Erickson's theory, the main task associated with Nora, a 16-year-old female who refuses to do what her parents want her to do, would be 16 years old, she is an adolescent. So kapag adolescent tayo, nandun tayo sa level na nagde-develop ng identity versus role confusion. So, if alam natin yung task ng isang adolescent, alam na natin na ang answer dito ay letter D. Kasi Nora is developing her sense of identity. That's why you allow her or you support her to do what she wants. You allow her, pero in a way na positively. Kung alam mo naman na yung ginagawa niya ay hindi na maganda para sa sarili niya, you still set limits, you explain. Diba? You talk to him or talk to her in a way na maintindihan niya or makakapag-establish kayo ng rapport sa isa't isa. Hindi yung sisigaw-sigawan mo yung anak mong adolescent kasi hindi niya ginagawa yung gusto mong gawin niya. Nabuhay niya yun, di ba? Yun yung kailangan intindihin as nurses as well. Nabuhay yun nung bata. Pero kapag syempre immediate danger na siya, emergency situations, of course, doon na papasok yung pagiging authoritarian nurses. Kailangan gawin na natin kung ano yung tamang gawin. Sa mga times na hindi siya makapag-decision sa sarili. Number 6, the nurse has noticed that her 5-year-old male patient does not recognize that his toy exists even when it is outside his visual field. Noting this, what action should the nurse perform? So guys, dito sa number na ito, it's all about object permanence. Okay? So object permanence yung topic natin dito ha. Yung object permanence dapat, object permanence basically dapat kahit hindi nakikita ng bata, alam niya na yung object ay nag-i-exist. Kahit saan mo ito itago, alam niya na, tinago mo lang siya. Pero, hindi ibig sabihin na hindi niya nakikita, ay hindi na totoo. Yan. Yun yung object permanence. Object permanence, kahit hindi nakikita, dapat meron. Yan. Nakikita, alam na meron. Alam niyang meron. Yan. So, kung 5 years old na yung bata, tapos wala pa siyang object permanence, maganda na i-report na siya sa physician for observation. Yan. Notify na siya sa physician about the observation. Kasi usually ito, dapat nade-develop na ito ng mga 3 years old pa lang eh. 3 years old pa lang, 2 years old pa lang nagde-develop ng object permanence. 5 years old na siya, it's very late na, diba? So you notify the physician about the observation. So clear tayo. Clear ko na guys ha. 3, 2, 1, and clear. Para proceed tayo sa number 7. Guys, B is wrong kasi wala nga siyang object permanence. So yun din yun yung problema, di ba? The thing is, dapat sa edad niya yan, alam niya na nag-exist yung object kahit na hindi niya makita. Yun yung main concept. So B, of course, makikita na niya kapag nasa field of vision na niya. Pero hindi siya yung ideal na gawin. Kasi hindi naman yun yung problema. The problem is all about object permanence. Number 7, the mother reported concern about her 6-year-old son, who appeared more interested in his classmates than anything. Based on the mother's concern, how should the nurse respond? Again, this is normal. So, kailangan sabihin ng nurse na at this age, children are currently developing their personalities. And you must let them. You must let them, pero at the same time, you're guiding them. Diba? You should let them decide and kung may time, you talk to them. Explain to them kung ano ba yung ganito ganyan para mas maintindihan nila. Kung tama ba yung personalities na dinedevelop. You should be alarmed. No, you should be alarmed. You should not be alarmed kasi this is normal. You need to monitor. Monitor is very strong word kasi pagdating sa pedia. When you say monitor kasi parang 24/7 or more, parang mas tutok ka. Not necessarily naman. Kasi this is normal. D, you need to give the child more praise. Again, same lang to ng question sa isa. D is wrong. C is the best answer. Number 8, Nurse Mara is observing the activity of a 5-year-old patient. Which of the following is the most common observation in the play activity of this age group? Kapag 5 years old guys, ano siya? Siya ay nasa, actually ito nasa preschooler na siya, di ba? So kapag toddler, 1 to 3, ganon. Kapag 1 to 2, 1 to 3, preschooler, nasa 4 to 5, 4 to 6, ganon. Kapag toddler, ang play nila, parallel, di ba? Parallel parking, ganyan lang sila. So naglalaro sila, naglalaro on her own, naglalaro on his own without necessarily interacting. Okay? Kapag naman sinabi natin letter C, plays with puppets and participates in team sports, usually this is sa mga school age natin. This is competitive play na. Letter D, play by themselves in a corner, engaged in putting a puzzle together. This is solitary play. Usually, mga ganito, mga infants natin. So the best answer is letter B, preschooler. Okay? Ito yung mga meron silang mga imaginative friends. Imaginative friends ba yun? Kasi yung mga friends na hindi nag-exist. Or magical creatures, fantasies. It's for preschoolers. Now, number 9. The nurse cares for a toddler patient. Tama, imagine. Yung white lady sa pinto, yes, tama po. Anong pangalan ng white lady sa pinto? Diba? Usually, yun yung mga bata na may mga nakikita, ganun. Sabi nila, Mama, may nakita akong white lady sa pinto. Pangalan niya Abigail, ganun. Diba? Parang, it's normal. Patay tayo dyan. Joke lang po, Miss Abigail. Okay, so proceed tayo sa number 9. The nurse cares for a toddler patient who must take medication. Or malay nyo, naka-high lang pala yung bata. Kimi. Number 9, the nurse cares for a toddler patient. Iwanan ko yung bata niya. Okay, so number 9, the nurse cares for a toddler patient who must take medication every afternoon for 5 days. Which of the following is the most appropriate, age-appropriate explanation for the toddler? Again, kagaya na sinabi ko kanina, mga toddler usually wala pa silang time permanence. Kung may object permanence, sabihin natin may time permanence. Or wala pa silang enough knowledge or idea pagdating sa time. And options A and D are very specific. 1 o'clock and 2 o'clock in the afternoon. 1 o'clock p.m. As if naman alam na nilang tumingin sa mga orasan. Diba? Well, siguro yung iba meron. Pero sa ganitong mga taon, sa mga toddler, hindi pa nila napag-aaralan yun. Usually yung time, pinag-aaralan during sa mga school age. Letter C, for a week, you will be taking your medicine in the afternoon. Again, this is very technical. When you say afternoon, when you say afternoon, alam ba nila kung ano yung afternoon? Kasi afternoon could be 2 o'clock, 4 o'clock, 5 o'clock, 6 o'clock, 7 o'clock, ganun. Pero that's very specific, diba? So you use words na familiar yung mga child. For example, in letter D, every afternoon after your lunch. Alam naman nila kung ano yung lunch, diba? That is their yung pagkain nila sa kalagitnaan ng araw. So, mas may idea sila, mas makasusunod sila kung ano yung pinapertain mo, oras at araw. So, B is the best answer. Number 9. Which of the following for infants does a nurse consider to have abnormal language development? The answer here, guys, is letter B, a 7-month-old who is beginning to vocalize during play and pleasure. Why? Kasi dapat, dito, nagagawa na niya to at around 3 months to 6 months. Diba? So kung 7 months, masyado na itong late. So, yun yung parang abnormal dito sa mga infants na meron tayo rito. Pero, kung titignan natin ang PIDYA, guys, diba? Sabi nila sa PIDYA naman, very subjective yung development ng bata. So, siguro kayo walang ganitong type ng question sa aming board examinations. Walang parang pinagko-compare kung alin sa mga infants or alin sa mga bata yung may abnormality. Kasi, developmental or childhood developmental stages are vary from child to child. Hindi porket, yes, merong common timeline sa pag-develop ng isang skill, pero hindi ibig sabihin ganun lahat. And that is accepted naman. Pero sa options na ito, B yung mali kasi nga dapat within 3 to 6 months, na-develop na niya yung vocalization. Nagbibigay na siya mag-vocalize. Number 11. 11, ito guys, kung ako yung sasagot na sa board exams, hindi ko alam kung ano yung sasagot ko rito. And that's okay. It's okay na meron hindi kayo masagutan. As long as hindi naman yung whole 100 points or 60 points, hindi nyo masagutan, di ba? It's okay na meron kayong mga items na hindi kayo confident. Kasi, hindi naman talaga natin ma-answer ang lahat. And that's the reality. So you answer all that you can, pero kung may hindi kayo masagot, you spare yourself from blame, self-blame. Number 11, which vehicle safety equipment is appropriate for an 8-year-old who is 4 feet tall? The answer here, guys, ay booster seat. Booster seat, yun yung pinapatong sa mismong mga upuan, di ba? Para makapag-belt yung bata. Seat belt, hindi nga pwede kasi nga masyado pang maliit yung bata. Ay usually ang seat belt, you-recommend ito kapag 4'9" na yung bata, kapag medyo malaki na siya, para yung seat belt mag-fit dito sa kanyang bandang katawan. Kasi kung yung bata, 4 feet pa lang, yung seatbelt nandito na, so ano na-protektahan niya? Imagine you guys, andyan yung seatbelt, no? So kapag nautog ba, nag-ganon, no? Nag-crush yung bata, nag-ganon, hindi wala rin, no? Yung ulo pa yung naapektuhan. So hindi rin efficient. Front-facing convertible seat and rear-facing convertible seat, usually ito ay prescribed sa mga infant. And usually ang inuuna rear-facing, tapos according sa manual, mag-transition siya sa may front-facing convertible seat. So booster seat, oh my God. Eme ka naman, ma'am, sa 411 mo po. Okay po. So, ang answer dito sa number 11 ay letter A. So, proceed tayo sa number 12. Using Erickson's 8 phases, the nurse evaluates a toddler's psychological development level. Which of the following would the nurse be most likely to see if the child was exhibiting shame and doubt? Again, ang answer dito ay letter A. Na-answer na natin ito kanina. Number 13. The mother of a breastfed newborn reported that her infant's feces is golden in color, pasty rather than firm, and smells strongly of sour milk. What would be the best course of action for the nurse to take? This is normal. So the best response is letter D. This is normal for a newborn who is breastfed. Kapag newborn, guys, ang color ay pasty siya, no? Hindi siya firm. And then golden color. Hindi siya thick. Unlike kapag formula fed yung bata, mas firm yung tayo. Okay. So, it's number 13 is letter D. It's normal lang, guys. But A is mali kasi matik. Kasi ano pa lang ba yung bata? Infant pa lang, di ba? So, you don't necessarily need to give him or her cereals. Kasi malay mo kung yung bata wala pa sa stage na pwede na sa kanya ang solid foods. Cut back on your fluid intake, wrong. So, wala naman sa yung problema. At so, wala naman sa situation yung diet ni mama, sita, sa letter B. So, that's why it's wrong. C, I need to check your temperature. Guys, this is not an abnormality. So, no need to check for temperature. Check for abscess. Best answer is letter B. Number 14, when planning to educate a class of mothers about introducing new meals during the first year of their infants, sir, public po sa tuwang. Yan. Same lang to guys, na-answer na natin to kanina. A, dependency, and concept looking for other support. Yeah. 14. Ayan, 14. So, kapag magpapakain tayo, when planning to educate a class of mothers about introducing new meals during the first year of their infants, which of the following should the nurse include? The best answer is letter D. Introduce one new food at a time at 7 intervals because to identify allergies. Isa-isa muna para malaman mo kung merong allergy yung bata sa food na yun. Ang problema kasi kapag halo-halo, di ba? Kapag sabay-sabay kayo, hindi mo alam kung alin yung nagloloko. Di ba? So, kapag pinakain mo siya ng patatas, ng carrots, ng hipon, ng chicken, alin kayo sa apat na yon? So, hindi mo siya mapipinpoint. That's why you give it separately. A is wrong kasi place up to 3 foods. Isa nga lang, di ba? So, mali na agad yun. B, introduce fruits first. Mali to guys kasi ang inuuna dapat ay sarili. Sarili at gulay. So, gulay dapat ang inuuna before prutas. Kasi nga, kapag prutas agad, ma-addict sila sa sugar, sa glucose. And yun yung hahanap-hanapin nila. That's why siguro marami yung may ayaw ng gulay kapag nung bata sila. Okay? So, letter C naman, alternate between feeding. Hindi mo nga siya i-alternate. One food muna for 7 days. So, mali yung C. So, the best answer is letter D. Okay? Number 15. A mother is concerned about her 5-year-old. Ganun pala yun. Parang yes po, isa-isa lang. Para kasi kapag, syempre, kung 5 ang jowa mo, baka magloko yung isa sa kanila, didahado ka pa. Ikaw naman nagloko, ikaw pa dihado. Ay, naglolokan lang kayo. Okay, so number 15, parang hindi na-grade to ang mga ito. Number 15, a mother is concerned about her 5-year-old occasionally peeing in his undies rather than using the restroom. Which of the following questions should the nurse ask in order to ascertain whether this is a typical occurrence? So, ang answer dito guys sa number 15 ay it's letter D. Uy, andito si Ice. Hi Gab. So, number 15. The answer in number 15 ay letter D. Does this behavior occur when your child is engaged in some activity? Bakit guys? Kasi sa age nila ito, sa age nilang ito, being a toddler, usually kapag very preoccupied sila sa isang bagay, kapag very focused sila sa paglalaro, hindi na pumapasok sa isip nila yung pumunta sa bathroom. Diba? So yan yung reason kung bakit tinatanong mo kung nag-occur ba ito sa isang specific activity, engaged in some activity. Kasi baka yung activity na yon ay activity na gustong-gusto niyang gawin. Or nangyayari yung activity na yon or nangyayari yung pag-ihi ng bata sa kanyang undies kapag ginagawa niya yung activity na gustong-gusto niyang gawin. Okay? Kasi syempre kapag mga toddler, nasanay pa sila na, ay kapag mga toddler, di ba tino-toilet train pa lang naman natin sila. So hindi pa sila totally sanay and hindi pa nila naman master totally yung toilet train. Okay, so D is the best answer. Number 16. What information should the nurse tell to a mother when giving vitamins to a preschooler? The best answer in number 16 is letter C. Why? Bakit mo itatago yung vitamins? Isa-isayin natin ha. Letter A, give the vitamins with sips of milk. Not necessarily, guys. Kasi kahit tubig naman pwede. Letter B, give preschoolers half a vitamin. Pinagdamot mo pa yung vitamin sa preschooler. Diba? Kung bibigyan mo na siya ng vitamin, ibigyan mo na ng buo. Hindi yung kalahati lang. Buo guys, bigyan mo yung vitamins ng buo para makuha niya yung nutrition, yung vitamins na kailangan niya within the day. Letter D, allow the child to be independent by self-administering the nangangagat. Mukha mo vampira. So letter D, allow the child to be independent by self-administering the vitamins. So ginawa niyo pang nurse yung preschooler. Diba? Di sana hindi na lang kayo nag-nursing. Di sana hindi na lang kayo ng board exams. Kung gano'n lang din naman. So mali letter D. Pero bakit mo i-store yung vitamins sa locked cabinet na hindi ma-access ng bata? It's because sometimes kasi yung mga vitamins natin sa mga batang ito, usually diba, sila yung mga matatamis. And kagaya ng sinabi ko kanina, that's why hindi inuuna yung fruits kasi nga yung flavor na yon kapag na-introduce sila sa glucose, sa sugar, mas na-addict sila. So tendency is kapag accessible yung vitamins, take sila ng take, kain sila ng kain, baka masobrahan naman sila. Diba? For the mukbang yung mga kids, indeed, di ba? Hindi mo sila i-overdose ng vitamin C everyday. Imbes na maprotektahan sila sa, sorry guys, lasing na ako. Hindi mo sila bibigyan ng vitamin C everyday. Ng 30 gummies kasi baka mamaya sira na yung kidneys nila. So itago mo siya sa may locked cabinet. Okay? Number 17. Nurse Alvin is assessing a woman who thinks she may be pregnant. Which, ay anak ko, uminom ng buo ng silin. Ay, sinasabi ko sa Miss Abigail, ayusin mo lang. So, number 17. Nurse Alvin is assessing a woman who thinks she may be pregnant. Which information from the client is most significant in confirming the diagnosis of pregnancy? Guys, kung titignan natin itong options, walang positive sign ng pregnancy dito, di ba? So ano ang second na most significant signs ng pregnancy? It would be probable signs. And ano lang ba ang included sa probable signs ng pregnancy dito? It's letter D, positive pregnancy test. A, B, and C are all presumptive signs. Number 18, Nurse Alvin is performing an assessment on patient Wayne who suspects that she is pregnant. Nurse Alvin should assess for which probable signs of pregnancy, select all that apply. Probable signs of pregnancy, guys. Ang answer dito ay letter A, B, C, and D. Bakit? Letter E and F are all positive signs of pregnancy na. So, hindi na siya included. Yun lang naman guys yung rationalization dito. Familiarization lang or gawa kayo ng clue sa kung ano nga ba yung mga signs ng pregnancy per presumptive, positive, and probable. So, E and F hindi kasali kasi all positive signs. So, number 19, when patient Wayne returned on her 38 weeks gestation, Nurse Alvin knows that the fetal heart rate is 180 beats per minute. Pakibalik sa 17 po. Sige po. 17, yan, SS. Assess nyo na in 3, 2, 1, 17 SS. Thank you. Number 18 po. Okay. So, number 19. Kapag 180 beats na yung fetal heart rate natin, kailangan na natin i-report sa physician. Bakit? Kasi 'di ba, ang normal heartbeat lang naman, especially guys, 38 weeks gestation na siya. Ibig sabihin, malapit na siyang lumabas. And ano ba yung normal heart rate fetal heart rate ng ating mga newborn? Usually it's 120 to 160, di ba? So kung 38 weeks na siya, malapit na siya lumabas at 180 ba? 180 pa yung FHR niya, masyadong mataas. So probable na in distress yung bata. That's why you notify the healthcare provider. Okay? So 19 is letter C. Number 20. After a while, a non-stress test is performed on patient Wayne, and the results of the test indicate non-reactive findings. Kapag non-stress test and non-reactive yung findings, is it good or is it bad? Non-reactive findings and non-stress test is bad, guys. So, ibig sabihin, hindi gumagalaw or hindi tumataas yung FHR ng bata during fetal movement. And maybe delikado yun. Kasi kapag sluggish yung bata, ibig sabihin, probable na may mali. So kapag non-reactive or bad result yung ating non-stress test, saka mag-prescribe yung doctor ng contraction stress test. So contraction stress test could be done through nipple stimulation or such. So kapag ang contraction stress test naman natin ang ginamit, tinitignan natin dito kung meron bang late deceleration, di ba? Early decelerations are normal, or yung pagbaba ng fetal heart rate, or yung early decelerations are normal kapag nagko-contract si nanay. Ang late decelerations usually happen even after the contraction. And this is abnormal. Kasi ibig sabihin na to, kapag merong late decelerations, probable na merong uteroplacental insufficiency. Pero, since sabi sa situation natin, negative naman daw yung contraction stress test, ibig sabihin, the baby is normal. So this is a normal test result. Okay? Yes, thank you po. Normal stress results. That's why A ang sagot natin. However, kung sabi naman sa contraction stress test, sabi rito ay the results are positive. Ibig sabihin, may yung problema sa may uteroplacental ng mother and ng baby. So, dun mo lang masasabi na abnormal. Again guys, clarify natin Mauuna ang non-stress test. Tapos, kapag non-reactive or kapag non-reactive yung fetus sa non-stress test, saka lang papasok ang contraction stress test. Okay? So, proceed tayo sa number 21. Number 21, while resting, Nurse Alvin decides to teach patient Wayne on how to perform kick counts, which statement by patient Wayne indicates a need for further instruction. Mali guys, ang letter B, I need to lie flat on my back kasi, di ba, hindi dapat flat. Laging may wedge or naka-side view yung patient, hindi naman side view, pero dapat yung right side ng patient nakaangat. Kasi di ba, anatomically, nasa right side ng katawan yung vena cava natin, inferior vena cava. That's why kapag nakahiga tayo, inferior vena cava. Pag nakahiga tayo, may ipit yung ating vena cava. Probable na yung mother magkaroon ng supine hypotensive syndrome. And iniiwasan natin yun. Kasi nga, baka hindi masupply, mamaya, ma-distress si mother, ma-distress pa si baby. That's why B is wrong. So, dapat may wedge under the right hip. 22. Which of the following is appropriate pregnancy classification for Vilma, who has had her first pregnancy, ended in miscarriage at 9 weeks, second pregnancy, delivered vaginally at 39 weeks of gestation, and the child is 3 years old now and is currently pregnant for the third time. So, pregnant for the third time, ibig sabihin, G3 na siya. Kasi gravida talks about number of times that you have been pregnant. So, matik mali na si B and D. Cancel na natin si B and D. Now, tignan naman, tignan naman natin yung para. Para talks about, all about the viability of the patient. So, ibig sabihin, yung bata na ilabas mo at around 20 weeks gestation. Kasi at around 20 weeks, viable na siya. With the right equipment, machinery, kaya niyang mabuhay. Kahit nawala na siya sa loob ng placenta. Diba? So, sabi rito guys, yung isa na miscarriage at 9 weeks. So, hindi na siya pasok sa 20 weeks. So, matik, P1 na lang tayo. So, ano na lang ang natitira is option A. G3, P1. That's why A is the correct answer. Number 23, Nagel's rule. Ang kanyang last period was October 19, 2018, di ba? October, numeral coefficient niya ay number 10. So, minus 3, 7. Ano ba ang number 7 sa calendar? Is July. Number 19, dagdagan lang natin ng 7. Ibig sabihin, 19 plus 7 magiging 26. Tapos 2018 plus 1 magiging 2019. Ibig sabihin, EOD niya ay July 26, 29. Number 24. Ito guys, pagdating sa may prone to art. Yes po, thank you po, Ma'am Maya. So dito naman sa number 24, during a prenatal visit, nurse Justin evaluates the fundal height of the uterus to be at the umbilicus. Guys, dito sa may fundic height, ang tignan lang natin ay yung mga landmarks natin. So kapag nasa umbilicus na siya, usually ito ay around 20 to 22 weeks gestation. Kapag nasa 16 naman, yan, 16, halfway between symphysis pubis and umbilicus. Umbilicus daw pala. And then kapag naman at around mga 36 weeks, nasa xiphoid process na si baby. Ito yung mga kailangan yung tandahan na landmarks. Kasi hindi naman mapupuno yung questions natin ng ganito. Probably kung may question man na ganito sa amin noon, isa lang. And yan pa yung mismong, parang ganyan pa yung concept, yung context ng lumabas. Asan na raw yung baby, ilang weeks na raw yung baby kapag nasa umbilicus siya. So the answer is letter B. Diba? 20 weeks. Okay, so screenshot nyo na guys, tapos erase na natin. And then proceed na tayo sa number 25. Yeah. Nurse Justine is performing an assessment of a pregnant client who is at 28 weeks of gestation. Nurse Justine measures the fundal height in centimeters and knows that the fundal height is 30 cm. How should the nurse interpret this finding? Guys, this is normal. Tatandaan nyo lang kapag fundal height tapos weeks, usually close enough sila. So kapag dalawa lang yung increment between the weeks and yung weeks of gestation and then yung fundal height, ganun, 1 to 2, is usually normal for gestational age. Diba? 28 weeks, 30 cm, magkalapit sila. So, it's normal. Number 26, a 17-year-old primigravida client at term is in active labor. Examination revealed cervical dilatation at 8 cm with 100% cervical effacement. Which of the following should the nurse assess the client for? Guys, very important sa pregnancy ha, always remember yung age nila. So 17 years old yung client, she's still an adolescent. Nagde-develop pala yung body niya. Hindi pa kumbaga fully formed, hindi pa mature yung kanyang musculoskeletal system, bone system. Especially kapag buntis yung kanyang pelvis. That's why it could result in cephalopelvic disproportion, di ba? Yun yung usual na problems or complications sa mga adolescent natin na nabubuntis. CPD, kasi masyadong malaki yung ulo ng bata para sa pelvis ni mother na hindi pa fully developed. So, hindi makaikot yung bata, hindi makalabas yung bata. Ano yung bata? Ganyan lang. Hindi siya makaikot, di ba? Stuck lang siya. That's why may CPD. Okay. So, number 27. Di ba? Kapag hindi talaga siya, step bro, I'm stuck. Number 27, a 23-year-old primigravida client at full term is in active labor. Which of the following should be incorporated into the plan of care of this patient? matik naman to guys, kapag nag-duty tayo guys, 'di ba? Madalas nating ina-assess, "Ma'am, anong pain rate na po tayo? Gano'n na po, from 1 to 10, gaano po kasakit yung nararamdaman natin? 1 being the mildest and 10 being the pinakamasakit." So, the most or the best answer here is pain assessment every 30 minutes. Oxygen saturation monitoring every half hour. This is usually done kapag may mga kapag may mga heart disease yung mother. Pero kapag normal naman, hindi naman. Supine positioning on back, mali nga. Kasi di ba, you don't position the mother supinely. Dapat niya, medyo nakaganyan para hindi maipit yung vena cava. Para maiwasan yung supine hypotensive syndrome. Letter D, vaginal bleeding, ROM assessment every shift. Hindi siya every shift, guys, ha? Every 30 minutes to 1 hour. Hindi 8 hours. Kasi nga, di ba, nasa labor na siya. So, at any time, pwede nang pumutok yung panubigan ni mother. So, hindi mo siya i-assess after ng duty mo. Kasi parang kung pumutok na pala, kalagitnaan ng duty mo, di ba? Eh di, at risk pa si baby sa may infection. Eh di, kasalanan mo pa, di ba? So, that's malpractice na. So number 28, a pre-gravida client who is in active labor arrives at a birthing facility. Examination revealed that the client is at 1+ station and that client's membranes are still intact. The doctor prepares for an amniotomy. What are the most likely outcomes of amniotomy? Anong amniotomy, guys? Yung panubigan. So kapag yung panubigan, syempre, yung bata, mas magdi-descend na papunta sa may cervix. So, dapat, imbis na less pressure sa cervix, it should be more. And since mas more na yung pressure sa cervix, ibig sabihin, mag-activate ito sa katawan ng mother na para magsisignal na, yung bata nasa may cervix na, so kailangan mailabas na. So, kailangan yung contractions mas marami. That's why mali yung option number 2 kasi dapat more number of contractions, increased number of contractions. Number 3, increased efficiency of contractions. This is true. So, included yung option 3. Ngayon, option 4, the need for increased maternal blood pressure monitoring. Hindi yung mother i-monitor mo. Kasi di ba, ang pinutok mo yung panubigan is yung bata. So, yung fetal heart rate ang i-monitor mo. That's why hindi included yung ating option 4. Number 5, the need for frequent fetal heart rate. So, ito guys, kagaya na nasabi ko kanina, kapag pinutok na yung panubigan, syempre, yung umbilical cord, hindi na siya lulutang. So, most probably, kapag hindi maganda yung position ng umbilical cord sa fetus, it could strangle the baby. That's why you assess the fetal heart rate para makita mo kung may probability ng prolapse cord. That's why the best answer ay options 3 and 5. So, letter D lang. So, number 29, a pre-gravida client in active labor is experiencing contractions that lasts 50 seconds every 3 minutes. The FHR is 100 beats per minute. Again, di ba? It should be 120 to 160. So, 100 is mababa na. Again, kapag mababa na yung FHR, possible na may complication na sa bata. So, you always report sa primary healthcare provider para magawa na ng paraan. So, yes, kasi ang isa sa pinakamakatulong sa atin sa boards ay visualization. So, maganda na ma-visualize. So, number 30, a pre-gravida patient in active labor is prescribed with scalp stimulation of the fetal head. What is the purpose of scalp stimulation? Guys, ito sa scalp stimulation, ginagawa ito para increase yung fetal heart rate and variability. Ano lang ito guys? Procedure done para ma-ensure na yung bata ay within normal condition pa. Na kapag na-stimulate yung bata, yung kanyang heart rate angkop sa stimulation or sa movement, sa action na ginagawa niya. So, itong assessment of fetal hematocrit level, this is done through fetal blood sampling in this stimulation. Increasing the strength of contraction. Kung gusto mo mag-increase ang contraction, you will give oxytocin. Diba? Assessment of fetal position, again, hindi mo kailangang i-stimulate. Kapag assessment of fetal position, you can do visualization procedures like ultrasound. So, proceed tayo sa number 31. The nurse is caring for a client in labor, which assessment finding indicates to the nurse that the client is beginning the second stage of labor. So, second stage of labor begins from complete dilatation ng cervix papunta sa delivery ng baby. So, the best answer ay C and A occurs during first stage of labor pa. Diba? B occurs during first stage of labor, then C, kasama second stage. D occurs during first stage of labor. E occurs during second stage of labor. So 31 best answer ay letter A. 32. The nurse is reviewing true and false labor with a multiparous client. The nurse determines that the client understands the signs of true labor if she makes which statement? Which it is letter B. My contractions will increase in duration and intensity. Kagaya nung nasa may option kanina sa may, nung nag-perform ng amniotomy, di ba? Kapag in labor na, ganun, and papalapit na yung baby sa cervix, papalabas na, tatas yung contractions para mas mapush palabas. A is wrong kasi I won't be in labor until my baby drops. Pak, sana all, di ba? Award si mother. Hindi siya nag-labor. Lumabas na lang yung baby. Edi, for the blessed. Letter B, my contractions will be felt in my abdominal area. Again, when you're in true labor na, aside from your abdominal area, bababa yung contraction sa yung lower back. Kasi nga, andun yung pelvis eh. I mean, andun yung pababa yung ulo. And andun, anatomically, andun yung pelvis. That's why mararamdaman mo yun sa may lower back mo. Letter C, my contractions will not be as painful if I walk around. This is wrong kasi di ba, yung relief na nadudulot ng walking is only for false labor. So C is wrong. Number 33. The nurse in the labor room is caring for a client in the active stage of the first labor. The nurse is assessing the fetal patterns and notes a late deceleration in the monitor's room. What is the most appropriate nursing action? Again, late deceleration, my uteroplacental insufficiency. So the best answer is you give oxygen para hindi mag-contract yung blood vessels sa may bandang uteroplacental area para masupply yung necessary blood and oxygen din sa baby. So A is the best answer. Down. Mali yung B, guys, kasi bawal ang supine. X ang supine. C ay mali kasi oxytocin is for contraction. Hindi siya for late deceleration. At saka may late deceleration na nga yung baby, mag-administer ka pa ng oxytocin, di ba? Hindi mas lalong mahihirapan yung baby, mas lalong mawawala ng oxygen yung baby. That's why you don't give oxytocin kapag under late deceleration yung bata. I-document mo to after mo naman gumawa ng action. Hindi naman pinabayaan mo na si mother, di ba? You document after providing intervention. 34. A client in labor is transported to the delivery room and prepared for CS. After the client is transferred to the DR table, the nurse should place the client in which position? Again, the answer here is letter A. Bakit tama ang supine dito? Kasi may wedge na under the right hip. So, hindi na may ipit yung vena cava. Okay, so 34A is the best answer. 35, a pregnant client asks the nurse when the stretch marks will disappear. The most appropriate response is, stretch marks, nilipis lang siya, pero hindi siya totally magdi-disappear. So the best answer is letter C. Okay? 35, letter C. Hindi siya totally magdi-disappear. 36, Nurse Mima is caring for Julina, who is at 30 weeks of gestation, has gained 17 pounds during the pregnancy, and has a blood pressure of 110/70. Excuse me po. Julina states that she feels warmer than everyone around her. Which interpretation of this findings is most correct? The answer, guys, is letter A. You feels warmer does not necessarily mean na baka aura na siya ng seizure. Hindi po, guys. Kasi kapag warmer, syempre kapag buntis, mas mataas yung metabolic rate niya. So it's normal na mas warm yung nararamdaman niya compared sa surroundings. Normal naman yung weight gain niya, ay hindi naman excessive yung weight gain niya, di ba? So it's normal. Kasi yung weight gain, 2 to 4 pounds sa first trimester and then 1 pound na per week sa second and third trimester. Blood pressure normal naman. So 36 is letter A. Number 37. Consequently, Nurse Mimay takes patient Jolina's vital signs. Her blood pressure is 160/94, PR of 88 BPM, RR of 24, and temp of 98 degrees Fahrenheit. Additionally, Jolina complains of epigastric pain and headache. What should Nurse Mimay do initially? Guys, itong epigastric pain and headache, these are the auras. Aura, or usually na parang nararamdaman, na-experience ng patient before. Aura, before having seizure. Oh. Seizure yan. So, the best support or the best intervention that you could do is provide supportive care for impending convulsion. Guys, walang magagawa ang indwelling catheter kasi kahit insertan mo siya niyan, magtutuloy yung seizure. Give Maalox. Guys, this is antacid ito. So wala siyang magagawa. Contact the doctor. Of course, you will contact the doctor, pero you ensure muna na safe si patient if biglang mag-start yung seizure niya. Convulsion niya. So letter D is the best answer. Oh, okay, screenshot nyo na guys. 3, 2, 1, and proceed na tayo sa number 38. Magnesium sulfate is ordered for client with PIH. What effects would nurse Nima expect to see as a result of this medication? So magnesium sulfate is it works as a CNS depression, as a drug which results in CNS depression. Diba guys, ang magnesium sulfate minibigay nga kapag may PAH para ma-prevent ang eclampsia. So automatically, kung ang pathophysiology ng eclampsia is all about the signal transmission sa utak, bakit ka magbibigay ng magnesium sulfate? Siyempre, to depress the signal transmission sa utak and para hindi magtuloy yung seizure. Okay? So, kapag depressed yung utak mo, walang masyadong transmission of signals, hindi magtutuloy yung seizure. Hindi siya for decreased gastric acidity kasi this is for magnesium hydroxide gel. Hindi siya for onset of contractions kasi nga contractions are produced or are results of oxytocin administration. Decrease in number of bowel movements, hindi naman siya for constipation. So the best answer in number 38 ay letter A. So number 39, if Nurse Mima were assessing a patient with severe preeclampsia, which assessment findings would most closely associated with the complication of this diagnosis is letter D. Kasi ang preeclampsia could be a risk factor for the development of what? For DIC, diba? For disseminated intravascular coagulation. So the problem with DIC is that may bleeding yung katawan, pero hindi because walang coagulating factors, hindi because walang ability yung katawan na mag-form ng coagulation. Actually, meron. May ability yung katawan na mag-coagulate during DIC. However, sa sobrang taas ng demand ng coagulation, nauubusan yung katawan ng coagulating factors. Kaya nagkakaroon ng bleeding, which is evidenced by letter D. Bleeding sa gums, petechiae, or purpura. Hence why letter D is the best answer. A, B, and C are all normal occurrences. So, hindi sila yung sagot. Number 40. Which of the following should the nurse assess for newborn infant whose mother has type 2 diabetes? Yung question, di ba? All about diabetes. Ano ba ang diabetes? All about sugar. Ano ba yung mga sakit dito sa options ang nagpo-pertain sa sakit which involves blood sugar? It's hypoglycemia, di ba? Pero bakit ba nagkakaroon ng hypoglycemia ang newborn? It's because habang nandun pala siya sa sinapupunan ni mother, napakarami ng glucose na naipapasa sa kanya through the placenta. And dahil dito, nagkakaroon din ng hyperinsulinemia para nga yung excess glucose sa katawan ng bata mapunta sa cells, hindi maipon sa dugo. However, kapag ginunting na yung kanyang cord, kapag ginunting yung cord, biglang nawawala yung supply ng glucose. Syempre, wala pa namang kinakain yung bata, so saan manggagaling yung supply ng glucose na kailangan niya? Plus, meron pa siyang hyperinsulinemia. So, yung glucose sa dugo niya, super baba na kasi mapupunta na sila sa mga cells na nangangailangan. Hence, magkakaroon ng letter A, hypoglycemia. Okay? So, association lang siya, guys. Yung sakit ng mother ay type 2 diabetes, sakit sa dugo and all about dugo and blood sugar. So, alin ba sa options yung may relationship sa dugo and blood sugar? Of course, it's letter A. That's why A is the best answer. 41. Hypoglycemia may occur in LGA newborn, large for gestational age newborn, as a result of which of the following, kagaya na sabi ko kanina, is hyperinsulinemia. Yeah, it's letter B. So, 42. Based on the knowledge about gestational diabetes, which of the following should the nurse assess in the newborn? Guys, kapag may gestational diabetes, masyadong malapot ang dugo, di ba? Malapot ang dugo. So, kung yung newborn, habang nandun siya sa sinapupunan, nagpapump yung puso niya ng very malapot na dugo, Diyos ko, pagod na yung puso niya, di ba? Kasi kung masyadong malapot yung dugo, may hirapan yung puso na ipump yung dugo. So kapag malapot yung dugo, kailangan mag-exert ng extra effort yung puso. And since muscle ang puso, kapag laging nagagamit or sobra-sobrang nagagamit, it results in a myopathy, cardiomyopathy. Hence, ang main natitignan mo sa mga newborn ay heart abnormalities. B and C ay wrong kasi wala namang infection. D is wrong kasi diabetes, hindi naman siya related sa errors of metabolism sa baby. So A is the best answer. Heart abnormalities. Specifically, mga hypertrophic cardiomyopathy. Paglaki ng muscles ng puso ng bata. 43, when admitting a newborn to the nursery, the nurse prepares to administer erythromycin. O, alam na natin to guys. Kapag erythromycin, ang ginagamit ito as antibacterial sa mga gonococcal infection. And ano lang ba yung mga sakit dito sa options ang caused by gonococcal infection? It's letter D. Options 1 and options 5. It's gonorrhea and chlamydia. And usually, these two coexist. Syphilis, sabi na natin, sa syphilis ang ginagamit dito guys ay penicillin. So, hindi effective ang erythromycin. Okay? So, 43 is letter D, gonorrhea and chlamydia. 44, a multigravida client with HIV who has recently delivered a newborn infant asks the nurse about the proper way to feed her newborn. Which of the following is a correct response by the nurse? Dapat, kapag may HIV yung mother, bottle fed na natin ang bata. Bakit? Kasi ang HIV virus ay napapasa sa gatas ni ina, sa gatas ng mother. So kapag pinasuso mo pa yung gatas mo na may HIV na nga, pinasuso mo pa sa anak mo, edi mas lalo mo dinagdagan yung viral count ng HIV virus sa katawan ng bata. Pinahirapan mo pa yung anak mo. So, X tayo guys, sa may breastfeeding. More on bottle feed tayo. 45. Maria, yes po. Thank you, ma'am. Si Mamaya, very active. Bigyan niyo ng jacket yan. Kay daddy na lang ipasuso. Diyos ko, balay mo kay daddy rin nakuha yung virus. O, di ba? Parang, mga tatay, kapag yung daddy na yan, sa kanya parang galing yung virus, what if? Okay, proceed tayo guys sa number 40. 44 ay letter A po. 45, Maria, a 40-year-old woman who is 28 weeks pregnant, comes to the ER with painless, bright red bleeding of 1.5 hours duration. What condition does the nurse suspect of Maria? Guys, matik na to ha. Pagdating sa board exams, ang situation or ang signs and symptoms ay painless, bright red bleeding. This is automatically placenta previa. Kapag naman dark red and may painful bleeding, is abruptio placenta. HMO is wrong kasi ito yung abnormal na masyadong mabilis sa paglaki ng sinapupunan. Prolapse cord, hindi naman guys. Kasi kapag prolapse cord, ang manifestation na ito ay yung baby, yung fetal heart rate ng baby, hindi yung mother. Okay? So 45 is B, placenta previa. Now, ano yung kailangan daw gawin since may bright red bleeding? So syempre, isipin natin na kapag buntis ang mother, dalawang pasyente mo. And kung ano yung nangyayari sa mother, always affected ang bata. So if may abnormality kay mother, agad-agad na rapat i-assess mo yung heart rate ni baby. Diba? Kasi baka mamaya, in distress na si baby, mag-cause pa to ng complications or worse, death ng fetus. So the best answer here, since may bleeding na nga siya, may risk siya for shock, and for shock, baka magkaroon ng alteration sa fetal heart rate, nagkakaroon na pala ng complications sa baby. So 46 is letter A. Hello po. 47. The common normal site of nidation or implantation of the uterus ay, this is letter A, upper uterine portion kasi yung blood vessels dito guys, mas abundant. So yung supply ng oxygen ng dugo, mas maganda. 47. 48. The maternity nurse is preparing for the admission of Lila, who is in her 3rd trimester pregnancy, experiencing vaginal bleeding and suspected placenta previa. Di ba guys, kapag placenta previa, nauna yung placenta kesa sa fetus. So ano daw yung questionin ni nurse dito sa doktor kapag ito yung in-order niya? Of course, is letter B. Obtain equipment for a manual pelvic examination. Bakit mo ima-manual pelvic examination yung placenta previa? Kung alam mo na mataas yung probability na baka ma-poke mo yung placenta. Diba? manual pelvic examination, bubuksan nila yung vagina. Tapos, malay mo kasi, kapag pagkabukas ng vagina, ng uterus pa, or gamit yung tool nila, ay baka mapoke pa nila yung placenta, which will result pa in more trauma sa placenta, at baka magkaroon pa ng injury, masugat, mas dumugo. So, mas delikado. So, you don't use manual pelvic examination. You don't use IE kapag meron ng placenta previa. Always, ang visualization mo rito ay either ultrasound lang, guys. Ultrasound. And also, to monitor the state of the baby, you monitor using fetal heart rate. So, questionin mo to. Questionin mo ang manual pelvic examination kasi baka ma-injure mo pa yung placenta. 49, a nurse na postpartum unit is caring for Lila, who has just delivered a newborn infant following a pregnancy with placenta previa. The nurse reviews the plan of care and monitor the client for which of the following risks associated with placenta previa. Kagaya ng nasabi kanina, guys, di ba? May bleeding. So, kapag may bleeding yung usapan, and bleeding na yung main symptom ng isang sakit, look for the options na alin ba dito yung related sa bleeding? It's hemorrhage. So, D is the best answer. DIC usually for preeclampsia yun. Chronic hypertension, malito. Kasi nga may bleeding. So, bakit magkakaroon ng chronic hypertension? Infection is wrong then kasi infection is more appropriate for ano yun? Basta yung pagputok ng panunugan. Artificial rupture of membrane. 49 is letter D. Mas prone sa bleeding yung mga placenta na naka-implant sa lower. Kasi hindi masyadong maganda yung musculature. Hindi masyadong maganda yung pagkaganon-ganon ng mga blood vessels sa may lower segment ng ating uterus at sa placenta. So, bleeding ang kailangan mong bantayan. 50. Kapag daw siya ay may placenta previa, ano yung usual treatment for partial placenta previa? Ano yung usual treatment for partial placenta previa? Usually, ang treatment dito ay bed rest. Pero sabi ni Sir Kenneth noon, hindi siya complete bed rest ha. Hindi complete bed rest. Kasi kapag complete bed rest naman, maipon naman yung dugo, baka mag-cause pa siya ng complications din. So, bed rest, ibig sabihin by bed rest natin dito is you limit the activity and you avoid extraneous activities. So, A is the best answer. You do not need to infuse pa kasi you do not need to infuse platelet kasi hindi naman DIC yung kalaban mo rito. Wala namang problema sa may clotting. So, what is the use of platelet? C, not necessarily, kasi kaya pa naman masustain yung pregnancy. D is wrong then, guys. Kasi kaya naman niya mag-proceed sa normal na labor. 51. Nurse mistress assessing lay in the second trimester who was admitted to the maternity unit. Guys, kung gutom kayo or nainom, kuha lang kayo ng pagkain para working break tayo, no? Para tuloy-tuloy tayo. To the maternity unit with a suspected of diagnosis of abruptio placenta. Again, pagkabasa pa lang natin abruptio placenta, tignan agad yung options. Alin dito, guys, yung meron sa abruptio placenta? It's letter B. Painful, uterus, at saka may bleeding dapat na dark red. Yung A, C, and D are all previa. 52. To separate previa from abruptio, Nurse Mitch, which of the following findings are included in abruptio? Select all that apply. Again, ang answer dito, guys, ay letter C. Sa abruptio placenta, may pain, may rigidity, and of course, may dark red vaginal tube. The rest are all previa na siya, guys. Mabilis lang yun, guys, no? Madali lang naman ang previa and abruptio. Kapag abruptio, yun yung mas masakit. Previa, yung hindi masyado. Okay? Number 53. Lay is hospitalized for vaginal bleeding from suspected abruptio placenta. What is the pathology of abruptio placenta, guys? Abruptio placenta, premature separation ng ating normally implanted placenta sa uterine wall. A is wrong kasi tears away from the cervical OS during dilation or results in fetal hemorrhage. Guys, ito yung mangyayari kapag manual pelvic examination ka sa may placenta previa. B, placenta is the umbilical cord hemorrhage from trauma. Hindi po, kasi ang placenta, abruptio placenta ay about sa placenta, hindi sa umbilical cord. D is wrong kasi abruptio is a rupturing of membranes along the uterine wall. Hindi lang siya rupturing of membranes lang, guys. The placenta separates. Okay? So it totally separates. That's abruptio placenta. 54. The nurse care plan for patient who has abruptio placenta should include careful assessments for signs and symptoms of which of the following, guys? Abruptio placenta, again, may bleeding. So, ang titignan mo ron ay letter B, hypovolemic shock. A is wrong kasi sa atay.
Patay yun. Ang problema dito is yung mattress at yung placenta. C is strong kasi it's for eclampsia or PAH, and hypertension is strong kasi dapat shock yung ma-experience ng patient. Shock. Diba? So number 55, since Nurse Mitch is busy, she decides to delegate clinical or client assignments in a maternity unit. Which of the following assignments should Nurse Mitch delegate to an LPN? Guys, tignan niyo yung options. Alin sa mga options na yun does not require the skills of a professional nurse, of a registered professional nurse? C, health teaching should always be done by a registered nurse. B, experiencing dyspnea, and buntis pa siya. So may difficulty, may complication. Hindi man complication, pero may difficulty. So kailangan professional nurse, registered nurse yung mag-assist sa kanya. A, suspected of having abruptio placenta, may complication. So dapat RN din. Unlike sa letter D, documenting the characteristics of a woman's lochia, isusulat lang naman ng ating LPN. Pero always remember na it is always the RN who assesses, guys, ha. Kapag assessment, dapat RN pa rin. Pero kung documenting lang din naman, of course, pwede namang i-document ng LPN yun. Kung masyadong marami yung pasyente. So the best answer is letter D po. So number 56 tayo. The nurse is explaining to a preeclamptic client how to keep track of her fetus's movements to assess fetal well-being. Which of the client's statements suggests that she needs further guidance on when to contact the healthcare provider concerning fetal movement? Guys, ang answer dito ay letter D. Bakit D? Diba? Ano ba ang normal movement ng fetus? Diba? It's 10 movements sa loob ng 2 hours. Sabi dito sa letter A, the fetus is less active than it was previously. Of course, i-report mo na siya, guys. Kasi baka mamaya nga, in distress yung patient. Letter B, if it takes longer each day for the fetus to move, i-report mo na rin. Kasi kapag yung na-experience ng fetus ay parang decrease or pagbaba mula sa usual na activity niya, this usually, most of the time, pertains na may distress sa fetus natin. So we should report it sa ating physician. Letter C, when the fetus did not move for 12 hours, ay, Diyos ko, kapag hindi na gumalaw yung fetus mo ng 12 hours, ewan ko na lang kung hindi ka pa mangamba. Diba? Of course, for the report na agad ng person, ang nanay. So letter D, bakit hindi kailangan i-report ito sa physician? Kasi nga, if the fetal movement exceeds 3 times per hour, it's normal pa naman. Kasi within 2 hours yung kailangan mong i-measures. 10 movements in 2 hours dapat. So wag ka muna mag-report. Patapusin mo naman muna yung 2 hours. Tapusin mo yung assessment. That's why D is the best answer. 57. A 16-year-old pre-gravid client who is 5 feet 1 inches tall. Guys, tignan niyo ulit ito. 16-year-old pre-gravid client. First pregnancy pa niya, ha? So ibig sabihin, 16 years old, isa siyang adolescent. So kapag may mga ganyan, yun na usually yung mga sagot. It's ang pinaka-risk factor dito ay yung pagiging part ng adolescent age group niya. It's the age. Kasi nga hindi pa kompleto, hindi pa fully mature yung kanyang body structure to carry the baby. That's why ang risk factor niya for preeclampsia ay letter C. It's always the age magpe-predispose sa'yo. 58. The nurse knows that the client needs further education when she states that preeclampsia can result in which of the following? So preeclampsia, guys, tignan niyo yung mga sakit dito ulit, diba? Ang abruptio placenta, sa labas ng fetus nangyayari. Ang preeclampsia pala, tingnan natin. Ang preeclampsia or ang seizure happens sa mismong nanay, diba? Ang abruptio placenta happens between sa nanay and sa fetus, diba? Intrauterine growth retardation happens sa fetus. Placental perfusion happens sa my fetus. Ano ba ang pathophysiology ng preeclampsia? Preeclampsia involves yung pag-constrict ng ating blood vessels and pagkasira ng ating mga blood vessels and pagka-delay sa blood flow. So automatic, kapag nagkaroon ng malawakang pagkasira ng ating mga blood vessels due to eclampsia or seizure, mataas yung risk ng abruptio placenta. Also, since nagkakaroon din ng constriction sa umbilical cord or sa may mga blood vessels during seizure episodes, nababawasan din yung pag-transfer ng blood ng nutrients and ng oxygen sa ating baby, kaya nagkakaroon ng intrauterine growth retardation. Lastly, again, kapag nagko-constrict yung mga blood vessels at nagkakaroon ng damage sa vascular integrity ng ating uterus, nagkakaroon na ng poor placental perfusion as a result ng seizures natin. So, alin lang ang hindi kasama rito? Ang hindi kasama rito ay hydrocephalic infant. Kasi ang hydrocephalus, this is due to endogenous factors. So, nangyayari mismo sa mismong fetus, sa loob ng fetus. Ibig sabihin, may problema, probable na may problema sa may collecting ducts niya, sa may brain niya, para makollect yung CSF. That's why hindi na-drain ng maayos. Hindi siya related sa may preeclampsia. So, the answer in 58 is letter A. The nurse, 59, yes po. 59, the nurse determines that instruction was effective when the multi-gravid client says she will count the number of times the baby moves during which of the following time periods. The best answer here is 1 hour period each day. Usually, kung meron dito guys, in our 2-hour period, ganun, siguro yun yung i-answer ko. Kasi doon naman guys, 10 movements every 2-hour period. Pero since 1 hour is the closest, we will answer letters. 60. Which of the following assessment results for the patient receiving IV magnesium sulfate for severe preeclampsia would alert the nurse to suspect hypermagnesemia? Ibig sabihin mataas yung magnesium level sa dugo. Guys, kung ang magnesium sulfate ay for CNS depression, alin ba dito sa options yung related sa signal Alin ba dito sa options yung related sa signal transmission? Diba? It's letter A. Hypoactive deep tendon reflexes. Kasi diba ang reflexes happen kapag merong signal transmission. Nagkakaroon ng fire up ng signal transmission. Pero since depressed yung CNS ng mother na nasobrahan sa magnesium sulfate, hindi maka-produce ng enough signal transmission yung kanyang utak para magkaroon ng deep tendon reflexes. Kaya nagiging hypoactive ito. So the answer is letter A. Ito guys, ito na naman yung mga matic. Kapag nakakita na tayo ng magnesium sulfate, matic, kapag complication related dito, hypoactive deep tendon reflexes. So ano ba ang count or ano ba ang signs ng hypoactive deep tendon reflexes? Usually ito yung mga 1 plus or 0. Kapag 2 plus yung rating ng DTR mo, ibig sabihin normal pa siya. Okay? So proceed tayo sa number 61. A 33-year-old weak client with severe preeclampsia is receiving IV magnesium sulfate. Which of the following are the desired objective of this treatment? Okay, so tingnan natin to guys ha. Hanapin natin yung mga abnormal options. So isa-isay natin siya. Number 1, temperature of 98 degrees Fahrenheit, PR of 72, R of 14 is normal, di ba? Normal naman itong lahat. So, positive ito. So, we include it sa ating option. So, matik, alis na yung letter B kasi walang option 1. So, matitira A, C, and D na lang. Number 2, urinary output less than 30 ml per hour. Guys, ang normal urinary output per hour is approximately 30 ml, di ba? Or more dapat. Kung less than dito, ibig sabihin, mayroon ng injury sa kanyang renal system. So, hindi na to normal, hindi na to positive, hindi na to desired objective. Dito hinihingi ng question. So, this is negative. Matic X na siya. So, lahat ng options sa may option 2, alisin na natin. So, alis na yung option A and option B. Ang matitira, option C, 1, 4, and 5. So, proceed na tayo sa may, mali yung magnesium, ay mali yung FHR with late decelerations kasi nga abnormal yung late decelerations, guys. So, hindi yun advisable, hindi yun desirable. DTR of 2 plus is, yun yung pinakamataas for, and it's the normal rating for DTR, for deep tendon reflexes. So, it's normal. Normal rin yung 5.6 mg/dl kasi ang level naman ng magnesium ay 5 to 8. Sorry, medyo nangawit na yung likod ko. Aish. So, proceed tayo sa number 62. After having an eclamptic seizure, a 35 weeks pregnant client starts to show signs of labor. The client should be assessed by the nurse for, again, kapag seizure, usually ang nagiging result niyan ay abruptio placenta due to the wide range destruction of blood vessels. So, dahil walang blood vessels na separate yung placenta sa uterus ni mother. So, 62A ang sagot niya. 63. Guys, kung makakita man kayo ng ganitong tanong sa board exams, ialay nyo na. Kung ako to, medyo inalay ko na to guys. Kasi honestly, hindi ko memorize yung mga normal values until now. That's why may ganito. Pero kung sakali man na ma-memorize nyo, ma-familiarize nyo, very good. Syempre, good for us. Good for you, di ba? Pero kung hindi, guys, hindi nyo masasagutan lahat, ialan nyo na. Pero we will discuss this one. But the correct answer here is letter B. Bakit? We must remember na ang platelet, ang question dito, the nurse is looking over the records of a multigravid client who is at 39 weeks gestation and may have HELLP syndrome. Which of the following test results should the nurse inform the doctor about? So ano rito yung alarming? The alarming value rito ay, it's letter B. Why? LDH is being released by the body or the organ or the tissue kapag nagkakaroon ng injury. So, kapag yung LDH mo greater than 200 and lumagpas pa ng 600, ibig sabihin, masyado ng maraming, or ibig sabihin yan, nagkakaroon ng injury sa ating katawan. And kapag inassociate natin ito sa HELLP syndrome, nagkakaroon na ng massive destruction ng ating mga thrombocytes, ating liver. That's why tumataas ito, LDH natin. A, C, and D are all within normal ranges. Platelets, 200,000 mm3, within pa siya sa 150,000 to 450,000. Uric acid, same. Pasok rin siya sa normal range, which is 2 to 6.6. Ganun din ang ating AST. Pasok din siya sa normal range na 4 to 20 units per liter. So, ang abnormal value rate ay letter B, lactate dehydrogenase. So, B is the correct answer po. Number 62, which of the following would warn the nurse that placenta previa is present while examining a multigravid client at 33 weeks? Guys, placenta previa, di ba? Ano lang ba ang placenta previa? It's painless vaginal bleeding. Somatic is letter A. 64 is letter A. 65, multigravid client at 33 weeks of gestation was admitted because of vaginal bleeding. After interviewing the client, which of the following factors might lead the nurse to suspect abruptio placenta? The answer here ay cocaine, pare. Di ba? Kasi ang cocaine, it induces vasoconstriction. It is a potent vasoconstrictor. Kaya nga, di ba, kapag cocaine ka, parang nasi-stimulate yung SNS mo, di ba? Parang kapag na-cocaine ka, dadalate yung pupils mo, tapos parang alert ka sa paligid mo, ganun. So, kagaya na sinabi ko kanina, kapag masyadong constricted yung ating mga blood vessels, hindi masyadong maayos yung flow ng dugo, which results in abruptio placenta. Okay? So, 65, the answer is letter D. Good item, di ba? Good item ang 65. Kaya yun yung maling sagot, guys. Hindi lahat ng good, tama. Okay? So, hindi lahat ng masarap, tama. That's why mali ang cocaine use. So, proceed tayo sa number 66. A multigravid client at 34 weeks of gestation with abruptio placenta was prescribed to receive whole blood replacement. Which of the following should the nurse perform first before administering the IV blood product? So again, kapag may nurse intervention, ang lagi naman nating first step ay you check the chart and you verify, di ba? The client information and verify din kung yun yung i-transfuse mo na dugo. Kasi kung naglagay ka na at nag-transfuse ka na without verifying, malay mo, iba pala yung patient. So magkakaroon pa incompatibility. Mag-result pa siya sa may what do you call this na? Yung transfusion reaction na baka magkaroon pa ng shock sa patient due to transfusion reaction complications. You check vital signs. Of course, you will check vital signs. Pero you transfuse the dugo. Dapat, for the first 15 to 30 minutes, diba, you check for 10 to 15 minutes pala, you check for complications kung may transfusion reactions. Then after which, you infuse it na within 2 to 4 hours. Diba? Hindi siya over 5 hours. Masyadong matagal yun. Baka mamaya masyadong nag-coagulate yung dugo. C is mali kasi tama naman ito, pero ang una mong itanong is kung siya ba yung pasyente mo. Okay? Letter D, at saka yung mga ganito naman, tinatanong naman ito even before pa yung blood transfusion, di ba? Upon admission, itatanong na ito agad eh. So hindi siya sumasagot sa question natin, which is nagtatanong, or which is regarding transfusion of blood product. Letter D, administer 5% dextrose. Hindi siya dextrose, guys. Kasi di ba dito, ang na-administer natin ay normal saline. So, hindi siya dextrose. So, A is the best answer. Number 66. Number 67, should be PNSS. Tama po. Double check. Yes. Sir, bakit with other? Di ba usually kapag ganyan, dalawa kayo mag-check for? Usually kapag for blood items, mga good shit na blood items, dalawa kayo mag-check. for verification, tama. Kasi baka mamaya maduling-duling ka. Diba? I-check mo, tapos i-check rin na isa as, ano man tawag doon? Hindi ko manap yung proper term. Pero it is part of the process po. Usually, ganun po sa lahat ng blood transfusion. Dalawa po kayong mag-check na nurse. Dalawa po, ma'am. Para ma-check po na tama po yung na-verify mo and para po ma-check rin po yung verification na ginawa mo na tama. Kasi nga po, very delikado ang transfusion reactions. Pagka-verify po kasi ng dugo, hindi naman na natin basta-basta may extract yung dugo, ma'am. So, kailangan po, double sure. Double sure? We must make sure. Sure na sure. Yes po, last error. Sure na sure tayo sa transfusion reaction. Number 68. 67 pala. Which of the following would the nurse expect to deliver IV when caring for a multigravid client admitted to the hospital with vaginal bleeding at 38 weeks gestation? If the client develops DIC. Again, di ba, ang problema natin sa DIC, nagkakaubusan ng ating clotting factors. So, ang bibigay lang natin ay fresh frozen plasma, fresh frozen platelets, di ba? Kasi, nasa platelets natin yung ating clotting factors. So, hindi natin kailangan magbigay ng RLS, ng dextrose, ng warfarin. Usually, kapag DIC naman, ang binibigay heparin, guys, hindi warfarin. So, the best answer ay fresh frozen platelets po. Okay. Iyan natin na. Kapag DIC, heparin dapat. DIC, heparin. Not warfarin. Yan. Screenshot nyo guys. 3, 2, 3, 2, 1, 3, 2, 1, and lipat na natin. Number 68. Number 68. The nurse is caring for a 22. Guys, kung takpan natin yung question dito, tapos tignan nyo yung options. Ano ba yung mali rito? Matik na ng letter C, di ba? Kasi nga, dapat 30 ml per hour. So kapag yung ml niya ay 25 ml per hour lang, kailangan mo na siya i-report sa physician. Okay? Now, basahin natin yung case. The nurse is caring for a 22-year-old G2P2 client who has DIC after delivering a dead fetus, which finding is the highest priority to report to the HCP. Guys, may DIC pa siya. So, may bleeding siya, di ba? So, probable na may shock ito. Di ba? So, explain po. DIC, guys, DIC, Ma'am Krisha, is ang main mechanism kasi or ang main pathophysiology bakit nagkakaroon ng DIC is because meron naman tayong coagulating factors. Kaso lang masyadong marami yung demand for coagulation. That's why nauubusan tayo ng coagulating factors kaya nagkakaroon ng bleeding. So yun yung main mechanism sa DIC. Kaya kailangan nating magbigay ng fresh frozen platelets para masupply yung needed na coagulating factors natin, yung ating mga thrombocytes, para matuloy yung coagulation sa body and ma-maintain yung integrity ng ating dugo para hindi siya mag-result into bleeding, hindi siya mag-leak sa ating outside the intravascular spaces natin. Yes po, Ma'am Krisha, yun lang yung tatanda natin usually sa DIC. Kailangan natin ng additional coagulating factors. So again, tignan natin number 68, guys. May DIC siya. High risk siya for hemorrhage and hypovolemic shock. So, ano ba yung pinakabinabantay natin kapag may shock, di ba? Is the urinary output. Kasi kapag mababa na talaga, tapos at risk pa yung patient mo siya shock, report it immediately. Kasi most probably, nagkakaroon na ng shock yung pasyente mo early stages na siya ng shock. So, yun yung number 68 po. Number 69, the nurse would put the ultrasound transducer to monitor fetal heart rate in which of the following maternal positions if a fetus at 35 weeks of gestation is in the left occiput anterior position. Kapag sinabing left occiput anterior position, ano yung naka-engage? Yung ulo, di ba? So kung yung ulo naka-engage, tapos 35 weeks na siya, malamang sa malamang, di ba? Kapag nag-Leopold's maneuver tayo, saan ba natin pinapatong yung ating, what do you call this na? Stethoscope. Saan natin pinapatong yung stethoscope para marinig natin yung FHR? Diba sa likod ng bata? So kung naka-engage yung ulo ng bata, sa tingin nyo, nasan yung likod ng bata? Diba? So i-visualize nyo yung tiyan ni mother. Kung ito yung tiyan ni mother, ha? Ito yung sa may fundus, ito yung papunta sa cervix. Yung ulo ng bata ay itong bunganga ko nasa baba. Tapos ito yung bilaykos, guys. Yan. Ito yung tiyan ni mother, Yung ilong ko, yung line ng umbilicus, andito yung fundal height, andito yung cervix, andito yung ulo ng bata. Sa tingin nyo, nasa yung likod ng bata? Nasa may taas ba ng ilong ko? O nasa baba ng ilong ko? Nasa taas ba ng umbilicus? Nasa baba ng umbilicus? Siyempre, mas malapit siya sa may baba ng umbilicus. That's why letter C is the best answer. Tama po. The fetal back is below the umbilicus on the left side. Considering yung considering yung presentation ng bata na left occiput anterior position. So proceed tayo sa 70. Kapag mga ganyan guys, visualization talaga yung makakatulong sa inyo. I-visualize nyo kung anong position ng baby habang nasa sinapupunan para mas madali makatulong. 70, a prima gravida client at 35 weeks of gestation went to the hospital because she believed her water had been broken. After testing the leaking fluid with nitrazine paper, which color confirms that the client's membrane has ruptured? The answer here is letter B. Kasi ang amnion or amniotic fluid ay alkalinic in nature. And kapag titignan natin yung nitrazine paper, ang meron na colors lang naman yan guys ay yellow, green, blue-green, blue. So, kapag yellow siya or closer sa yellow, closer sa green, it's acidic. And kapag acidic, ibig sabihin baka ihi lang yun. Pero kapag blue na siya guys, it's alkalinic, meaning yung amniotic fluid, ibig sabihin baka pumutok na yung panubigan ni mother. Pero aside from nitrazine paper, ano yung mas maganda na test na gawin natin to confirm if ano nga siya, if amniotic fluid nga ba talaga siya? It's the Fern test. Kasi ang unique sa may amniotic fluid guys is kapag yung amniotic fluid nilagay mo sa slide, pinatuyo mo at you look under the microscope, at kapag tinignan mo yung slide under the microscope, makikita mo na may fern na lalabas. Hence, kaya siya tinawag na Fern test. Okay? So 70 is letter C. 71. At 30 weeks gestation, a primo-gravid client was taken to the hospital due to an early rupture of the membranes without contractions. Her cervix is 50% effaced and 2 cm dilated. The nurse needs to assess next. Ano yung i-assess mo rito? Gaya ng sinabi ko kanina guys, diba? Kapag amniotomy, ang pinakadelikado rito ay infection. So ano ba yung sign ng infection dito sa binigay na options? Thank you. It's letter D, temperature. Tignan nyo kung ma-increase ng temperature. Bakit nagkakaroon ng infection kapag pumutok na yung panubigan? Kasi diba wala nang barrier yung fetus. Wala nang barrier yung baby. So kapag may microorganism na pumasok, madali na lang siya makakalapit sa baby. Madali na lang siya makakagapang and mag-cause ng infection. That's why 71, kapag merong premature rupture of membranes, you must always check for temperature. Letter D. 72. At 34 weeks gestation, a primo-gravid client has 35-second contractions every 3 to 4 minutes. Her cervix is 50% effaced and 2 cm dilated. Which of the following would the nurse do first if the client said, I think my bag of water just blew? The answer here, guys, ay letter C. Test nyo kung pumutok nga ba talaga. Kasi yun yung claim ng client. So, i-answer nyo yung query niya. Kung ang complaint ng client ay about sa kanyang panubigan, i-check mo talaga kung pumutok na nga yung panubigan. Sometimes the question answers itself, diba? So, since ang question ay about sa panubigan, letter C. That's the leaking fluid nitrazine paper. Pero if ever man na walang letter C rito, I will answer letter A, guys. You could, pwedeng i-check mo muna yung status ng fetal heart rate kung totoo man yung sabi ng mother. Pero syempre, it would be better to check mo muna yung panubigan ni mother. Kasi hindi naman agad-agad mag-iiba yung fetal heart rate ni baby kapag pumutok na yung panubigan. So next, 73. A 38-year-old multigravida patient was admitted to the hospital due to ruptured ectopic pregnancy. Which of the following would be crucial for determining a predisposing factor when learning the client's history? Guys, kapag ectopic pregnancy, automatic, ang main risk factor na to ay history of pelvic inflammatory disease. Recurrent urinary tract infection, magiging risk factor na ito kapag infection tumaas na sa kanyang reproductive system. Use of marijuana not associated with ectopic pregnancy to guys. Usually it is for cognitive reduction, mental retardation. Kapag kapag use of estrogen, progestin contraceptives, hindi rin siya usually related sa may ectopic pregnancy. If anything, ang oral contraception na related sa ectopic pregnancy ay mga IUD or PAP. Pero kung may nakita kayong history of pelvic inflammatory disease, yun yung best answer kapag may mga signs na, kapag may mga cases ng ectopic pregnancy. Okay? So the best answer is letter C. So proceed tayo sa number 74. A pre-gravid client was diagnosed. Sorry, boses ko, sorry. Kasi parang hindi ata ako sanay magsalita ng ganito. Okay, so 74. A pre-gravid client was diagnosed with ectopic pregnancy. Number 72 po ay letter C. 74, 74. A pre-gravid client was diagnosed with ectopic pregnancy. Which of the following medications should the nurse anticipate to be administered to the patient? Kapag may ectopic pregnancy na guys, hindi na yun mabubuhay. So, alisin na natin siya sa ating fallopian tube. And para maalis siya ng katawan, ang ibibigay mo ay methotrexate, guys. Ito naman yung usual ginagamit na, di ba? Anti-cancer drug na usual ginagamit for therapeutic abortion. Methotrexate. Kapag nakita niyo ulit yung methotrexate tapos for therapeutic abortion, gano'n, matic methotrexate na yung sagot dyan. Letter C. Ano to? Ito guys, same question lang to. So it's letter C. Kapag ectopic pregnancy, pelvic inflammatory disease ang one of the usual predisposing factor. 76. Same question lang pala. Ectopic pregnancy, methotrexate. 77. A multi-gravid client at 15 weeks of gestation was admitted to the hospital with a diagnosis of HMO. Which of the following? Balik po 74. Yan. 74, guys. 1, 2, 3, and let's go. Thank you. 77. Kapag merong HMO yung mother, she is predisposed to what complication? To PIH or pregnancy-induced hypertension. Ang mechanism dito guys ay, kasi nga diba kapag age mo, masyadong mabilis yung paglaki ng abnormal cell and masyadong nagdademand ito ng blood supply. That's why, nagkakaroon ng PIH. At saka kapag may age mo, nagkakaroon ng maraming occurrence ng mga blood vessels, unnecessary blood vessels. So, tumataas yung blood supply, minsan hindi mapunan nung katawan ni mother, that's why nagkakaroon ng PIH. So, kapag may HMO, the mother is predisposed to letter A, pregnancy-induced hypertension. Number 78. Si mother, kagagaling lang daw siya ng dilatation and curettage. Or, anong tawag doon? Yung other thing for, yung kasi ano yung curettage? Raspa. Niraspa raw si mother after molar pregnancy. So, ano yung complication na babantayin mo? Of course, it's hemorrhage. Bakit hemorrhage, guys? Siyempre, ikaw ba naman, yung tissues mo sa loob, yung organ mo, niraspa. So, di ba, hello po. So, niraspa yung uterus ni mother, di ba? So, automatic, may trauma sa uterus. At saka may damage sa may tissues. So, magkakaroon ng bleeding. That's why we must look for hemorrhage. Letter B. Okay? Yes po, raspa. Thank you po. Ay, Ma'am Alcaraz. Hindi po Ma'am Alcaraz, Ma'am Shara, nauli po yung ibang question, 75 to 76. 75 and 76, na ulit po sila. 75 po ay letter C, 76 letter C po. Saan pong punta natin, Ma'am Joy? To the moon. Charis. Ingat po sila. Number 78. So number 78, hemorrhage. Number 79 tayo. A multi-gravid client asks the nurse as to when she can conceive after treatment with molar pregnancy. The nurse should answer by not getting pregnant for how long. Guys, kapag meron kayong H-mole, saka kayo pwedeng magbuntis after a year. So, dito guys, for the first 6 months, every month kayo magte-test for HCG titer sa dugo. Then after 6 months, every 2 months na lang, hanggang ma-reach nyo yung 1 year. Tapos kapag mababa yung value ng HCG, kapag normal na, deemed normal na by your physician, then you can continue with pregnancy. 79, letter B, 12 months. 80. Nurse Tammy is monitoring patient Jocelyn in the immediate postpartum period for signs of hemorrhage. Which sign, if noted, would be an early sign of excessive blood loss? Guys, kapag sign of hemorrhage, early sign would always be tachycardia. Ito matic na to guys. Kapag ako dati nalilito ako kapag mga signs ng shock, kasi parang tama naman silang lahat, 'di ba? Pero kapag early signs, matic na tachycardia ang sagot. So yun yung lagi kong sinasagot kapag may early signs of hemorrhage, tachycardia. Siyempre nagko-compensate yung dugo sa para mapunan yung blood supply na kailangan ng katawan. Kaya binibilisan. Diba? Habang papaubos yung dugo sa mga intravascular space natin, binibilisan niya magtibok para masupply niya yung pangangailangan ng katawan. The letter B. 81. Nurse Tammy is preparing a list of self-care instructions for Jocelyn, who was diagnosed with mastitis. Which instruction should be included in the list? Any kind of shock po. So number 80. Depende sa shock guys kasi parang meron tayong neurogenic shock, so iba yung mechanism nun. Pero usually kapag mga hypovolemic shock, yun yung sign niya. Pati naman cardiogenic shock actually. Kasi cardiogenic shock, hypovolemic shock, usually tachycardia. Kapag, if I'm not mistaken, kapag neurogenic lang yung medyo iba yung baliktad na. Kapag neurogenic, baliktad yung manifestation. It's bradycardia. Thank you, Ma'am Maya. So yun po, Ma'am Clarence. Ay, Sir Clarence. Sir Clarence. Thank you po. So proceed tayo sa number 81. Ano daw yung ituturo mo kapag may mastitis? It's letter A, B, C, and D. So mali yung letter E kasi you will not stop the antibiotics kapag wala na yung sakit. Diba? Tapusin mo yung duration to prevent resistance. Letter F, avoid decompression. Guys, kailangan i-decompress yung breast. Kailangan mailabas yung gatas para hindi maipon sa loob, para mas lalong hindi magbara yung ating mga mammary ducts and hindi maipon yung apicent sa loob. So, A, B, C, D ang tamang sagot. We're supportive, bro. Of course, kasi masakit. Baka mamaya kapag hindi nakasupport, mas lalong malagdag yung pain. Rest during acute phase. Acute phase, guys, siyempre, i-rest mo kung talagang masakit, guys. Pero yung rest na to, siyempre, is parang important to rest naman kasi nga merong nangyayaring infection. So, rest, this is positive. Hindi niya naman sinabing, do not breastfeed. Kung do not breastfeed, or avoid breastfeeding, gano'n, yun yung mali. C, maintain a fluid intake. Tama to guys, para mas maraming may labas na gatas. D, continue to breastfeed if the breasts are not too sore. Tama ulit to. Yun yung complementary yung option B and letter B. Siyempre kung yung masyadong masakit naman talaga guys, siyempre, wala naman akong suso, so hindi ko alam. Pero kung upon imagining naman, kung masyadong masakit talaga, sa tingin ba natin, makakapag-breastfeed din talaga yung mother? Siyempre hindi. Pero kung kaya, why not? Kapag masakit na, may tutulong na. Kapag masakit na, tigilin na. Tama po. Ay, ano may tutulong na? Ma'am Abigail, what? Sinong tutulong? Okay, so proceed po tayo sa number 82. 82, Nurse Tammy then provides instructions about measures to prevent postpartum mastitis in the future for Jocelyn, which response by Jocelyn would indicate a need for further instruction. Ano raw yung mali rito sa options natin? Ang mali rito guys ay letter D. Kasi you will not wash your nipples with water. Kasi, you should not wash your nipples with soap. Kasi soap is drying. And kapag nag-dry yung nipples natin, it can induce cracking. Kapag nag-crack yung nipples, syempre mayroon ng portal of entry yung ating bacteria, which can cause infection. Tama to guys, I should breastfeed every 2 to 3 hours. Kasi nga, para ma-decompress yung dibdib, malabas yung gatas, para hindi ma-block yung ating mammary ducts. I should change the breast pads frequently. Of course guys, kasi that's hygienic. Kapag hindi ka nagpapalit ng breast pads, Diyos ko, namuhay na yung mga bacteria dyan. Letter C, I should wash my hands well before breastfeeding. Opo, tampo. So number 83, meanwhile, Nurse Tammy is assessing Tina, who is in the 4th stage of labor, and knows that the fundus is firm but that bleeding is excessive, which should be the nurse's initial action. Guys, excessive na raw yung bleeding. So, ibig sabihin, complication na ito. And kagaya na sabi ko kanina sa NP1, kapag may complication na, always notify the healthcare provider pag ganito. Hindi mo, okay yung massage the fundus, kaso lang, hindi naman boggy and soft yung fundus niya, di ba? Sabi sa situation, the fundus is firm, so walang magagawa yung massage mo. You will record the findings after mabigyan ng proper intervention yung complication, di ba? Place the client in Trendelenburg position, letter D, hindi naman siya makakatulong. In fact, kapag pinosition mo pa nga siya in Trendelenburg, mas lalo pa siya mahihirapan huminga. So mas lalo pa na baka mag-complicate yung situation. So the best answer, 83I, letter C. Notified healthcare provider. 84, on the other hand, nurse Tammy notes that patient Susmita's uterus feels soft and baggy. Ito na guys, kapag soft and baggy, matik na letter C. Massage the fundus until it is firm. Okay? 84, letter C. 85, Nurse Claire assisted with the birth of patient Gloria's newborn, Fulgencio, mga nanonood po ng Modern Family. Fulgencio, which nursing action is most effective in preventing heat loss by evaporation. Part ng EINC natin guys, diba? Ano bang ginagawa natin para maiwasan natin yung heat loss sa patient? Maiwasan yung hypothermia, diba? Heat loss related sa hypothermia. So ano ba yung part ng EINC natin na ginagawa natin to prevent hypothermia? Is letter C, drying the infant with warm blanket. How guys? This is sa may concept, yes, fermented milk. So kapag may additional lang guys kapag may mastitis yung mother, maalat-alat yung gatas. Hindi naman sa na-try ko na, pero yun yung sabi sa theory. Try nyo na lang guys, tapos sabihin nyo na lang sa akin kung tama. Thank you. Okay, dito. Balik tayo sa evaporation. Heat evaporation or heat loss sa evaporation is due to the presence of water sa balat. Kapag kasi basa yung balat natin, it acts as parang conductor ng heat. So yung heat sa katawan natin mag-transfer sa water. So kapag nag-evaporate yung water, magiging warm, warm, parang yung heat, mag-evaporate na with the water. So parang tataas yung warm air mula sa katawan natin. Yung guys, yung cycle ng cold air and warm air, parang ganun lang din kapag basa yung katawan natin. So kapag 85, letter C po pabalik po sa 84. Yan. Proceed tayo sa number 86. Nurse Claire proceeds to administer erythromycin. Erythromycin ulit. Tanong nila, para saan daw yung erythromycin? Diba? Ang erythromycin, kaya nasabi natin kanina, para maiwasan yung pagkabulag ni baby. Ophthalmia neonatorium or complications sa mata brought by ating mga gonococcal infections, kagaya ng syphilis and chlamydia. Chlamydia and gonorrhea, I'm sorry. So it's letter D. 86, letter D. 87, Nurse Claire prepares to administer vitamin K to a newborn. Tinanong daw ni Gloria kung para saan daw yung vitamin K. What is the best response of Nurse Claire? The answer here, guys, is letter D. Kasi, di ba, paano ba nabubuo ang clotting factors natin? Paano ba nabubuo ang clotting natin? It is induced kapag nagkakaroon na tayo ng normal flora or bacteria sa may intestines natin. Ang problema, ang mga newborns, hindi pa naman sila kumakain, di ba? So, anong source nila ng normal flora, ng vitamin K? Wala. So, tayo muna yung magbibigay sa kanila. Parang spoon feed muna natin through injection. Kasi nga, pagkapanganak, di ba, guguntingin yung umbilical cord. So, may bleeding na. So, agad-agad, kailangan na niya ng vitamin K para maiwasan yung sobrang pagdudugo sa katawan. Hence why, wag na muna nating magturok na tayo agad ng vitamin K. Sabihin natin, magbe-breastfeed naman po yung bata, di ba? Part ng EINC. Pero it will take time para din ma-absorb ng bata, ma-metabolize ng bata yung pagkain and to produce his or her own normal flora. So, B is the best answer, guys. 88, after giving EINC, Nurse Claire assesses Fulgencio after circumcision and notes that circumcised area is red with a small amount of bloody drainage. This is normal lang. So since normal lang ito, syempre, may trauma, may pagtulit. And malamang may dugo talaga, may minimal amount. So you just document the findings. Saka ka lang mag-apply ng pressure, ng reinforcement kung may panunugo talaga, kung may excessive bleeding. Then, i-report mo na sa physician kapag may excessive bleeding talaga. Pero now, since normal naman yung situation, you just document it. So number 89, which statement by patient Gloria reflects a new mother's understanding of the teaching about the prevention of newborn abduction. Guys, A is wrong kasi hindi mo siya ilalapit sa pintuan. Siyempre kapag malapit sa pintuan, easier access na yung mga abductor sa baby. So mali na yung A. Letter B, some healthcare personnel won't have name badges. Guys, lahat ng healthcare professionals should have identification bands or identifiers. Kasi, syempre, he or she is working sa hospital. So, kailangan alam ng patient na she is part of the team. Okay? And one way para ma-achieve yun ay yung ating identifiers, mga ID bands. D, it is okay to allow the nurse assistant to carry my newborn to the nursery. Again, kapag mga ganito, kapag mga transportation to the nursery, gumagawa nito guys, ay responsibility ito ng registered nurse. So, ang best answer dito sa 89, letter C, I will ask the nurse to attend to my infant if I am napping and my husband is not here. Number 90, after a while, Nurse Claire receives a telephone call to prepare for the admission of a 43-week gestation, newborn with Apgar scores of 1 and 4, and planning for admission of this newborn with the nurse's highest priority. Guys, for emergencies, ABC, airway, ang highest priority natin. So, it's letter B. Connect the resuscitation bag to the oxygen outlet. Excuse me po. Excuse me. Letter A, cardiorespiratory is for circulation. Letter C is for circulatory support then. IV line water. Letter D, radiant warmers for to prevent hypothermia. Okay? Pero ang main na uunahin mo is to provide support sa kanyang airway. So B is the best answer kapag emergency situations. Yan. Number 91. After admission, Nurse Claire has been monitoring the newborn for RDS. Which findings should alert Nurse Claire to the possibility of this syndrome? Select all that apply. Guys, ang answer dito ay letter A, B, D, and E. Bakit mali ang letter C, guys? Mali ang letter C kasi hindi naman siya related sa respiratory problem. Hypotension is more on circulatory problem. Eh, ang problema dito ay respiratory distress syndrome. So, hindi na natin i-include ang letter C. Hindi rin included ang letter F kasi ang RDS ay isang acute disease, acute illness. E di ba ang barrel chest, it develops over time. So it is for chronic illnesses. That's why hindi siya included sa RDS. So ang matitira na lang ay A, B, D, and E. And ito yung mga signs and symptoms usually sa respiratory distress. Okay? So proceed tayo sa number 92. After being discharged, Gloria calls the clinic and reports that when cleaning the umbilical cord, she noticed that Fulgencio cord was moist and that discharge was present. Guys, kapag discharge, ibig sabihin, mayroon ng infection. Somatic abnormal na yon. So what should you do? What should you tell Claire? Na dapat, dala na niya yung infant sa clinic. Kasi nga, ang problema, kapag hindi naagapan agad, pwedeng umakyat yung infection papunta sa blood system ng bata. So magkakaroon ng systemic infection, ng sepsis. And that's very dangerous sa kalagayan niya. That's why you bring the infant to the clinic for him to receive the necessary antibiotic treatment to prevent complications just like sepsis or worse, death. Okay? So, A is the best answer. 92. Meanwhile, Nurse Claire is planning for a newborn of a mother with diabetes mellitus. What's the priority nursing consideration for this newborn? Again, guys, kapag galing sa diabetic mother, may risk for hypoglycemia. So, ang related lang naman sa options ito, na talking about low blood glucose levels, talking about hypoglycemia, is letter B. So, B is the best answer. To maintain safety, di ba? Kasi it could be na yung patient lethargic, baka mamaya biglang nahulog, habang binubuhat, biglang nahulog, ganun. So, baka mamaya maka-injury pa sa patient. So, maintain safe. Number 94, additionally, Nurse Claire creates a plan of care for a woman with HIV infection in her newborn. The nurse should include which intervention in the plan of care? Guys, bakit mali yung letter A? Mali yung letter A kasi being born from a mother who has HIV does not significantly affect the vital signs naman of the newborn unless nag-activate na yung virus. Letter C is wrong kasi initial referral to evaluate for blindness. Again, guys, yung HIV does not necessarily result in blindness, deafness, ganun naman. Kasi di ba, ang HIV ay more on the immune system. So, hindi siya directly related dito sa mga nabanggit dito sa letter C. D is wrong kasi, again, you should not breastfeed. You should not encourage breastfeeding kapag may HIV si mother. Kasi through breastfeeding, nadadagdagan mo yung viral load ng newborn mo, which is not ideal. Kasi mas at risk siya for the activation of the virus. So the best answer is letter B. Maintaining standard precautions at all times. Kasi nga, you're dealing with client with HIV. Of course, it's also your responsibility to protect yourself kapag mga ganitong ka-contagious na yung mga sakit. So always remember to have standard precautions kapag dealing with patients with HIV. Mapa-mother man yan, mapa-newborn man yan, have standard precautions. 95, Nurse Claire is providing instructions to the mother of a newborn with hyperbilirubinemia who is being breastfed. Which of the following should she instruct the mother? Guys, it is best kapag may hyperbilirubinemia ang baby na mag-encourage tayo ng breastfeeding. Bakit guys? Kasi yung breastfeeding, it improves kasi yung caloric intake ng bata at saka it prevents dehydration din. Also, due to breastfeeding, nagkakaroon din ng hastening sa may pag-excrete ng bilirubin, di ba? So, mas bumibili. So, B is the best answer. Continue to breastfeed every 2 to 4 hours. A is wrong kasi the baby needs food. The baby needs nutrients. So, supply him. C is wrong kasi doesn't necessarily need to bottle feed naman. Wala namang connect yung bottle feed. D is wrong din kasi again, wala namang connect yung bottle feeding, di ba? Unless it's HIV. 96, the nurse examines a collection of blood beneath the newborn skull and that newborn skull that does not cross suture lines. The nurse notes this as it's cephalohematoma. Sabi na nga guys, collection of blood beneath the newborn skull. So, di ba, kapag may collection ng blood, ano ba yun? It's hematoma. So, ano na mismo? B, cephalohematoma. Ang kaput saxidanium naman, it is yung swelling ng ating mga soft tissues. Sa soft tissue, kaya nagkakaroon ng parang duwende yung ulo ng patient. Di ba? Parang pa-triangle. So, ibig sabihin, kapag nag-gano'n na siya, guys, ibig sabihin, nag-cross siya ng suture line. So, hindi siya proper sa tanong. C and D are anatomical points siya sa ulo. So, hindi siya related. Sagot guys, 96. Collection of blood, hematoma, automatic. Letter B, cephalohematoma. Number 7. A newborn is evaluated by the nurse after birth, which assessment findings reveal a problem and indicate a need for more evaluation. Guys, normal lang ang rosy skin color. In fact, you want that kasi it is a sign na merong enough circulation si baby. Heart rate of 138 beats per minute is normal din. Kasi nga, di ba, 120 to 160, so it's normal. Auxiliary temperature of 36.5 is within the normal range. So, ang mali rito, by the process of canceling out, is letter C, noisy breath sounds. Kasi kapag noisy ang breath sounds ng bata, ibig sabihin, he or she might be in distress. So, that needs more evaluation. Baka mamaya, sudden death syndrome na yan, di ba? Ang delikado, baka mamaya magtuloy pa yung sa sudden death syndrome. Which is delikado. 98, which of the following reflexes is being evaluated by the nurse? Ayan, sorry. 98, which of the following reflexes is being evaluated by the nurse? By elevating the infant's body slightly over the crib and lowering it abruptly and then observing for bilateral arm extension and leg flexion. Guys, this is motor reflex. Diba yung parang nahuhulog ka? That's motor reflex. Gallant reflex is yung stimulating mo yung spine. Sa gilid ng spine, guys. Stimulate mo yung curve ng hip nila towards the lower back, next to the spine. That's the gallant reflex. Palmar grass naman, guys. Palmar grass is yung ganyan. Palmar grass. Diba? And then Babinski reflex is yung sa sole. Diba? Yung Babinski reflex. A is the correct answer, number 98. 3 to 1, number 99. The nurse is questioned by the parents of an infant about the need to test their child for phenylketonuria. The nurse should respond appropriately by saying, kapag phenylketonuria, guys, kailangan na i-check for mental retardation. So the best answer is letter A. Ang phenylketonuria talaga is one of the ang tawag doon, yung sa proteins, essential proteins na kailangan ng body to encourage fetal development, especially sa may brain natin, cognition. Basta kapag nakakita ka ng phenylketonuria, matic na yan, tingnan nyo na lang sa choices, mental retardation. Number 100 naman, the nurse is discussing the characteristics of newborn and toddler stools with a group of pregnant clients. Which of the following is a correct statement by the nurse? It's letter C. For the first 24 hours, the feces passed by the newborn are black, tarry, and sticky. Kasi, because of the distinct color from the bile. And di ba kapag pinanganak yung mother, we are checking for meconium stain, amniotic fluid, or kung meconium stain ba si baby. Kasi nga, ibig sabihin, may tae. Kapag sinabi natin meconium stain, may tae. Anong color ba ng meconium ng tae? Diba? It's greenish, blackish to greenish. It's tarry. So, yun yung correct answer, letter C. A is wrong kasi kapag breastfed, dapat bright yellow or golden in color siya. And dapat pasty kapag breastfed, guys. Kapag naman formula fed, usually more darker yung color niya and must form yung stool. Tapos, kapag during the first week of life, the feces of the newborn are brown. Again, it depends on the pinapakain mo, kung bottle fed or breastfed. Also, according din sa may nabasa ko, it is generally third day, ganun. Third day, doon nagiging more on brownish yung color ng tae ng baby. The third day of life. Okay, so, yun na yung NP2 natin, guys. 5 minutes break tayo. Tapos proceed tayo sa may NP2. Okay? Balik tayo ng 6:30. Sir, may break po ba? Break tayo, guys. Balik tayo ng 6:30. Guys, pwede pa natin Ma'am Maika, by that po ba you meant presentation? Ma'am Maika, ano po yung 1 to 37 po, yung sagot po ba mismo or yung presentation po? Guys, if may copy kayo ng answers ng numbers 1 to 37, okay lang ba na share ka, Ma'am Maika? Thank you. Sige, i-rundown lang po natin ng mabilis, Ma'am Maika. Ma'am Maika, andito po ba kayo? NP po, NP3 po, guys. Okay na po, Ma'am Maika. Thank you. Recall 8 pa rin po. Okay, start na tayo sa may NP3. Start na ba tayo or gusto nyo mag-additional 5-minute break pa? Sabi mo additional may ano, sige guys ano na lang, additional tayo ng mga 2 minutes gano'n, tapos tignan na lang natin. 2 minutes para tulungan natin yung 2 to 5 minutes para wait lang, hanggang 8 tayo guys 'no. So ito, 50 items, 50 items, 51, 85 to 97. Guys, may answer ba kayo ng number 85 to 97? Kay sir or sino si Nojo Matongko? Sige guys, wala tayong kay Sir Nojo Matongko. Hindi ko alam kung totoong pangalan niyo ba yun guys or minsan screen name. Resume tayo ng mga ano, 6:35 kami. Medyo magpahinga lang konti yung boses ko guys. Parang, oops na. Ganito pala yun. Thank you po ma'am. Ay Sir Nathaniel, thank you very much po. Sir ano guys, ang gamit ko na calculator nun. Alam niyo yung calculator sa sari-sari store, yung malaki? Literal na ganun talaga yung nabili ko guys. Yun lang yung available noon eh. Yung tig 700 ata na calculator. Yung yung parang typewriter. Yes, yung tak 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 gano'n. Sir puwede po ba? Puwede guys. Basta color white. Ako nagdesisyon. Ako pala yung BON. Depende na lang siguro guys kung anong i-re-require nila. Pero sa'min puwede naman ata. Seryoso, pero yung calculator guys, ano, sa'min konti lang naman yung ano, isa nga lang ata yung tanong, eh. Ang funny dun kasi isa lang yung computation sa amin. Yung kaibigan ko namali pa niya, 'di ba? Kahit hindi ka na mag-calculator nun namali pa niya. "Sir sir puwede po ba mag-scrub sa Sunday?" Hindi ata dad. Ang alam ko yung gala uniform, yun ata yung ire-require, gala uniform. "Sir ano po preparation and ganaps niyo po nung last 10-50 days?" Masyadong matagal yung 50 days, Maya. Siguro akin ng mga last 1 week. Nung last 1 week lang ako nagkaroon ng parang ritual. Yung last 50 days nag-ano pa rin ako ng ano, ang tagal ba ng 50 days? Basta ang ginawa ko ng mga last 1 week, yun na yung ano, yung parang nanood na talaga ako ng ano, focus na talaga ako sa mga rationalizations. Yun lang, wala namang special na ginawa guys, hindi nga ako pumunta ng Manawag. Parang kinupit ko na lang ata yung Manawag ko dapat. So ano po mas mahirap board exam? Honestly, mas mahirap yung exam ng top rank. Pero maybe it's because nasanay na tayo sa napakarami nilang binigay. So we already got used to it. Tapos nagkaroon na tayo ng clue kung paano yung tatakbo yung board exams. That's why mas madali na ng board exams. Sir, pwede ba kahit di naka-white shoes gamit? Ang alam ko white shoes guys eh. Ganun ata. Yung maliit na calculator sir pag duty. Pwede yun. Basta, ewan ko hindi naman chinak yung sa amin ay. Basta yung ano, yung manual calculator. Miss Angel. Sir, nagsuot ka ng red brief. Yung isa red, yung isa maroon. Hindi ko alam. Yun lang yung sinunod ko ata na ano. Taga saan kayo? Sa bahay po namin. Sa Baguio, sa ano po, sa San Fernando, La Union po. So, yung mga level lang po ng recalls ang hirap naman. Parang mas mahirap pa po ang recalls kaysa sa boards po. Guys, Ma'am Adora, if I'm not mistaken, may nag-send po rito kanina ng answer sheet ng NP1. Hindi ko po na-try yung mag-answer ng sinubukan ko po, promise, sinubukan ko talaga yung mga mag-search, mag-answer ng mga 100, pero hindi ko nakakaya. Ewan ko kung bakit. Siguro tamad talaga ako. Sabi nila mahirap daw yung NP3, pero manageable naman guys. Sir, in-expect niyo po bang mag-top kayo? Hindi kasi sa batch namin, maraming manya. Or kunwari sa ganun ng comparison. Maraming manya, tapos ako noon ay cum laude. Cum laude? Hindi, cum laude. Pero maraming manya. So isipin mo, since maraming manya, mga 8 ata sila or 10, syempre isipin mo, may mas magagaling sa'yo. So hindi mo i-expect. Amin na Gab, amin na yung lapis mo, tasahan ko. Gusto mo hanggang, tasahan ko hanggang eraser. Okay, so, 6:35 na start na po tayo. So, hindi ko na matandaan yung scores ko ng recourse ay ng recalls, pre-boards gano'n. Siguro mga 60 gano'n, 60 to 70 gano'n lang talaga. Hindi Ma'am Krisha. Sir, ilan daw po wala po Ma'am Mitzi. Ma'am Krisha, hindi po ay. Ano po mahirap, recalls o pre-boards? Pre-boards po mas mahirap. Baharin? Baharin wala po, hindi ko lang po sure, parang familiar po pero baka hindi ko na po matandaan. Walang recommended score sa pre-boards, guys. Ang recommended I mean siyempre ang dapat na inaano niyong score ay mas mataas sa 60%, 'di ba? Yun yung i-aim niyo, more than 60%. Pre-boards hindi ko na matandaan, guys, basta mga 60 to 70 gano'n lang. Okay, so start na tayo, NP3. Ito na guys, oh, sa favorite nating med-surg. Wag kang umiyak Ma'am Jaira. Mas maganda ng mahirapan ngayon, bumagsak-bagsak ka ngayon kaysa sa board exams. Gusto mo 'yun? Siyempre hindi, ngayon na lang, 'di ba? Tama, kaya sa pre-boards kahit 20 okey lang. Joke lang guys. Siyempre we should always want to achieve greater scores, higher scores. Oh, proceed tayo sa nurse and practice 3, mga favorite nating mga nurse advocate pero inom ng inom sa gabi. Okay, let's go, shot. Oh, eh, di natamaan ka Ma'am Jean, char. Let's go na, number 1. As part of her health teaching, Nurse Jo is discussing dietary sources of iron for patient Andrew who has iron deficiency anemia. Sorry, ASMR pala ito. Sorry, nag-take ako ng strepsils. Anemia. Which menu should be included in the teaching? So ano daw yung may highest sources of iron dito, guys? The answer here is letter B. Tandaan natin na pagdating sa protein, beef has the highest source of iron. Kaya nga ito yung pinaka-red sa mga protein natin, di ba? Adobong manok. Manok, very white. So mataas to sa protein. Pero iron ang hinahanap. So beef tayo. Also, pagdating sa gulay, mga colored greens, especially broccoli, mataas yung iron content niya. And then may orange juice pa siya. So it aids sa absorption ng iron. A is strong kasi, sorry, biyain ko muna guys. Okay. Milkshake, corn dog, and soft-serve ice cream. Yung option na ito ay wrong kasi it's more on sugar, calories, and carbs. So walang iron dito guys. C, adobong manok, mababa yung iron niya. More on protein. Tortang talong is very less in iron then. More on fiber siya guys. And Coke, it's sugar. D, spaghetti, macaroni, salad, and lemonade. More on carbs ito guys. Carbs and calories. So best answer is letter B. Number 2. After 2 weeks, patient Andrew returned to the clinic for a follow-up checkup, which assessment findings indicate compliance to treatment. Select all that apply. The answer here guys is letter A, B, and C. So, bakit mali ang letter D? Kasi nga 'di ba kapag nag-take ka ng iron supplement, nagiging reddish, ay hindi reddish, nagiging blackish yung time. Mainly because this is due to iron. Bakit kasama yung flushed cheeks? Flushed cheeks, ibig sabihin, di ba, kung namumula yung pingping mo, yung pisngi mo, ibig sabihin may blood flow sa mukha mo. So, hindi ka nagkukulang ng RBC. Kasi di ba, ano ba nagkukos ng flushing? It's yung rush ng blood and yung RBCs natin. So, bakit may more energetic? Of course, mas marami kang RBC, mas maraming, opo, tiga San Fernando La Union po ako, sorry. So, ping-ping. Siyempre, kapag mas marami kang RBC, ganun, mas marami kang sources ng oxygen. True, sir, very low ng oxygen. So, mas energetic ka. Now, letter C, complaints of nausea at times. Sabihin natin, hindi ba parang ano ito? Parang hindi naman to positive. Pero, nausea at times, when you take iron, is a normal side effect. Kasi nga, di ba, iron, um, proud Ilocano, iron, nag-i-irritate siya ng ating GIT. So kapag nai-irritate yung GIT natin, it's normal for the body to send signals sa ating utak para ilabas yung iron. So ma-feel nauseous talaga tayo. It's just a normal compensatory mechanism kapag nagagasgasan yung ating GIT. Okay? So next tayo, number 3, Which of the following statements by Mrs. Hidalgo, whose son has been newly diagnosed with sickle cell anemia, should Nurse Gia rectify? Okay, so ang answer dito guys ay letter A. Bakit? At least pwede pa kami magpunta ng ulap. Guys, Mount Ulap. Guys, Mount Ulap ay bundok. Kapag mga bundok, matataas na lugar, mababa yung oxygen saturation. Imagine mo, yung anak mo, mayroong sickle cell anemia, hindi na nga maganda yung storage site niya for oxygen sa katawan, ipupunta mo pa siya sa lugar na mababa yung oxygen content. Hindi paano na lang yan? Nahihirapan na nga yung katawan niyang magdaloy ng oxygen sa bawat parte, i-restrict mo pa yung sources niya ng oxygen. E di pinatay mo na yung anak mo. Diba? Yes, tama po mamaya. It's high altitude. So, anong anong point mong magulang kung gano'n ka magulang? That's why as parents, we must learn this. Or ngayon pa lang, dapat maging mabuting magulang tayo sa mga anak natin kasi ito yung mga pinag-aaralan natin, guys. So, i-apply natin sa mga anak natin, okay? So, A is the incorrect answer. A is the correct answer. Kasi ito yung mali. Ito yung hinahanap ng question. Okay? Number 4. Patient Shane diagnosed with pernicious anemia asks Nurse Natty why he needs vitamin shots. Nurse Natty is correct if she states that. Guys, tandaan natin na kapag pernicious anemia, kulang yung production ng intrinsic factor para ma-metabolize ng katawan natin or ma-metabolize ng katawan natin ang vitamin B12. Vitamin B12 ay cobalamin. Cobalamin. So kahit na, tignan mo yung options A and D, kahit na painumin mo siya ng ilang pirasong pills sa isang araw, kung wala namang intrinsic factor and wala namang intrinsic factor, hindi rin ma-absorb ng katawan yung vitamin B12. Ang problema kasi, yung kawalan ng intrinsic factor is endogenous. Talagang nangyayari na sa katawan ng tao. It could be na kasi ang intrinsic factor, di ba, produced by our parietal cells sa ating GIT. So, possible na kapag mayroong mga autoimmune disease sa GIT ng tao, like Crohn's disease or inflammatory bowel syndrome, usually, sila yung mga nagkakaroon ng pernicious anemia. So, ang best way para ma-supply yung B12 ay, of course, so ang reason kung bakit binibigyan ng shots imbes na pills is because nga hindi kayang ma-absorb ng katawan natin ang B12 from foods kapag mayroon tayong pernicious anemia. That's why they are given through shots. See, vitamins are necessary to make the blood cells. Guys, hindi naman, vitamin B12, hindi naman siya for blood cells, guys. Diba? Number 5. Patient Shane further asks about the durations of her shots. Nurse Nati is correct if she states what? Guys, since nga meron siyang innate abnormality. Excuse me po. Since meron siyang innate abnormality, pagdating sa kanyang GIT and production ng intrinsic factor, magte-take siya ng shots for the rest of her life. Okay? Pagdating sa pernicious anemia, magte-take ka ng shots for the rest of your life. Kasi kulang yung ability ng katawan mo to produce intrinsic factor to process cobalamin sa mga foods. Lifetime na siya, guys, ha? Lifetime na siya. Number 6. Patient Joe has been admitted for observation due to reports of increasing number of episodes of chest pain during the last week, which statement by Joe would be of greatest concern to his nurse. Number 6, the answer, guys, is letter C. Bakit? Tingnan niyo sa letter A, B, and D. Lahat ng options na ito, may ginawa si Joe bago sumakit yung tiyan niya. Sumakit yung puso niya. Ibig sabihin, yung kanyang angina was predisposed by an activity. And that's normal, di ba? Kapag may problema ka na sa puso, tapos gumalaw-galaw ka pa, syempre, may strain yung puso mo kasi kailangan niyang mas mag-work harder para ma-supply yung necessary blood supply, di ba? However, kapag tingnan niyo yung option letter C, I had chest pain yesterday while I was sitting in the living room watching television. His doggy. He's watching lang daw, nakaupo lang daw siya. Tama, wala namang ginagawa, 'di ba? Wala naman siyang ginagawang masama, pero biglang sumakit yung puso niya, 'di ba? So that's abnormal na. That's obviously a sign na mas lumalala yung kanyang angina. Ah, ako wala naman ginawa pero pinasakit niya pa rin yung puso. Maybe because, Lorenzo, baka naman kasi nagiging masyadong passive ka. Siyempre kailangan mo naman ipagtanggol sarili mo naman. Baka naman, 'di ba nga, kagaya ng sabi ko kanina, hindi na uso ngayon yung being passive. Kailangan may gawin ka naman to protect your heart. Kung ganyan, edi hiwalayan mo. Parang hindi mo nag-grade 2 ito. So proceed tayo sa number 7. Number 7, Nurse Rose is teaching patient Joe about nitroglycerin. Nurse Rose is correct if she tells him that the NTG administration is effective if Ano ba ang purpose ng NPG, ng nitroglycerin natin, di ba? Nitroglycerin is given to relieve the patient from pain. So alam mong effective siya kapag, of course, nawala na yung pain ni patient. Nawala na yung pain ni patient. Letter A, tingling sensation is felt under the tongue. Guys, this is a sign na potent yung gamot. Na pwede pa yung gamot, na hindi pa expired yung gamot. That's letter A. Letter B, pulse rate increases. That's the opposite of what you desire. Kasi when you give NTG, supposedly dapat bababa yung pulse rate, di ba? Then letter D, activity tolerance increases. This is good. Siyempre, pero the best answer would be letter C. Kasi ang main goal ng NTG administration is to relieve the patient from the pain that he or she is experiencing. Now let's proceed to number 8. During an episode, Joe immediately takes NTG tablet sublingually. However, he is worried that it might not provide relief. What should Nurse Rose do? Di ba? Ilan yung pwede nating ibigay na NTG tablet sa ating patient? 3, tama. And gano'ng katagal yung interval per tablet? 5 minutes. Tama, 5 minutes. So, kapag hindi siya gumaling o hindi siya na-relieve sa first tablet, ang gagawin mo, syempre, magbigay ka ng pangalawa. After 5 minutes, di ba? So, the best answer here is letter A. B is not correct kasi kapag mas mataas yung paa kaysa sa katawan, mas mataas din yung cardiac effort na kailangan. Di ba? Para ma-supply ng puso yung dugo papunta sa paa, papunta sa extremities. C is mali kasi hindi ito yung initial, hindi ito yung primary. Hindi na siya related din sa may NTG. D, hindi naman kailangang i-call ang physician and alert code kasi nga, manageable mo naman yun as a competent nurse who should know na kapag hindi gumaling yung patient or hindi nag-relieve yung pain after 1 dose, bigay mo yung pangalawa. Now, number 9, patient Joe will have to make lifestyle modifications. Which of the following modifications would prevent angina attacks? Guys, prevent ha. So, the best answer here is letter. There's nothing annotate. Sino naglagay ng annotate? Nag-walk out. So, ano tayo sa letter D? Letter D, I will need to walk more slowly and rest frequently to avoid the angina. This is the best answer. Why? Letter A, I know that I will need to eat less. So, I will eat 1 meal a day lang. Guys, wag mo naman gutumin yung sarili mo. May sakit ka na nga sa puso. Ginutom mo pa sarili mo. Dinagdagan mo pa yung stress, yung distress sa katawan mo. Di ba? Be kind to yourself. So, this is not the appropriate answer. Di ba? Small frequent feedings. Hindi 1 large meal. B, I will need to stay in bed all the time so I won't have the pain. Nawalan ka nga ng angina pain, nagkaroon ka naman ng pneumonia, di ba? So, hindi rin siya productive. Letter C, I'll stop what I'm doing whenever I have pain and take a pill. Guys, this is an example of treatment na siya. Hindi na siya prevention. Ang tanong sa question, prevention. So, dapat, ginagawa mo para hindi mangyari. Ang problema dito sa letter C, nangyari na. So, more on treatment na siya. So, letter T is the best kasi sabi niya, I will need to walk more slowly and rest frequently to avoid. And avoid is a synonym of prevention. So, letter D is the best answer. Number 10. In a follow-up visit, patient Joe tells Nurse J that he experiences anginal pain during sex. Which of the following should Nurse J teach Joe? So, ano sagot dito, guys? Best answer here is letter B. Well, sige lang, Ma'am Daisy, mga ka-din. Win, mga tayo. Kasi yung Ilocano ko, kahit na tiga Region 1, feeling ko mas na-adopt ko na yung Ilocano ng mga Igorot. Kasi sa Baguio ako nag-aral, diba sa SLU? Win, sige lang, adi, win, adi. So, number 10, kapag sex daw, he's worried na baka he experiences pain during sex. So, ano yung best na maituturo mo sa patient mo? It would be to have his partner, yung asawa ni Joe, dapat siya yung nasa top. Kasi 'di ba usually sino ba ang gumagalaw? Yung nasa top. Yun yung ano doon, guys, 'di ba? So, normal lang naman na mapagod during sex, 'di ba? So, letter C, sabi, rest and relax first before you engage in intercourse. Kahit gano'n ka mag-rest, kahit gano'n ka mag-relax, kapag nandun na kayo sa moment, gagalaw at gagalaw ka kung ikaw yung top. That's why, it will still result in anginal pain na all nagtatop. Ano ang top? My virgin is passive, bro. Letter D, have some cocktail or light alcohol before sex. Ay, mas lalo na to, di ba? You don't give alcohols before sex. A, or you don't give alcohol sana before sexual activity, especially sa case. A, make sure that you want to engage in sex wholeheartedly. Oh, hindi nyo kaya. Sex wholeheartedly. Of course, it's maganda to have it wholeheartedly. However, kahit willing ka naman, kung ikaw ngayon nasa mapapagod ka. Therefore, you'll experience vaginal pain. That's why the best answer is letter B. Okay? So, proceed tayo sa number 11. Jean, 54-year-old male, has been admitted with a diagnosis of left-sided congestive heart failure, which assessment finding by nurse Liz would most likely be present. Tama, abstinence po para sa lesson. Hindi niyo kaya. Sabi nila, ang lucky charm daw para mag-top ka sa board exams ay merong ay either mag-top ka or matapan ka before the board exams. Oh, hindi niyo kaya guys ha. So number 11. Guys, ito yung isang pinaka gusto ko natutunan din kay Ma'am Udan sa Teaching with the Idols, basta sa icons, is that kapag left-sided heart, always look, kapag congestive heart failure ha, tignan nyo yung system before that specific side of the heart. So kapag right-sided heart failure, ano ba yung mga system or ano yung mga organs before yung right part ng heart natin, di ba? Systemic, ating jugular vein, yung ating leg, pupunta sa ating atay, pupunta sa ating inferior vena cava, yun yung mga system before ating right side. Kapag left side naman ng puso natin, di ba? Pag left side ng puso natin, ang system before yung left side ng puso natin ay ang ating respiratory system. So basically, kapag may abnormality sa left side ng ating heart, ang maapektuhan ay ang ating respiratory system. So alin ba dito sa mga options ang nagpo-pertain sa abnormality regarding respiratory system? It's dyspnea, letter B. So the best answer in number 11 is letter B, dyspnea. Pag di nag-top sa board sa exam, tama po. Eh paano kung nag-top ka sa board tapos, uy! Ayan po. Tama yun, rise to the top. Okay, so number 11, the best answer is, sino nagsan ng Johnny Sins? Number 11, the best answer is letter B. Number 12, low sodium, low cholesterol, weight-reducing diet is prescribed for patient Jean. Nurse Liz knows which meal. Nanonood ba kayo ng Bob's Burgers, guys? Ready na po ako mag-top after to top? Akala ko ba to top the board exams? Anong to top after the board exams? Parang iba. Okay, guys, to top after the board exams. Ganun pala yun. Hayop. Okay, so number 12. Low sodium, low cholesterol, weight-reducing diet is prescribed for? Bale, sir, sa May 31 na ulit mag-active. Guys, kung ang sexual intercourse gives you peace of mind and improves your mood and has positive effects sa inyo, diba? Why not? Why restrict yourself from it? Diba? If you're happy doing it and if it positively affects you, then do it. You don't need to baguhin your rituals para lang sa board exams kasi. Diba? Dapat nga handa kayong pumasok, dapat masaya kayong pumasok. So if it makes you happy before the board exams, do it. As long as make sure na safe kayo and gusto niyo yung ginagawa niyo, okay? Yes, as long as it's consensual. Consensual, you're safe and willing kayo sa ginagawa niyo. Okay? So proceed na tayo. Low sodium, hindi na tayo natapos. Low sodium, low cholesterol, weight-reducing diet is prescribed for patient Jean. Nurse Liz knows which meal should be most appropriate for patient Jean. So alin ba dito ang may pinakamababang sodium? Kapag stir-fried Chinese vegetables, guys, usually ito gumagamit ng mga soy sauce, ng mga light soy sauce, dark soy sauce, maraming asin, di ba? So, mataas ng sodium na to. So, X na agad. Tuna fish, sabi sa letter C. Galing sa dagat ang tuna. So, automatically, mataas ng sodium content ng tuna. So, X na agad ito. Grilled lean steak, di ba? Kaya nga malasa ang lean steak kasi mataas yun ang sodium nito. Actually, parehas naman ang chicken and steak na mababang sodium, ganun. Pero, mas mababa ang cholesterol ng skinless chicken kaysa sa grilled lean steak. So, the best answer in number 12 is letter A. Okay? Letter A po. Now, proceed tayo sa number 13. Digoxin and furosemide are ordered for patient Jean. Which of the following would nurse Liz also expect to be ordered? Guys, ang mga diuretics na ito, alam natin ay yung furosemide ay loop diuretic, 'di ba? Tapos yung digoxin kailangan para sa puso. So kung nagbigay ka ng loop diuretics, tapos alam mo na may problema pa sa puso yung tao, 'di ba? Sa kanyang contractility, of course, you will give ano ba yung nai-excrete ng mga non-potassium diuretics? Potassium, potassium, 'di ba? Pagdating sa mga diuretics, yun lang naman yung main focus minsan kapag ano, kapag mga supplementation, ang focus lang dun ay potassium minsan, 'di ba? Tama, potassium. Kasi kapag masyado namang kulang ang potassium, Diyos ko, kulang naman ang electric conduction naman sa puso, baka hindi na nagkaroon na ng mga arrhythmias, 'di ba? So it's very important to supply potassium kapag meron kang mga non-potassium sparing diuretics. That's why the answer in number 13 is letter A. Para kahit nag-take siya ng furosemide, normal pa rin yung pagtibok ng kanyang puso. Okay? Number 14 na tayo, guys. 14, patient Jean complains of muscle aching, so his physician orders a potassium level which shows hypokalemia. In addition to treatment with a potassium supplement, the nurse administers which of the following prescribed drug. So, di ba? Nagbigay na tayo ng potassium, di ba? So, ano na i-expect natin na ipapalit na medications? Of course, it's a potassium sparing diuretic na, is spironolactone. A, B, kung ako, hindi ko alam yun, di ba? Ako, honestly, hindi ko alam yung bumetanide, tercimide. Pero kung titignan nyo, guys, yung Bumex, Demodex, feel ko mga ano to, mga diuretics na hindi nag-spare ng potassium. More on mga loop diuretics din siguro itong mga to. So, feeling ko, hindi ito yung tamang sagot. So, letter D. Clonidine, sabi, clonidine, parang hypertension ito. Anong connect niya sa may hypokalemia, di ba? Bakit naman may hypokalemia patient? Siyempre, doon ka na sa may gamot na prevents hypokalemia. And that's letter C. Spironolactone. Number 15, in making a nursing care plan, Nurse Liz knows that the priority nursing diagnosis for congestive heart failure would be, ano ang priority sa CHF? It would be fluid volume excess. Diba? Kasi, kapag meron tayong congestive heart failure, ano nangyayari guys? Hindi na papump ng maayos yung dugo towards systematically. So, naiipon siya sa dugo guys. No? So, nagkakaroon ng fluid volume excess. Okay, so ang answer sa number 15 ay letter A. At saka isa pa, since masyadong marami rin yung tubig sa katawan, masyadong nai-strain yung katawan natin. Si Ma'am Ivy naman kumakain na, sana all. Sana all po, Ma'am Ivy. Guys, kung gutom na kayo, kuha na rin kayo ng pagkain nyo, tapos saluhan nyo na si Ma'am Ivy. Baka magbigay rin siya ng ulam. Okay, so number 16 tayo guys ha. Number 16, Nurse Liz is preparing patient Louise for cardiac catheterization. Which action should she expect to take? Kapag cardiac catheterization guys, or any procedure naman for that instance, diba, we always take the baseline VS muna. That's why you locate and mark peripheral pulses, especially since ang cardiac catheterization is in line or in relation sa ating puso, diba? So you take the vital signs closest to that. You take the vital signs muna to ensure na while having a procedure or after the procedure, you ensure na safe si patient. Ano ba ang common complications kapag mayroong cardiac catheterization? Guys, ang cardiac catheterization nasa puso. So kung may bleeding yan, may injury yan, possible na magkaroon ng hemorrhage. Magkaroon pa ng shock, di ba? So you check for its baseline, for the patient's baseline vital signs, specifically, number 1, locate and mark peripheral pulses. Mali ang letter D kasi NPO dapat siya before the test. So hindi mo siya dapat painumin. Ang cleansing enema, hindi naman gut ang involved na system dito. Is the cardiovascular system naman. So hindi siya related. Letter A, hindi siya radioisotope kasi ang cardiac catheterization, gumagamit to ng iodine dye sa cardiac catheterization. Number 17, during the admission interview, patient Louise disclosed that every time she eats shrimp, she gets a rash. What should nurse Liz do? So, ano bang gagawin, di ba? Di ba kagaya na sabi ko kanina, ang ina-administer sa cardiac catheterization ay iodine dye. So, kung meron siyang allergy sa shellfish, di ba? Automatic na yun. Nasabihin mo sa doktor para alam niya kung ano yung medications na ibibigay para ma-suppress yung allergic reaction. Diba? That's why you notify the physician agad. Kasi baka mamaya tinuloy na nila yung procedure tapos nagkaroon ng allergic reaction, delikado na si patient doon, baka mamatay pa siya. Okay? So number 18. Additionally, patient Louise asks Nurse Liz if she will be asleep during the cardiac catheterization. What is the best initial response for the nurse to make? Kapag cardiac catheterization, guys, hindi siya tulog. Nakaano na siya, sedate lang siya. So, gising siya, pero hindi niya mararamdaman yung pain. At saka minsan kasi kailangan din kausapin yung physician yung patient while doing the procedure to ensure na she's doing fine. To assure na na walang nangyayaring complication sa patient. That's why B is the best answer. Okay? Proceed tayo sa number 19. Number 19, cardiac catheterization can accomplish all of the following except. The answer here, guys, according kay Saunders, is letter D, obtaining a biopsy specimen. Kasi usually ang cardiac catheterization, naglalagay sila ng camera, ganun, or dye, for visualization talaga ng heart chambers natin. Assess ng heart structures, tapos evaluate din yung cardiac output ng ating puso. Pero lately, sa mga nabasa ko rin latest, pwede na mag-obtain ng biopsy specimen using cardiac catheterization. Pero if ever man na ganito yung lumabas sa exam, tapos similar yung parang options, ang piliin yung sagot ay letter D pa rin, obtaining a biopsy specimen. Okay? So number 20. Once patient Louise returns from having cardiac catheterization, it is most essential for Nurse Liz to, of course, sinimulan mo lang, in-assess ang kanyang pulses, tapusin mo na, i-assess din yung kanyang pulses. So it's letter A. You also check peripheral pulses kasi kagaya ng sabi ko kanina, hemorrhage could happen. So shock could happen. So tignan mo, baka mamaya, nag-bleeding na yung pasyente mo, yung sugat pa man, yung paman din ay papunta sa puso, di ba? It's very delicado. So you check peripheral pulses. Maintain NPO. After ng procedure, hindi mo na kailangan i-maintain yung NPO. Apply heat. Hindi ka mag-apply ng heat sa insertion site kasi nga, di ba, ang heat ay vasodilator. So kapag nag-vasodilate ka pa, mas aggravate mo yung bleeding tendency. So it's an X. Letter D, start range of motion exercise immediately. Guys, again, it might cause bleeding. So the best answer is letter A. Number 21. Guys, nahihirapan pa ba kayo sa may acid-base imbalances? Yung totoo ha. Kasi sa amin noon kapag review, ang daming nahihirapan sa acid-base imbalances. So, thereabouts, ayan. Thank you. So, okay na pala. Okay, thank you po. Okay, very good po. Thank you everyone. So, proceed tayo. Number 21. A client with pneumonia presents with the following arterial blood gases. pH of 7.27, partial carbon dioxide of 70, bicarbonate of 29 MEq per liter, and partial oxygen of 50 mmHg. Which of the following is the most appropriate nursing intervention? So guys, ang answer dito ay, nalikod ko. Yeah. Guys, ang best answer dito ito ba? Yeah. Sa 21, ang best answer dito guys ay letter C. Mali yung letter A kasi, ang problema kasi ng client, di ba, ay respiratory acidosis. So, masyado ng maraming carbon dioxide sa kanyang katawan. The thing is, kapag binigyan mo pa siya ng sedative, edi mas lalong hindi siya makakahinga. So, kung ganun, di ba, ang respiratory drive natin ay high oxygen levels. Pero kung binigyan mo siya ng sedative, hindi siya makakahinga ng maayos. So, imbis na mag-inhale siya ng oxygen para ma-neutralize yung carbon dioxide niya sa katawan, excess carbon dioxide sa katawan, hindi niya magagawa kasi nga depressed yung kanyang respiratory system. So mas mag-accumulate yung carbon dioxide sa kanyang katawan. Okay? So letter B, place client in lateral position. Again, this is not a question of positioning. Kaya position mo na ng lateral position, hindi siya beneficial. I'll tell you why later kapag diniscuss natin letter C. Letter D is mali kasi when you breathe into a paper bag, yung nilalabas mong CO2, in-exhale mo rin pabalik. So, hindi nawawala yung excess carbon dioxide sa katawan. So, the best answer here ay, tama po. The best answer here po is letter C. High Fowlers para maximum lung expansion. Para maka-ventilate siya ng maayos. Malabas niya yung carbon dioxide at makuha niya yung oxygen na kailangan to neutralize the acidity. Yes, online. Okay, proceed tayo sa number 22. If a client with COPD on 2 liters of oxygen has an ABG reading of 7.37 blood pH, CO2 of 60, bicarbonate of 34, oxygen at 88% on 2 liters, and feels short of breath after walking to the bathroom, which would be the nurse's primary intervention? Guys, ang answer dito ay letter D. Encourage the client to rest and to use pursed lip breathing technique. Guys, mali ang letter A kasi these values are normal naman kapag meron kang COPD. Di ba? Pag meron kang COPD. So, you don't necessarily need to call the physician and report kasi nga, this is within the normal expectation pa sa ating patient. B, turn the client's O2 up to 4 liters nasal cannula. Guys, iba nga, as much as possible, mababa lang yung supplementation natin ng oxygen. Kasi nga, kapag masyadong mataas, baka naman sumabog yung kanyang alveoli. Di ba? Yes, it's hypoxic drive. Yung kanya okay, kapag tinaasan natin agad yung oxygen, baka nga sumabog yung kanilang mga alveoli. Diba? COPD. Ang mahirap din dito, guys, kailangan ng doctor's order para i-test ang ating oxygen. So, hindi mo pwedeng itaas agad. Okay? Encourage the client to sit down and to take deep breaths. Hindi to helpful. Kasi nga, ang problema niya, tignan nyo guys, ang problema niya, nagkakaroon siya ng acidosis. Deep breaths, tapos meron siyang COPD. Again, hindi helpful to kasi may difficulty sa air trapping din. So, ang best answer dito, I encourage the client to rest and to use pursed lip breathing lang. Kasi napagod naman siya. Ang main reason kung bakit ganyan is because of the pagod. Yung values, they are normal. Ang main focus mo rito, yung feel short of breath after walking to the bathroom. So, you let him rest, okay? And encourage pursed lip breathing, letter D. Diaphragmatic breathing. Okay, letter 23. Number 23. If an anxious client complaining of lightheadedness and tingling in the fingers has an ABG okay, ito po. Tingnan natin guys, sa number 22. Tingnan natin kung respiratory acidosis daw. Ang number 22. Tingnan nyo guys, 7.37, within normal range naman siya, di ba? Carbon dioxide of 60, masyado mataas. So acidotic. HCO3 of 34 ay masyado rin mataas, meaning alkalinic. It could be na one is trying to neutralize the other. Pero tignan nyo yung blood pH niya. It's 7.37. Guys, ang 7.37 is within normal. However, it is very close to the minimum normal value of blood pH. Diba ang value ng blood pH natin ay 7.35 to 7.45. Remember na ang mean nito, ang gitna ng 7.35 and 7.45 ay 7.40. So kapag ang blood pH natin ay before ay lower than 7.40, it could be na it is closer to acidosis. Diba? It is closer to acidosis. Nag-gets ba yung concept na yun, guys? Normal siya kasi 7.35 to 7.45. Pero yung fact na it's 7.37, it's close to being acidotic. Diba? Konting baba pa, acidosis na siya. So, kung yung ating blood pressure ay malapit na mag-acidosis, alin ba sa sa partial carbon dioxide at bicarbonate ang acidotic in nature? Diba? It's the carbon dioxide. So since carbon dioxide ang acidotic in nature and mataas ang ating carbon dioxide levels, the most probable acid-base imbalance that patient number 22 is experiencing is respiratory acidosis. Okay? So tama po, Ma'am Angel Chua. Okay, so proceed tayo sa number. Nagets po ba yun? Could be na compensated na to. Compensated respiratory acidosis. Compensated kasi tumaas rin yung bicarbonate to balance out the acidity of carbon dioxide, which resulted in a blood pH that is within the normal levels of 7.35 to 7.45. Okay? So proceed tayo sa number 23. Yan. Anxious daw yung client, tapos nag-experience siya ng respiratory alkalosis. So ano ba yung main cause ng kanyang respiratory alkalosis? Diba? It is his or it is the client's anxiety. So you manage the causative, the predisposing factor of the client's present situation. So since anxious siya, ano bang ginagawa natin sa mga client na anxious, di ba? We provide reassurance. Yung administering sedative is an additional intervention to slow the breathing and retain more CO2 sa katawan para ma-prevent natin yung respiratory alkalosis. Letter A is wrong kasi hindi naman related ang intake and output sa ating respiratory alkalosis. Letter B, encourage client to increase activity. Diyos ko, pagod na nga yung client, di ba? Hindi na nga siya, hindi nga maayos yung kanyang pakiramdam, nahihilo na nga. Excuse me po. Tingling pa yung fingers. Pagpahingahin mo naman, dad. So B is wrong. C, institute deep breathing. Guys, kapag nag-deep breathing ka, tapos, excuse me, alkalotic yung patient, respiratory alkalosis, mas mag-worsen yung at yung kanyang situation. Diba? Not all my assurance. Sana nga. So the best answer is letter D. Provide reassurance to the client and administer sedatives to slow down breathing and retain more oxygen para man-neutralize niya yung alkalinic environment. Number 24. Yan, 23, screenshot niyo na po. 1, 2, 3, and 24. Which acid-base disorder would be manifested by a client with a small bowel obstruction who has a nasogastric tube connected to low intermittent suction for 3 days? Guys, isipin nyo, may suction daw sa NGT niya. So, saan ba nakakonect yung nasogastric tube? Diba? Nakakonect sa may gastric area. So, kapag may suction doon, syempre, nasa suction na niya yung gastric acid natin. So, imbis na maging acidic na yung ating environment sa gastric area, nagiging letter C, metabolic alkalosis. Kasi nasa suction yung acids, stomach acids. Okay? So, that's basically the rationale sa ating number 24. So, proceed tayo sa number 25. If a client who has renal failure skips dialysis treatments for 3 consecutive times, what acid-base disorder would be manifested? Dito naman, guys, sorry, kailangan kayo magtingin. Hindi daw na ilalabas yung waste products ng katawan. Pero ang usapan dito, dialysis, so involve ang renal treatment. Ang renal system natin. Di ba? Kung renal system ang involved, usually it is all about metabolic. Kasi kapag respiratory, andun eh, respiratory system. So kapag metabolic, usually kapag mga ano na siya, renal system na, ang involved dito sa metabolic acid-base imbalance. Now, paano siya naging acidosis? Again, di ba? Kapag nagda-dialysis yung patient, ibig sabihin, marami siyang waste products. And in nature, ang mga waste products na ito ay acidic. So, kapag nag-accumulate sila sa katawan, kapag hindi sila naalis sa katawan through dialysis, may ipon sila which will cause metabolic acidosis. That's why letter C is our answer in number 25. Narinig ba yung strepsils, guys? Distracting. Alisin ko muna. Number 26 na tayo. Which set of ABGs would indicate that the client is in a state of acid-base imbalance in the previous item? Ay, hindi naman dinig. Okay, thank you. Balik ko na. Thank you. Balik ko na. Thank you po. So, number 26. Oh, so sabi natin, yung client ay metabolic acidosis. Alin ngayon sa mga ito ang nag-pertain sa metabolic acidosis? So, it's letter C. Bakit? Guys, again, ang HCO3 ay alkalinic in nature. Diba? So, kapag tumaas yung HCO3 natin, magiging alkalinic din yung ating acid-base imbalance. Pero kapag bumaba siya, ibig sabihin magiging acidic. At tignan nyo yung PCO2. Normal naman siya, diba? 35 to 45. So, ano ang nagkukos ng acidity ng blood pH niya? It's metabolic. It's the bicarbonate, the decreased amount of bicarbonate. That's why C is the best answer. Nagets niyo ba yun, guys? Number 26. A is wrong kasi normal naman ito. This is very normal. B is wrong din kasi ang ano na to, guys, ay PCO2 niya 35 to 45. This is acidic in nature. HCO3, 2026. Normal naman pala itong itong letter B natin. Ba't ako nahilo? Normal naman pala itong letter B natin. So, hindi rin siya, guys. Letter D, yes, it is acidic. However, ang cause ng acidity dito ay respiratory kasi mataas ang kanyang CO2, which is acidic in nature. Tapos, nagko-compensate yung kanyang bicarb by increasing then, which is alkalinic in nature to neutralize the respiratory acidosis. Okay? Proceed tayo sa number 27. Number 27, a client diagnosed with atelectasis is experiencing respiratory acidosis. Guys, sa tingin nyo, ano yung mechanism bakit may respiratory acidosis sa atelectasis? Atelectasis kasi di ba, nag-collapse yung kanyang alveoli, yung kanyang lungs. Ibig sabihin, hindi sila maka-expand, hindi nila mailabas yung carbon dioxide. At saka may injury pa eh. So, yung mga waste products sa ating respiratory system all contributes to having an acidotic environment. That's why meron siyang respiratory acidosis. So number 27, the best answer is letter A, 7.25 kasi mas mababa siya compared sa minimal normal amount na 7.35, meaning acidic siya. And then mataas din yung kanyang PCO2, diba? Ibig sabihin, masyadong mataas yung carbon dioxide, so it is respiratory in nature. That's why this is the values for respiratory acidosis. B is normal. Letter C, 7.50, this is alkalinic. Tapos tingnan nyo, mataas yung PaCO2 niya. Ibig sabihin, ang nagkakos ng alkalinity neto sa letter C ay metabolic. Kaya, tumataas yung PaCO2 para mag-suffice or para ma-neutralize yung alkalinic environment caused by metabolic in nature. Letter D, alkalinic din to, pero alkalinic ito, pero respiratory in nature naman. Letter D pertains to respiratory alkaloids. Okay? So number 28 tayo. 28. An unresponsive client has arterial blood gases drawn with the results of pH. With the results of pH is 7.20, acidotic in nature. Acidotic na siya, diba? Yes, acidotic na siya. PA is 70 mm, so masyadong mataas. PaCO2 is 70 mm, masyadong mataas. So it could be na ito ay respiratory acidosis na agad. HCO3 is within the normal value. However, normal value. So, asan dito yung options na may respiratory acidosis? Is letter B and letter D. Pero, may additional wordings ng with compensation and without compensation. Di ba kapag with compensation, tataas yung opposite niya na chemical para ma-neutralize yung isa. So for example, sa case na ito, respiratory acidosis, masyadong mataas yung carbon dioxide. Kung may compensation yan, tataas din itong bicarb natin, di ba? Dapat ito mas mataas pa sa 26 para ma-normalize yung pH. So, pero since hindi naman siya tumaas, within pa rin siya sa range na 22 to 26, this will be considered as respiratory acidosis without compensation. Diba? Okay, so proceed tayo sa number 29. The nurse reviews the arterial blood gas results of a client and notes the following. pH of 7.44, partial carbon dioxide of 29, 7.44 normal to ha. Carbon dioxide of 29, masyadong mababa. So, ibig sabihin, alkalinic ang kanyang respiration. And then HCO3 of 19 MEQ per liter, indicating which acid-base imbalance. So, titignan natin guys, yung dugo nung patient ay 7.44. Ang kagaya ng sinabi ko kanina, if it is on the right side of the continuum, kapag nasa right side siya na 7.40 or mas mataas siya sa 7.40, this is close to being alkalinic. So meaning, ang blood pH ng pasyente natin sa number 29 is alkalinic. That's why it's either letter B lang or letter C. Okay? Nag-guess ba yun? Now, is it metabolic or respiratory? Again, PaCO2 is acidic in nature. So, kung mataas ito, magiging acidic yung blood pH. Pero hindi, alkalinic yung blood pH. And interestingly enough, mababa yung ating carbon dioxide. So, ibig sabihin, kung mababa yung values or amount ng carbon dioxide, alkalinic siya. alkalinic siya, respiratory. Di ba? Kasi nga, bumaba yung partial carbon dioxide mo. So, yung causing ng alkalosis niya ay respiratory in nature. Then, bumaba yung HCO3 kasi ito yung attempt ng katawan. Di ba ang HCO3, alkalinic in nature. So, kapag tumaas ito, edi mas lalong mag-progress yung kanyang alkalosis. However, since bumaba, ibig sabihin, the bicarbonate is trying to compensate for the rise of carbon dioxide. So, tinatry niyang i-neutralize yung alkalinity ng carbon dioxide. That's why the best answer here is letter B. Respiratory alkalosis, compensated kasi nasa within normal values yung blood pH. Pero kahit na mag-adjust yung HCO3, kung hindi naman nasa normal values yung ating blood pH, hindi siya considered as compensated. So, proceed tayo sa number 32. Konti na lang, yes guys, last 20 items. Diba? Abot tayo guys. Number 30, which acid-base imbalance will be manifested by a client with several broken ribs? Similar lang to sa atelectasis guys. Kung injured yung kanyang respiratory system, of course magkakaroon siya ng respiratory acidosis from inadequate ventilation. So number 30 is letter A. Number 31. If a post-operative client develop a compromised airway, which intervention is the priority action? Pag airway guys, of course, kung airway, letter B, open the airway. Kasi yun na may action na nagpo-pertain or na nagbibigay ng solution para sa problem natin, di ba? Bakit ka magbibigay ng, ay bakit mo siya i-reposition sa may supine position, di ba? Ay hindi naman positioning yung problema natin. Prepare for intubation of the client. Of course, you will do that. C and D, you will do those. Kasi meron siyang compromised airway. Pero unahin mo muna yung kaya mo nang gawin ngayon. Di ba? So you open the airway muna para habang tinatawag mo sila, habang prepare mo yung intubation ng client, ay tinutulungan mo yung client to have a more access for oxygen. Sorry, tinutulungan mo yung airway ng client to more access for oxygen. Okay? So that's number 31. Number 32, which action by the perioperative nurse will reduce the clinical manifestation of laryngospasm? This is, the answer here, number 32 is letter B. Kasi ang ating succinylcholine ay isang competitive acetylcholine antagonist, guys. Ibig sabihin, siya yung pumupunta sa mga receptor sites ng acetylcholine. However, hindi niya pinoproduce yung same result ng acetylcholine. So, imbis na mag-depolarize yung ating yung ating muscles sa larynx, yung ating nerves sa bandang larynx, and mag-stiffen, mag-spasm, hindi nangyayari. Nagre-relax siya. That's why D is the correct answer. Okay. Number 33. Which sign or symptom would indicate that the client is experiencing hypovolemia? Tama po. Tama po, ma'am. Angela. Number 33, which sign or symptom would indicate that the client is experiencing hypovolemia in the immediate post-operative period? Guys, yun na yung clue nyo, post-operative period. Diba kapag post-operative period, of course may blood loss. That's why ang best answer dito ay yung pinakamalapit sa post-operative, sa peri-operative procedure, sa operative procedure, which is yung blood loss of 500 ml. Okay. Number 34. Which intervention will be performed to aid a post-operative patient who develops sinus tachycardia? Okay, so remember guys, ang sinus tachycardia post-operatively ay due sa anxiety na nafe-feel ng patient. So again, sabi ko kanina, in order for you to efficiently and effectively resolve the complaint of the patient, you must focus on the causative factor, which is in this case, anxiety. So the best answer is letter D, manage the client's anxiety. Okay? A is for hypothermia, B is for bradycardia, and then letter C is for, wala namang positioning dito guys. So kahit na i-position mo siya, ganyan. Hindi naman maapektuhan yung sinus tachycardia na nararamdaman. So D is the best answer. Number 35, if a post-operative patient becomes hypothermic, which nursing action would be the best to be performed? Oh, again, This is similar sa question natin kanina NP2, diba? Kapag EINC, pupunasan mo yung bata kasi nga, any fluid sa balat ng bata, nanakaw niya yung heat ng katawan. Then, by the principle of evaporation, parang evaporate yung fluid, mag-evaporate din yung heat. So, nawawala ng heat yung katawan ng tao, which results in hypothermia. That's why, sa post-operatively, ensure na, i-remove natin yung mga clothing na saturated with blood. Okay? So, alisin natin lahat ng mga sources na saturated with blood. So, letter C is the correct answer. Kasi, by the process of evaporation, yung heat sa katawan, mag-evaporate with the water. Number 36. John, who was admitted with acute asthma, is treated for inspiratory and expiratory wheezes and a decreased forced expiratory volume. Which class of prescribed drugs should nurse are expect to administer first to this client? Okay? So, keyword natin guys first. Di ba? Kapag nagbibigay tayo ng gamot sa asthmatic clients, as long as excuse me po, hanggat hindi pa siya emergency cases, we give bronchodilators, di ba? Pero kung yung asthma ng client ay yung nakalimutan ko yung term na yun yung asthma na yung very severe, which can result in death. I forgot it, pero try natin search. Search ko nga. Anong asthma na yun? Nakalimutan ko na. I'll refer to you guys. So, as much as possible, hanggat hindi pa emergency situations, ang ibibigay mo pa lang ay bronchodilators. Steroids, A and C, binibigay mo nga sila kapag severe situations na. Hindi sila yung first line of drugs. Ang first line natin ay bronchodilators. This is wrong kasi hindi naman mucus ang problema sa asthma. It's a constriction of the airways. Diba? Yun yung main problem natin. So, ang main solution doon ay bronchodilators. Number 37. Yun, status asthmaticus. Thank you, guys. Thank you po. Salamat po. Okay, magtatap ang lahat ng sumagot. Joke lang. Thank you everyone for your participation. Yes po, status asthmaticus. Bibigyan na ng mga ganong situation, you will give steroids. Number 37. John was curious about why inhalation. Si Ma'am Maya, naghanap ng lalaki. Anong men, sir? Sorry. Sir, Gcash tumatangkap. Yes po, 09 to... Pag ako nagsan ng Gcash at wala akong na-receive na 500,000. Stop it. So, number 37. John was curious about why inhalation is the preferred route of administration for corticosteroids. Nurse Art is correct if he answers. Guys, ang binibigay ay ang corticosteroids ay usually ini-inhale kasi nababawasan yung adverse reaction systemically. Bakit? Kasi through inhalation, diretso na siya agad sa may lahat na sumagot. Yung through inhalation, diretso na siya agad sa may affected na system ng katawan natin, which is yung respiratory system. Unlike kasi kapag, for example, problema sa liver, ganun, syempre, hindi mo naman, mahirap naman idiretso sa liver yung gamot, di ba? Sa atin kasi, yung respiration natin, diretso agad sa ating lungs, sa may infected na parts. So kapag through inhalation, yung gamot natin, yung corticosteroids natin, kakabit sila agad sa mga receptor sites nila sa may lungs natin agad. That's why, nakukuha natin agad yung effect ng mabilisan without having to undergo the systemic adverse effects. So that's why the answer is 37 is letter B. 38, if Nurse Art were to instruct a client to use a meter dose inhaler, which instruction would be essential to include? This is letter A. Letter C. Activate a canister at the beginning of a slow deep breath. Bakit mali yung letter A? Guys, kapag may inhaler kayo, usually, dapat in-hold nyo yung hininga nyo for 5 to 10 seconds of breathing. Para mas mag-stay talaga dun yung gamot. Di ba? And para mas may time siya, para mag-travel dun, papunta sa ating respiratory system. Kasi kapag huminga kayo agad, Diyos ko, nalabas nyo na siya agad. Edi wala rin. Letter B, take a quick deep breath. Imagine nyo guys, pag ganyan, no? Ano nahigop nyo ron? Parang usok lang ata yung nahigop nyo rin, guys. O, di ba? Nakahigop na kayo ng dumi. Nakahigop na kayo ng utot. Hindi mas lalo pa kayo nahirapang huminga. So B is wrong. Letter D, place the canister 6 inches in front of an open mouth. Guys, 6 inches, di ba? Na-visualize, gano'ng kahaba ang 6 inches. Di ba, 6 inches? Masyadong mahaba. Paano po magta-travel yung ano doon, yung gamot doon, di ba? So kapag 6, kapag 6 inches na, in front of an open mouth, Diyos ko guys, yung gamot nyo, nahalo na sa polusyon. Di ba? Nahalo na sa usok. So the best answer is letter C. Activate, spit or swallow, depende raw po kung mahal mo. Spit or swallow po, depende kung mahal mo. Okay. So the best answer in 38 is letter C, okay? Number guys, yan guys, pumunta kayo ng Manawag. Hindi yung lapis ang ibababad nyo sa may holy water ha, yung ulo nyo or yung buong katawan nyo ha. Okay, magdala kayo ng tabo at ng towel. Maligo kayo sa holy water sa Manawag. Okay? Proceed tayo sa number 39. 39, patient John awakens in the middle of the night. In the middle of the night, my dreams. You should see the things we do, baby. With an asthma attack. So, which inhaler medication should nurse administer first? Again, sabi rito guys first, ano ba yung na-administer natin primarily? Diba? Loko, award, sabi ko sa inyo. Anong sinabi ni Miss? Ma'am, paano po mag-kick dito? Kick ko lang po si Ma'am Adet. Okay po. So, diba, kapag meron ngang asthma attack, ano ba ang ina-administer natin first? It's ibon adarna. Ibong adarna nyo pero paos. Hindi ibong adarna. Ibong adarna yan. Tandang po. Tandang po, tandang. Okay, so proceed tayo. Diba kapag mayroong asthma attack, ang binibigay natin, albuterol, okay? So, bronchodilators muna. B and C, these are steroids. Letter D, ito wala itong immediate effect di ba? Prophylactic mast cell inhibitor ito. So, the best answer is letter A. Number 40 na tayo, guys. Number 39 ha, best answer is letter A. Miss Tricia, tiga purple crib ka ba? Kasi parang kamukha niya yung dorm ko noon. Pero parang hindi. Baka hindi. Miss Tricia Nicole Torino, purple crib po ba yan? Or hindi po? Purple crib ba yan? Or iba? Ibang apartment? Kasi yung apartment namin noon, color violet din, tapos purple crib yung tawag. So akala ko, tiga purple crib si Ma'am Tricia. Sorry po Ma'am Tricia, naabala kita sa pagkain mo ay. Eat well po. Ay, hindi po. Okay. Thank you Ma'am Tricia. Sorry. So proceed tayo sa number 40. Number 40. When admitting a client with asthma who is to be started on theophylline, which question is the most appropriate for nurse Art to ask initially? So the answer here, guys, is letter B. Guys, kung board exams to tapos ito yung tanong, honestly, hindi ko alam yung sagot dito. Pero ang answer dito ay letter B. Bakit? Kasi di ba, kasi ang cimetidine, this decreases theophylline clearance. So anong ibig sabihin nito? So kung na-decrease yung theophylline clearance, ibig sabihin, mas naiipon yung theophylline sa dugo natin. Exactly, nagkakaroon po siya ng toxicity. And the danger kapag nagkakaroon kasi tayo ng toxicity ng theophylline sa katawan, ay it could be possible na mas lalong ma-depress yung ating respiration and worse, could also result in death. Diba? So, that's very dangerous. That's why itanong mo kung meron siyang cimetidine para it could be na pababaan yung dosage ng cimetidine para while taking theophylline, maayos pa rin na nadi-discharge ng katawan yung theophylline and hindi nagkakaroon toxicity. Okay? Number 41. Patient Paula, who was diagnosed with myocardial infarction, is developing cardiogenic shock. Because of the risk of myocardial ischemia, what condition should nurse Alexa carefully assess the client for? Guys, kapag may myocardial ischemia, di ba nagkakaroon ng damage sa puso natin? So, ibig sabihin, nagkakaroon ng ventricular dysrhythmias. Mali ang letter A kasi dapat it should be tachycardia. Di ba? At saka imagine nyo, cardiogenic shock siya. So in shock siya, ibig sabihin compensatory mechanism ng katawan na maging tachycardia. That's why mali yung bradycardia. Kasi ang bradycardia ay for neurogenic. Letter C, rising diastolic blood pressure. Guys, cardiogenic shock. So dapat low blood pressure, di ba? Kasi it's a shock. It's a shock. So it should be letter C. Letter D, mali siya guys kasi dapat tumataas. Tumataas yung central venous pressure. Bakit? Kasi nga di ba, hindi niya napapump ng maayos. So nagkakaroon ng backflow ng fluid. That's why mali yung letter D. So the best answer is letter B, ventricular dysrhythmias. Okay? So proceed tayo sa number 42. Konti na lang guys, amen. Due to her condition, patient Paula wears a, continuous cardiac monitor, which begins to sound its alarm. Nurse Alexa sees no ECG complexes on the screen. Sabi sa inyo sino na yung nag-ano kanina guys na maubusan ng oras? Kalkulado to guys. Siyempre ayaw ko naman na tumagal ng 8. So magkwentuhan muna tayo ng mga 24 minutes. Okay? Mag-break tayo ng 24 minutes, no? Bago tayo magtuloy guys. Okay? So have your dinner muna. Ayaw ko nahihirapan kayo guys. Siyempre hindi tayo lalagpas ng alas 8. So break muna tayo. Ayaw? Ay, edi don't. Okay, sige. Proceed na tayo sa number? Proceed tayo sa number 42. Due to her condition, patient Paula wears a continuous cardiac monitor, which begins to sound its alarm. Nurse Alexa sees no electrocardiographic complexes on the screen, which is the priority nursing action. Here, the priority nursing action, di ba? Kahit naman, for example, tapusin na natin to. So, ganin mo na lang. Okay, tapusin na natin to. 7 p.m. break. Hindi. Sorry. So, for example, di ba? Kahit naman sa mga ventilator natin, kapag tumunog yung ating ventilator alarms, titingnan muna natin, i-check muna natin kung nakalagay ba ng maayos yung lead placement at i-assess natin agad yung client kung nagkakaroon ba talaga siya ng difficulty. Kung yung bang error sa machine ay nagmamanifest physiological, di ba? Kasi baka mamaya, kaya pala tumutunog, naalis pala, ganun. Kaya pala walang reading, is naalis pala. Imagine mo, nakikipagdaldalan naman yung patient, pero walang ECG reading, di ba? Paano yun? Di ba? Kung buhay naman siya, bakit walang ECG reading? So, i-check mo kung nakakabit ba. Di ba? That's why C is the best answer. Huwag kang tatawag muna ng code or healthcare provider kasi ensure mo muna na nakakonect pala talaga and gumagana. Because the recorder button, wala kang wala kang ma-record. So why would you press it? Number 43. Dealing with multiple patients. Oh my God. Excuse me po. 43. Dealing with multiple patients, Nurse Alexa was tasked to assist defibrillating patient Paulo, who is in ventricular fibrillation. After placing the pad on the client's chest and before discharge, which intervention is a priority? Walang nakaalala. Paano nakaalala kung nasa tabi ko naman? Uy. So, number 43, the best answer here is letter D. Confirm that the rhythm is actually ventricular fibrillation. Guys, tignan nyo, magde-defibrillate na daw magde-defibrillate na raw si patient ay si Nurse Alexa kay patient Paulo. Pero, paano kung hindi pala ventricular fibrillation yung rhythm ng puso niya, di ba? Paano kung ang tinitibok pala ng puso niya ay ikaw? So, i-make sure mo muna na ventricular fibrillation talaga yun bago ka magbigay ng kuryente. Di ba? So, for example, that nire-assess mo. Yung rhythm naman pala ay sabihin na nating vita, di ba? Hindi ka naman mag-aano ng ventricular ng defibrillation sa beta, di ba? So what's the point? I-injure mo lang yung client. So you must always make sure before you introduce the shock na ventricular fibrillation nga talaga before you defibrilize. A is wrong kasi hindi naman kailangang i-intubate yung patient. B, set the defibrillator to the synchronized mode. Again, ito ay, yung synchronized mode ay for cardioversion, di ba? For example, unstable tachyarrhythmia lang, ganun, tachyarrhythmia, ganun lang, yung cardioversion. And doon mo i-on yung synchronized mode. Walang ganun sa defibrillation. Letter C, administer amiodarone. Ito yung na-administer usually after. Bago ka doon make sure. Upo. Mali ba? Ngayon mo lang ba narinig, Reginald? Parang baliktad ba? Baliktad ba? Okay, so best answer 43 is letter D. Ensure mo muna na tama yung spark sa inyong dalawa. Ah, mali pa. Ensure mo muna na tama yung tinitibok yung puso. Tama yung tinitibok ng puso bago mo bigyan ng spark. Okay? Hindi yung binibigyan mo ng spark lahat ng ginagawa niya, lahat ng meaning. 2023 na guys. Okay, number 44. Parang hindi talaga nag-grade. Okay, okay. At least, di ba, we learn something new every day. Okay, magkwentuhan na tayo mga 30 minutes talaga, guys. Marami na tayong oras. Kaya pa to. Number 44. Patient Paulo is now to be defibrillated, di ba? To convert this rhythm effectively, the monophasic defibrillator machine should be set at which energy level for the first delivery? Guys, take note. The machine that will be used is monophasic defibrillator. So, ang 120 joules to 200 joules ay ginagamit for biphasic kasi nga dalawa, di ba? However, since monophasic lang siya, you should use 360 joules na. So, the best answer here is letter D. Hindi letter A kasi kung ganyan, 50 joules. Dama mo pa ba? Diba? Parang dama mo pa ba siya? Parang hindi na. Kung ganyan ka, ano lang din naman yung ano. Or kung meron man, hindi siya enough to provide the defibrillatory effect na kailangan ng pasyente to stabilize the heart rate. So the best answer is letter D. Sige, tingnan natin. Mag-answer kayo ng board exams, guys. Ewan ko na lang kung may ano. Ma'am Adet, Carlos, usually ito po, Ma'am Adet, usually ito naman po yung mga guidelines na binibigay nila sa ating mga books, pati po sa AHA natin, kung gaano kalaki yung, or kung gaano kalaki yung joules na binibigay, energy na binibigay para sa ating defibrillator. Kung biphasic po, start ka ng 120, proceed 120 hanggang sa 200. Kung monophasic naman po ma'am, it's 360 joules. Okay? Number 45. Nurse Alexa knows that the defibrillation of patient Paulo was successful if, when we're talking about successful, sabi, di ba? So, hanapin mo na yung mga pinaka-positive na signs dito. Signs and symptoms. O, isa-isahin natin, ha? Isa-isahin natin, di ba? Isa-isahin natin. Letter D, non-arousable. Positive ba yan? Hindi, di ba? Hindi. Parang hindi nag-ano itong mga ito. Hindi. So, hindi nakasama ang letter D. Kasi hindi positive ang non-arousable. Di ba? Ayusin nyo. Oh. Letter C, arousable siya, pero meron siyang marked bradycardia. And yung BP niya ay below the minimum normal level of 90/60. 86/54, marked bradycardia. Normal ba yan? Hindi, guys. Hindi yan normal, guys. So, wag niyo isagot yung letter C, okay? Sheesh, parang... So, letter B, non-arousable. Non-arousable na naman, di ba? Hindi siya gising. So, possible, so normal ba yun? Di ba? Hindi na. So, hindi siya yung answer na ideal, na desired answer to say na normal na yung patient. So the signs that would indicate that the procedure was successful is letter A. He is arousable, normal yung rhythm ng puso niya, blood pressure niya within normal levels 10, within 90/60 and 120/80. So A is the best answer, okay? Yes, aroused. By aroused po, ibig sabihin, kapag ginano nyo iba yung aroused, okay? So, proceed tayo. Yun yung kapag, syempre, kapag, iba po. Parang, kaya pa natin mag-grocery, guys. Medyo iba yung ano neto, So, iba tayo patungo, Number 46. Patapos na. Nurse study is preparing to insert NG tube for patient ward. To determine the accurate measurement of the length of the tube to be inserted, nurse study should take which action? This is letter C. So this is universal. This is the standard, di ba? Kunin niyo yung tali, tapos, tip of the nose, tip ng tenga, papunta sa ciphered process. Okay? So it's letter C. 46 is letter C. 47. Nurse study is assessing the correct placement of patient ward's NG tube. Nurse study aspirates the stomach contents, checks the gastric pH, and knows a pH of 7.35. Based on this information, which action should the nurse take at this time? Guys, di ba ang pH dapat ng tiyan ay acidic. So, dapat nasa bandang 3 siya, di ba? What's NEX, guys? Uy, si Ma'am Celine, siguro mas ma-appreciate ko yan kung may 500 pesos. 500 pesos Gcash. Okay, so, di ba, kapag kinuha natin yung pH, gastric pH, it should be sa bandang 3. Ganon. Kasi acidic siya in nature. So, kapag 7.35, ibig sabihin na misplaced na yung tubo. So, matik, i-check mo na agad kung nasa tiyan pa ba yung tubo. And the best way, the golden standard to check for correct placement of NG tubes would be always letter D. Will always be radiographs. Yes, it's X-ray. So, it's letter D, diba? So, the best answer natin 47 is letter D po. Okay, guess natin yun, guys. Gold standard ang radiographs. So, we answer letter D. Number 48. Excuse me. When nurse steady turn patient more to his side, the chest tube accidentally disconnects from the water seal chamber. Which initial action should nurse steady do? Diba? Pag naalis siya sa may water seal chamber, the most appropriate answer would be letter B. Palitan mo yung water seal chamber ng bottle ng sterile water. So, pasok mo na yung tubo doon. Excuse me. Pasok mo yung tubo doon para yun yung magsisilbing water seal chamber para, yes, na ilalabas yung hangin mula sa lungs pero hindi nakakapasok yung hangin mula sa labas. Kasi, meron yung tubig na harang. Okay? So, 48 is letter D. Okay, 49 tayo, guys. 49, tapusin muna natin yung 49 bago tayo mag-break, okay? Break ng 3 oras. 49, nurse steady is preparing to, diba, magkwentuhan tayo, guys. Ano yung mga aspiration nyo sa buhay? Gusto nyo ba talaga mag-nurses? So i-type nyo sa comment section, mga 3 paragraphs isa-isa. Basahin natin lahat. 206 participants, okay? So number 49, nurse steady is preparing to administer medication using patient Morse nasogastric tube. Which actions should nurse steady perform before administering the medication? The answer here is letter A, B, C, N. Bakit mali yung letter D? Mag-administer ka ng medication sa NGT. Bakit mo pa ililipat sa kabilang ilong? Diba? Ay, diba? Parang tuloy-tuloy na. Kung nasa ilong na, doon mo na i-administer, diba? Letter A, check the residual volume. Of course, i-check mo muna. Kung nasa gastric area pa nga ba yung tubo. As per the stomach contents, this is one way of making sure then na nasa tiyan pa nga yung tubo. See, turn off the suction. Yes, we should turn off the suction kapag mag-i-introduce ka ng medication kasi bigyan mo naman yung time, yung katawan ng pasyente to metabolize, ano bang term no? Sa pharma? To absorb the medication, di ba? And usually, disconnect mo siya ng mga 30 to 60 minutes para naman ma-absorb ng katawan yung gamot na pinainom mo. Kasi kung naka-on yung suction, edi pagka-insert, lumabas din, di ba? Edi lumabas din yung gamot, edi wala rin, hindi rin nakuha yung side effects ng gamot. Okay? So, letter E naman, test the stomach contents for a pH indicating acidity. Yan, tama. Yes, tama. Di ba nga? Acidic in nature ang ating tiyan. So, kung acidic yung lumabas sa pH natin, tama na, Miss Maya, hindi ako uto-uto unless may 2,000 po. 0928. Okay? So, best answers are options A, B, C, and E, or letter A. Diba? 49 is letter A. And lastly, guys, asa na yung mga aspiration nyo sa buhay? Diba? Saan nyo na? Ito naman, parang ayaw mag-share ng mga ito sa buhay. End na natin? Sige. End na natin ngayon, guys. Huwag na natin tapusin. Goodbye. Thank you for... Okay, so, siya po nakadito Baguio, label kita dyan. Nasa Baguio ako, Miss Abigail. Nasa Baguio po ako ay. Okay po. So, proceed na tayo sa number 50. Mine sa isang student dito. Ay, pa, hindi mo kaya. Sir, in your own words, sir, masagot pag okay. So, number 50. Tapusin muna natin bago tayo mapagchismisan, di ba? Tapusin natin para may time tayo magchismisan. Number 50, in another patient, nurse steady is preparing to administer medication through the nasogastric tube that is connected to suction. To administer the medication, nurse steady should, kasi sabi ko lang kanina, if the suction or if the NG tube has suction, i-clamp mo muna yung suction, di ba? I-off mo muna yung suction for 30 to 60 minutes para nga ma-absorb ng katawan yung medication. A is wrong, hindi mo siya isusupain kasi mas magkakaroon ng increased risk for aspiration. B is wrong as well kasi nga, bakit mo siya i-aspirate after mo magbigay ng medication? Di nilabas mo rin yung gamot nang hindi pa na-absorb ng tiyan, di ba? Ng katawan. Di bali wala rin. Counterproductive. So lastly, letter D, change the suction setting to low intermittent. Again, you turn off the suction para nga ma-absorb muna ng katawan. Give the body time to absorb the medication. So the best answer is letters. Okay? So that's all for NP3. Yay! Ako din, sir, nasa Baguio. Malamig ba ngayon dyan, sir? Malamig po kapag gabi at malamig kapag nag-iisa ka. Kapag morning, mainit po. Sir, anong favorite number mo sa electric fan? I'm sorry, naka-aircon kami eh. Sorry po. Ma'am Aliana, Ma'am Aliana, honestly, hindi ko po masasabi, pero mahirap. Definitely, that's mahirap po. Kung 30 days pure aral, mahirap po yun. Pero if I'm not mistaken, meron po kasi iba na review lang ng mga 3 months. Ganun. Pero, Ma'am Aliana, alam natin mahirap, pero that should not restrict you from trying it. Pero kung circumstances are really like that, then still give your best, di ba? At least po, para after ng board exams, walang regrets. Just do your best for now po, ma'am. If kaya nyo po ng pure review 30 days, go po, ma'am. Try nyo po, ma'am. Di ba? As long as binigay nyo po yung best. Skincare routine reveal. Wala po akong skincare. Ang skincare po natin ay katabi reveal. Andito po. Pakilala ko na sa inyo, guys. Wala kasi ako sa bahay, so wala yung mga pusa ko. So ito muna. This is Duro. This is Milo. Sila muna yung katabi ko. Yung may-ari nila, hindi ko alam, nasa labas. So thank you everyone. So yun lang po. So kung wala na kayong katanungan, pwede na kayong kumain. Diba? Ilang hours, kung may mga katanong kayo, isabi nyo lang guys. Tapos tapusin natin. Ma'am Maya, yung review ko lang talaga, mostly yung review ko talaga ay nanggaling sa may top rank ko talaga. Panonood po ng videos. Tinanay ko po magbasa pero hindi ko po na-sustain. So, mga maximum 3 days lang. 3 days tapos mga 3 hours per day yung pagbabasa ko sa books. Hindi siya sustainable for me. So, suggestan niyo po ba ang mag-focus sa mga subjects like guys, ang suggestion ko talaga, you follow the flow of top rank. Diba? Kapag nagkaroon ng final coaching, ganun, yung flow ng final coaching, very helpful naman yun sa akin. Wala naman akong specific na inano. Kung meron man akong hindi matandaan, binabalik-balikan ko, pero hindi yung specific na by system. Ilang buwan ka na po straight hours nag-study. Siguro mga yung last month to last week. Yung last month, hindi pa masyado Pero more on sa last week pala. Last 30 days, tapos last week, doon talaga ako nag-anon. Thank you everyone. I hope kahit na pangalawang beses ko pa lang ito, may natutunan kayo kahit paano. Okay? So, have a nice day, have a nice dinner po sa ating lahat. Thank you po. Kamsahamnida sa imong tanan po. Kamsahamnida. Kamsahamnida. Arigatou gozaimasu. Papasa kayo guys, huwag kayo magalala. Nasa top rank kayo. As long as may perseverance and confidence. Okay? Bye-bye. Arigatou sa inyo. Justi kumuyog. Justi kumuyog kinya yung board exam sa atin. Bye-bye po. Yung mga natulog na po dyan, pwede na po kayong gumising. Salamat po, salamat po. Gising na guys. Matutulog na tayo. Sir, birthday po ni Rizal. Happy birthday po, Ma'am Rizal. Happy birthday po, Ma'am Rizal. Mayroon po ba kayong papansit dyan? Baka naman po. Kung hindi po kaya, send Food Panda. Si Jolly Code na lang. Saan po yung Jolly Code? Jolly Code. Sa likod ng Jollibee? Sir, ayaw ko po mag-left. Sige ma'am. Mag-usap-usap na lang po yung mga matitira dito. Kausapin niyo raw po si Ma'am Alicia. Late night talks pala sa Victory. Okay. Sir, di ko birthday pero okay.
Sa victory. Jolly quote sa victory. Okay, familiar. PNR, sir. PNR? Ano po PNR? Jolly. Nasa Baguio kami. Oh, baka naman. Baka naman po. Happy dinner, everyone. Thank you po. Pabulong. Sikretong malupit. Pwedeng pabulong. Walang bulong, guys. Kasi wala namang may alam ng ano. The best, ano talaga, the best. Amen. Ang best na maggamit nyo sa board exams ay anticipation. Always be ready sa kung ano yung possible na lumabas. Always open your vision sa kung ano yung pwedeng lumabas. Para hindi ka nagugulat sa mismong board exams. Sige. Salamat po. Walang tao sa likod ko. Ay, si Milo yan. Si Milo yan. This is Milo. Nasa labas yung amo neto. Pero makararating. Thank you po. Sir, IG po. Kaya pala may energy. Ito po guys. Kung may mga tanong kayo guys, you can message me naman sa my private accounts. Clarifications. So mag-message lang kayo na.